We're live.
Good evening and welcome to this meeting of the Boston School Committee. I'm Chairperson Jerry Robinson. We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Because this is a remote meeting, I will ask Ms. Sullivan to please call the roll.
Thank you, Chair. Dr. Alkins,
Present.
Ms. Lopera,
Present.
Ms. Mercer. I believe she'll be joining us a few moments late. Ms. Polanco Garcia,
Present.
Mr. Tran,
Present.
Mr. O'Neill,
Present.
Ms. Robinson.
Present.
Thank you.
Thank you, Ms. Sullivan. Tonight's session is being shared live on Zoom. It will be rebroadcast on Boston City TV and posted on the school committee's webpage and on YouTube. Tonight's meeting documents are posted on the committee's webpage, bostonpublicschools.org/school committee, under the January 12th meeting link. The agenda, presentations, and equity impact statements have been translated in all of the major BPS languages. Any translations that are not ready prior to the start of the meeting will be posted as soon as they are finalized. The committee is pleased to be offering live simultaneous interpretation in Spanish, Haitian Creole, Cabo Verdeano, Cantonese, Mandarin, Vietnamese, and American Sign Language. After the interpreters finish introducing themselves and providing Zoom instructions, we will activate the interpretation icon, the globe, at the bottom of your screen. Please click the icon to select your language preference. Will all of our Spanish interpreters please introduce yourselves and give Zoom instructions in Espanol?
Thank you very much, Madam Chair. Good evening, everyone. School committee members, distinguished guests, Happy New Year to everyone. My name is Juan Bernal. I am the Spanish interpreter whom will be providing consecutive interpretation for school committee member, Spanish-speaking, Ms. Rafaela Polanco Garcia. Muy buenas noches para todos. Mi nombre es Juan Bernal. Soy uno de los intérpretes para español asignado a la reunión de hoy. Voy a proveer el servicio de interpretación consecutiva única y exclusivamente para la miembro del comité escolar, la señora Rafaela Polanco García, mientras los dos intérpretes asignados para proveer simultáneamente interpretación lo van a hacer en sus respectivos canales. Para poder accesar el recurso de la interpretación, busquen el globo redondo que aparece en la parte inferior derecha de sus pantallas, hagan un clic sobre español y lo seleccionan como su idioma de preferencia. De igual manera, aquellas personas que se estén conectando de un iPhone, de una tableta o de un teléfono celular, por favor, busquen los tres puntos que aparecen en la parte superior de la pantalla donde dice Language Interpretation, seleccionen español como su idioma de preferencia. Muchas gracias. Thank you very much. The next interpreter may proceed.
Good evening, ladies and gentlemen. My name is, and Happy New Year to everyone. Muy buenas noches, damas y caballeros, y gracias a todos por estar presentes esta noche. Mi nombre es Randolph Domínguez y voy a ser su intérprete simultáneo. Voy a estar trabajando junto con mi colega Luz. Luz, adelante.
Buenas tardes. Good evening, everybody. Happy New Year. We're happy to be here interpreting for the community and for you all. Buenas tardes. Mi nombre es Luz Barreto. Aquí estaremos haciendo lo mejor posible de nuestra interpretación en español. Gracias. Thank you.
Thank you. Will our Haitian Creole interpreters please introduce yourselves and give Zoom instructions in Haitian Creole?
Thank you, Madam Chair. Hi, everyone. Good evening. My name is Sergio Saint-Hilaire, Haitian Creole interpreter. C'est un plaisir nous gagner après-midi encore, moi-même avec Nadège, pour nous assurer interprétation pour vous. Et nous demander pour prêter attention à tout ça qu'a dit yo, et puis nous là, n'a pas interprété pour tout ça qui dit, n'a interprété yo tout pour. Si vous avez besoin d'entrer dans la conversation, ou apprendre, ou à cliquer dans cet écran, ou à regarder en bas, ou à prendre un globe, ou à cliquer sur lui, et puis ou à entrer, poser des questions, et ou bien dire tout ça, demander si vous avez besoin de dire, si vous pas comprendre pour nous interpréter yo pour vous. Et moi-même, maman travaille là jusqu'à 7 heures, et il a déjà pris de 7 heures à 9h30, et puis moi-même, m'a préparé encore à 9h30 pour moi finir. Et nous comptons pour ne pas l'avoir. Merci beaucoup. Thank you.
Thank you.
Bonsoir tout le monde. Nom c'est Nadia. C'est un réel plaisir pour moi là avec nous à soir. Donc, comme Sergio fait ce dit nous, donc, m'a commencé à interpréter pour nous à partir de 7h jusqu'à 9h30. Mais c'est vrai que nous va porter bon service pour nous à soir. Merci. Good evening, everyone, and I hope everybody is listening to this call. Thank you.
Thank you. Will our Cabo Verdeano interpreters please introduce yourselves and give Zoom instructions in Cabo Verdeano?
Hi, good evening. My name is Armando Monteiro. I'm going to be your Cape Verdean interpreter. Boa noite, meu nome é Armando Monteiro, sabem ser o intérprete de crioulo cabo-verdiano. E para nós seguir, nós também na parte inferior do aparelho, também na globo, tem a opção de escolher qualquer língua que de preferência, neste caso, a crioulo cabo-verdiano. Muito obrigado. Thank you very much.
Thank you.
Good evening. My name is Jose. I'm going to be with Armando tonight for Cape Verdean interpreter. Boa noite. Meu nome é José. Hoje nós estamos com Armando para ajudar nós com aquela sessão de interpreter para a reunião de hoje. Thank you.
Thank you. Will our Cantonese interpreters please introduce yourselves and give Zoom instructions in Cantonese?
Thank you, Madam Chair. Good evening, everyone. I'm Anna. I'm your Cantonese interpreter for the meeting tonight. 大家好，我係 Anna， 我哋嘅廣東話翻譯員。今晚我同 Terry 咧會搭檔，為你哋提供同聲嘅廣東話翻譯。一陣間你哋見到地球嘅時候咧，撳落去揀 Cantonese， 咁就會成功進入咗廣東話翻譯頻道噶啦。如果你係需要咧用手機嘅話咧，撳我3個點，再選擇更多，咁亦都會成功進入咗廣東話翻譯頻道噶啦。新年快樂，大家，陣間見啦，拜拜。Your turn, Terry.
Thank you, Anna. Hi, everyone. My name is Terry. I'll be your Cantonese interpreter. 大家好，我係另外一個廣東話翻譯，我會同 Anna 今晚咧同大家搭檔去翻譯嘅。咁咧，你哋就撳嗰個廣東話嘅頻道。咁我哋一陣見啦。Okay, thank you.
Thank you. Will our Mandarin interpreters please introduce yourselves and give Zoom instructions in Mandarin?
Thank you, Madam Chair. Hi, everyone. Good evening. My name is Wei. Tonight, Tina and I will be your Chinese Mandarin interpreters for the meeting. 大家晚上好，我是您的普通话翻译伟。今天呢，我跟 Tina 会是您的普通话的同声传译。如果您需要这个翻译服务呢，请点击屏幕底部的地球仪，然后选择这个Mandarin 中文这个 Mandarin 选项，进入这个翻译频道就可以听我的翻译。如果你使用的是手机或者是平板电脑的话呢，请发现3个点，找到这3个点之后呢，选择更多然后呢就进入可以听我们的翻译。OK，Tina。
Thank you。各位好，我跟这个李伟会半个小时一换，一会儿我们见啦，祝您今天晚上过得愉快，再见。Thank you, Madam Chair.
Thank you. Will our Vietnamese interpreters please introduce yourselves and give Zoom instructions in Vietnamese?
Hello everyone, my name is Duyên, Vietnamese interpreter. Xin chào quý vị. Vi và Duyên hôm nay sẽ là thông dịch liên tục cho các anh chị. Nếu anh chị cần ngôn ngữ tiếng Việt, xin bấm vào quả cầu chọn ngôn ngữ tiếng Việt thì chúng tôi sẽ cung cấp thông dịch liên tục cho các anh chị. Thank you.
Thank you.
Good evening, everyone. My name is V. I will be your Vietnamese interpreter for this meeting tonight. Kính chào quý vị, tôi và chị Duyên sẽ là thông dịch viên của quý vị ngày hôm nay. Xin quý vị nhớ bấm vào quả cầu để có thể nghe được thông dịch viên dịch lại cho quý vị hiểu. Cảm ơn rất nhiều. Thank you.
Thank you. Will our American Sign Language interpreters please introduce yourselves?
Hello, I'm Sharon Mendes. I have a team. We have Jacqueline and Lou. The three of us will be interpreting in ASL. You'll just stay in the main room and you'll have access to ASL interpreting. Thank you.
Thank you. Thank you all for assisting us this evening, and thank you to all of the BPS staff behind the scenes who also provide support for our virtual meetings to run smoothly. We will now activate the interpretation icon at the bottom of your screen. I'd like to remind everyone to speak at a slower pace to assist our interpreters. Thank you to everyone who signed up this evening for public comment. Sign up for both public comment periods close today at 4:30 p.m. Please make sure that you are signed into Zoom under the name you used to sign up for public comment. You can use the Zoom tools to rename yourself so that committee staff will be able to recognize you when it comes time to call on you. Again, thank you for your cooperation. I'm delighted to introduce the newest member of the Boston School Committee, Dr. Stephen Alkins, who was sworn in this morning. Dr. Alkins serves as the Diversity, Equity, and Inclusion Officer for Turk, a Cambridge-based nonprofit focused on STEM research, education, research evaluation, and professional development. He's also a member of the Rennie Center's Education Policy Fellowship Program. Dr. Elkins is a graduate of Morehouse College and holds both a master's degree and a PhD from Brandeis University. He is also a spoken word and slam poet and resides in Mattapan. Welcome, Dr. Elkins. Would you like to say a few words?
It's been a full day, and I'm thankful to Mayor Wu, to everybody here on the committee for the work that you've done up to this point, and the tireless efforts that lie ahead. And I look forward to collaborating and really striving towards educational equity from now into the future. So let's get to work.
Thank you. Okay, I'd like to invite my fellow members to offer welcoming remarks. Oh, Mr. Tron.
I'm sorry, Member Lopera. I raised my hand after you, but somehow I was called the hat. But anyway, thank you. Welcome, Dr. Atkins. Alkins. I'm sorry, I mispronounced your last name. But welcome aboard. Thank you for volunteering to share the workload with us. I appreciate your, like I have mentioned before, last time to the new, not so new now, committee members. I'm reminding you that this position will require a lot of courage and stamina in facing and confronting different kind of issues that may or may not be in line with your, with your ideas or with your commitment. But if it is in line with the community at large, then we have to go with it. That's how I define myself, given the last time when we fight the fight regarding Boston schools, exam school admission. As the sole Asian member on the board, on the committee, I face a lot of criticism from my Asian community. But, in the final analysis, if you and I both are trained and committed to diversity, to the, you may be from the development side of diversity. I'm from the enforcement side of the diversity for the last 30 years. So I honor it, and sometimes, regardless of what my heart is saying, but it is a democratic process. If the majority is there, then somehow we have to go with it. So I'm appealing to you to take that to heart and apply that to our work ahead. Thank you and welcome.
Thank you, Mr. Tran. Ms. LaPera?
Thank you, Madam Chair. Welcome, Dr. Elkins. It's great to see you again via Zoom, but it's great to see you. I am grateful for you for applying and for engaging in this work, continuing to engage in this work around educational equity. And I look forward to working with you and to really have your perspectives as your academic perspective, your professional perspective, and your lived experience, both as a person of color and also as a father in this community. So thank you for joining us. Looking forward to rolling up my sleeves with you and working together.
Thank you. Mr. ONeal?
Thank you, Madam Chair, and Dr. Elkins. Thank you for your willingness to step up and serve. I'm looking forward to the voice you're going to be bringing to the table from your learned experiences and your career work, particularly in DEIB, or Diversity, Equity, Inclusion, and Belonging, and your work at the Equity Resource Collaborative. So, and also always glad you are filling the shoes of Reverend Gruber, as I said to you on the phone, of being a proud Morehouse grad on the committee. And yes, I know that is a redundant sentence, a proud Morehouse grad, because every Morehouse grad I met is very proud of their university, rightfully so. So delighted to have you join us. Thank you for your willingness to serve, and I look forward to working with you and learning from you.
Thank you, Mr. ONeal. Ms. Polanco Garcia?
Yes. Quiero dar muchas gracias por estar con nosotros en este barco, por unirse con nosotros en estos momentos tan difíciles que estamos viviendo con la pandemia global.
Mr. Elkins, thank you very much. Thank you very much for being part of this trip, of this ship that we are embarking in. Thank you for uniting with us, particular in this particular and difficult moments that we are living right now, considering the pandemic crisis we're living.
Me alegró mucho leer de él que está muy identificado con la inclusión. Es un tema que a mí en lo particular me toca mucho, porque soy la única miembro del comité que no habla un inglés fluido y necesito siempre un intérprete al español, y me alegra sobremanera que piense mucho, he leído sobre él y piensa mucho sobre la inclusión. Eso para mí es importante y para mi comunidad también. Así que de nuevo, bienvenido.
You're very welcome, Mr. Alkins. I have read a lot about you, and particularly regarding inclusion. That is a very important topic for you, considering my particular situation that I am Spanish speaking. I do need an interpreter by my side all the time for the purpose of communicating. Therefore, I do appreciate very much that you are focusing in inclusion, and I have read a lot about you. Thank you for being here with us.
Thank you. Ms. Mercer?
Hello, it's nice to meet you. It's a pleasure for you to take on this role and to have another adult that will aid us young people in amplifying our voices to make sure that we are heard across the district and across the state. So just thank you in general for being here and taking the time out of your days to sit in on these meetings.
Thank you. Well, welcome again, and we look forward to working with you and learning from you in support of our students and families. We are awaiting one additional appointment to the school committee to bring us to our full membership. We look forward to Mayor Wu's appointment in the near future. We'll now move on to the approval of minutes. At this time, I'd like to entertain a motion to approve the minutes of the December 15th, 2021 meeting and the January 3rd, 2022 organizational meeting as presented. Is there a motion?
So moved.
Thank you. Is there a second? Second?
Second.
Thank you. Any discussion or objection to the motion? Ms. Sullivan, will you please call the roll?
Dr. Alkins,
Yes, present.
Ms. Lopera,
Yes.
Ms. Polanco Garcia,
Present.
Mr. Tran,
Yes.
Mr. O'Neill,
Yes.
Ms. Robinson.
Yes.
The minutes are approved unanimously.
Thank you, Ms. Sullivan. We'll now move on to the superintendent's report with a focus on COVID health and safety updates. I present to you our superintendent, Dr. Brenda Cassellius.
Thank you, Madam Chair, and thank you all for being with us this evening. Happy New Year, and what a new year it has been. Who would have thought, 2 years later, we would still be living through this uncertainty and the ever-changing pandemic and the very difficult nature of keeping schools in person. The past 2 weeks have been among the most challenging many of us have experienced. Many of my colleagues near and far, and all professionals in and out of education are feeling the brunt of this new Omicron virus and the spread of the COVID and how it is impacting all of our lives. But we're all in this together and we will get through it together. And I have said time and time again, all hands on deck. And that is what it has been over the past 2 weeks. I have been incredibly proud of my team, and we'll share a little bit more about our efforts at mitigating this latest surge in my superintendent report. Tonight, I have many updates and some highlights to share on our work to keep schools open, to monitor public health trends, and to continue planning for the now and into the future. Before we get to that, I want to take a few moments to memorialize 2 members of the BPS community who were lost too soon. Janet Palmer Owens was an incredible educator. I was saddened to learn of the recent passing of Janet, a native of Boston, graduate of the Boston Public Schools, and longtime leader in our district. While I did not know her, I have heard from so many who loved her that Janet was a champion for students and a fierce advocate for inclusion. She began her career in BPS as a school counselor and later as school leader before joining the central office team as chief academic officer. She led a long and well-documented career in BPS that often drew national attention. Upon her retirement, Janet spent considerable time mentoring and supporting new and aspiring school leaders in her role as a distinguished leader and teaching fellow at the Harvard Graduate School of Education. Many educators across our system were greatly influenced by Janet's leadership, and she is going to be greatly missed. We send our sincerest and deepest sympathies to her family. This new year began with more heartbreak. It's never easy for me to memorialize anyone during my report, but especially difficult when it's a young person. It pains me to acknowledge the passing of Selena Gomez Ramis, a student at Madison Park High School who was senselessly gunned down on January 4th. I've been told by Selena is remembered as joyful, marked by her bubbly personality and her commitment to entrepreneurship. She started her own hair braiding business and had a dream to start her own beauty shop with some family members. I can't even imagine how incredibly devastated her family and friends are. I send sincere condolences to all who knew her, and I hope that you are one day comforted by the light she brought into your lives. I know she will be sorely missed. BPS had our counseling support services on site at Madison Park and other schools that Selena attended in the days after we learned of her passing. I'll now begin my report with a few district highlights and then share a few updates. On Monday, January 3rd, Mayor Wool administered the oath of office to the new and re-elected members of the Boston City Council. Congratulations to at-large councilors Flaherty, Mejia, Louis June, Murphy, and district councilors Edwards, Flynn, Baker, Arroyo, Bach, Braden, Worrell, Lara, and Fernandez Anderson. I'd like to congratulate Senator-elect Lydia Edwards on her win last evening. We're so very proud of all of our city leaders and of Senator-elect Lydia Edwards. I look forward to working with each one of the new city councilors to move Boston forward for our students and families. And I want to thank Mayor Wu for her ongoing support and partnership, especially during these challenging times. I want to quickly echo Chairwoman Robinson's sentiments and those of the school committee members on welcoming school committee member Dr. Stephen Alkins. Dr. Elkins is an accomplished professional and valued community member, but most importantly, Dr. Elkins is an education and equity champion. I want to again thank him for his first meeting tonight, and I also am excited to partner with him and work alongside him and all of the school committee members. I'm now going to share some important updates on behalf of the district. I know that January is an exciting time for a lot of our seniors and their families as they begin to submit applications for their favorite colleges and universities. Early January and February is a typical time for graduating seniors to submit their regular decision applications, and they will be hearing back in March and April. I want to wish each and every one of you the best of luck in your search for college or university that is the perfect fit for you, your skills, and your passions. Boston Public Schools is made up of many talented and brilliant students, and I know that they're going to continue to strive for excellence in everything that they do. All of our educators and staff in Boston Public Schools continue to ensure that every BPS student is academically prepared to succeed after graduation, even in these toughest of times. We also want to support you as you plan to finance your education, so please make sure you fill out the FAFSA or the free application for federal student aid. The deadline is January 15. Please visit bostonpublicschools.com/college for resources and tools for college and career planning, including financial aid information, or you can also check in with your school counselor. For the school year starting in September of 2022, the priority registration period for students entering grades K0, K1, 6, 7, and 9 officially began on January 5th, and it's going to run until January 28th. Priority registration for K2 and all other grades will begin on February 7th. In an effort to keep all of our families and staff safe and to limit exposure to COVID-19, school registration will be completed by appointment or virtual appointments. There are 3 simple steps to follow to create an appointment with one of our welcome centers. BPS Welcome Services is also hosting 2 registration information sessions on January 22nd and again on February 3rd. All of the information for how to register and dial in details for joining one of our upcoming info sessions, as well as recordings of past sessions, can be found on our website with links and translations for families to follow. Please visit bostonpublicschools.org/registration for additional details. I want to acknowledge the upcoming Reverend Dr. Martin Luther King Day, which will be observed this Monday. Dr. King dedicated his life to the pursuit of equality while calling all of us into servant leadership to create a better world for his family and for all of us and the generations to follow. We still benefit from his sacrifice today. Though Dr. Brown is famously known for his time spent in Atlanta, where he attended Morehouse College like Dr. Elkins, and also in Montgomery and Selma. He also spent formative years in Boston. It was here he attended graduate school and met his wife, Coretta. It is important to note that Boston is a city that fosters the prowess of people who became global catalysts for change, fighting for a better tomorrow for all. I hope this is meaningful to someone and all of us. I wanted to be sure to showcase Dr. King with a color picture. Sometimes black and white photos allow our minds to categorize certain people or events as happening so long, but our fight for justice and equality is ever present. It is just as important as it was almost 60 years ago when Dr. King gave his legendary "I Have a Dream" speech, and I will remain important to center equality as the fight through this pandemic. As a reminder, the district will be closed on Monday and there will be no school. Self-care is an important part of life, and I urge you all to take some time to rest and reflect this weekend on the legacy of Dr. Martin Luther King. But I also urge you to look at Monday as a day on instead of a day off. Find a simple way to be of service to someone else. Take out the trash or pick up groceries for your elderly neighbor who may be too fragile to leave the house due to COVID. Call your families and friends and check on them. Send that hardworking teacher or frontline worker, healthcare professional in your life a note of thanks and appreciation. Make a donation to an organization with boots on the ground right here in Boston. As always, if you decide to interact with people, be sure to mask up and practice social distancing measures. You can both be safe and be of service. I'd like to shift now to give a quick update on Mission Hill. The investigation into the serious complaints we've received is ongoing. I have asked the firm we hired to be thorough and to conduct a full investigation and to talk to as many students, family members, and staff as possible. So this is going to take some time. We'll continue to communicate findings of the investigation within a week of its completion. The emergency school review and the investigation together will provide the district with comprehensive information to inform recommendations about next steps. I do understand that the family, staff, the governance board, and the community are very eager for information, and I remain committed to providing updates as soon as I have them. I have asked for a preliminary update so that we can make timely decisions and communicate transparently with our Mission Hill community. I know they are anxious for this information. I also want to provide a brief update on the Charlestown prospectus. We were unable to hold our meeting on January 7th. BPS Chief of Equity and Strategy, Dr. Charles Granson, has been in touch with the prospectus authors about completing the racial equity planning tool. They have shared what they have so far, and they continue to examine and work together with the group. We also discussed the possibility of the prospectus authors presenting at a future community equity roundtable. After further discussion with Dr. Granson, they did not feel they had the data needed to present at that time, and our team could not produce the complex research and analysis that they had requested in time for the meeting. We continue to be in touch with the authors and the school leader and staff as we prepare for next week's meeting and next steps. We will vote on the prospectus next meeting. We also will review the public review and comment that we have had open, and we will review all those comments and have that for a summary as promised. I look forward to the meeting next week. You will hear from the team at the end of my report on all that we are doing to respond to the latest surge in COVID. But I wanted to provide you with more details on a few pieces of critical information. We have ordered thousands more KN95 masks and COVID-19 rapid tests. We are working with the Boston Health Commission and the city's procurement office to get these in the hands of our students and our staff as soon as possible. We've also been in touch with DESE regarding the additional 26 million rapid tests that they purchased and are working with them to determine next steps on when we will be able to receive them and distribute them to our staff. We are planning to provide each student and staff member with rapid tests prior to February vacation, just as we did in winter vacation. We are learning and listening and adjusting as needed and planning ahead so that we can be prepared for our future in case we need to have additional mitigation efforts. As part of the guidance with Boston Health Commission, we made the difficult decision over winter break and into this latest surge to temporarily pause athletics, musical performances, singing, and field trips. As an athlete myself and the mother of athletes, I know how important these experiences are for our students. I've been working closely with the Boston Health Commission to understand CDC guidance and mitigation efforts to stem transmission during a surge in our community positivity rates. Over the past several days, I have heard and read all of your messages, and I understand how important these activities are to our students' health and well-being. I spoke with Dr. Ojakutu and Sanchez today, and just this afternoon, they shared with me that although they remain concerned about COVID spread among our athletes, they also understand the balance we all need to make in order to give our students care and to provide for their overall well-being. So they approved for us to return to practices and small group conditioning on Tuesday, January 17th. And if the numbers begin to decline, we can resume to competition on the 24th. However, all students must consent to twice weekly testing in order to do so. This is a new policy, and we are in the process of securing these tests so that our students may resume their activities. I hope this puts our students and coaches and families at ease, and that we will all continue to place our students' health and safety front and center. As an additional mitigation effort, Mayor Wu announced the City of Boston staff compliance mandate with the new vaccine verification program, which requires city workers to show proof of the first shot of the vaccine by January 15th. We are working with all of our department heads, school leaders, and union partners to ensure our employees comply with the new vaccine policy. We're hosting dozens of vaccine clinics at our schools this week and next. We're also deploying vaccine clinics to our bus yards, central office, and other administrative offices to ensure everyone can get their vaccine. Mayor Wu also announced a temporary remote work schedule for some City of Boston workers, which began on January 4th and will tentatively continue through January 18th as an additional step to mitigate risk and keep our workforce and our communities healthy and safe. As part of that effort, the city temporarily decreased the number of employees in city buildings, including BPS central office. Though most of our central office staff are able to work remotely, many of them were actually deployed to some of our schools that were experiencing staff shortages. I want to give a huge shout out to all of our staff who have been helping out in our schools to continue to lend a helping hand, and they help us ensure that we can continue keeping our students learning in person. Last but certainly not least, I want to thank all of our incredible educators, paraprofessionals, custodians, lunch monitors, cafeteria workers, secretaries, social workers, counselors, school leaders, bus monitors, bus drivers, and all of the support staff in our schools and in central office. I think many of us were hopeful this year would be different, but it has proven to be our most challenging one yet. But we have an amazing team at Boston Public Schools, and I know we're going to get through this, just as we did before. One day at a time, sometimes 1 hour at a time, but we're going to be okay. Team BPS has really rallied over this past week. And I'm so proud of this team. It's been an all hands on deck situation. And I want to thank Chair Robinson for even jumping in at the hail last week when we needed a little extra help in kindergarten. And she just did an amazing job with our youngest learners. I'm going to turn it over now to Dr. Saramar Sanchez to go over the latest COVID-19 surge, and Deputy Superintendent of Academics, Dr. Drew Eckelson, who will share our process for how we are evaluating both of our staffing challenges and our COVID cases in our schools on a daily basis.
Hi, good evening, everyone, and thank you so much for the opportunity to be here. You know, I'm going to start off by going through, you know, contextualizing our recommendations to Boston Public Schools, as well as just our mitigation protocols within the current surge. And so, next slide, please. A brief overview of our metrics, though I'm sure many of you are familiar. We have seen them too much over the past few years, but the ones that I will really focus in on today are looking at our COVID-19 positivity rates, at our emergency department visits, and our hospitalization rates. Next slide. So this first slide highlights the positivity rate over the city of Boston. And, you know, really what has been most astonishing has been over the past week. So as we all know, we've seen our positivity significantly increase to greater than 30%, meaning that over a third of our, or around a third of our tests have been positive for COVID-19 here across the city. And this does not include rapid testing. This is strictly limited to PCR testing. Now, you know, I do want, and so this is one of the markers that we follow very closely when we think about our community transmission rates, and when we think about how that impacts the strategies and recommendations that we offer to mitigate COVID-19. Next slide, please. Now, importantly, as a city, we also look to our healthcare metrics. And so the current slide highlights the emergency department visits. And again, we note the significant increase since mid-December of emergency department visits due to COVID-19. Now, something to note is that oftentimes, you know, we look to our healthcare partners to better understand how this translates into understanding severity of COVID-19. As an example, we often know that people can present to an emergency department for testing, especially when testing resources are limited, as we all know has happened over the past few weeks. And so, you know, there is some limit as to how to interpret these metrics, but needless to say, our healthcare systems are feeling the strain. Next slide, please. And finally, this last slide highlights our number of adult hospitalizations due to COVID-19 across the city. And what we have seen is a similar trend to last winter surge, where our numbers have significantly, you know, increased over the past weeks. Now, to contextualize, this is nowhere near the amount of hospitalizations that we saw with our first surge. You know, back in March 2020, at that time, it was almost triple the hospitalizations. But again, you know, I can only emphasize that our healthcare systems are really feeling the strain. Now, that all of this being said, you know, I do, you know, we have looked over the past year to our Boston wastewater data to really think about as a predictive source for COVID-19 transmission in coming weeks. And reassuringly, we have seen over the past days that the levels, this measures the levels of COVID-19 present in wastewater. And, you know, those have started to peak and come down. So that does offer a glimmer of hope that perhaps we are seeing and experiencing a current plateau in cases. This has also been supported by our latest case data that show that the number of cases per day has started to plateau. And so there is a glimmer of hope. You know, that being said, we still do not know how much that peak down will take in terms of days or weeks. And so we will keep to that. And I can assure you that we will look at this very closely as we think again about the context of our recommendations to BPS and other agencies. Next slide, please. And so again, the guidance that we have offered at this time is really centered around surge recommendations, you know, really highlighting that we want to protect in-person instruction, and that at times of high community transmission that often involves measures such as cohorting, such as limiting visitors, and really thinking about higher risk activities, as Dr. Casilius mentioned, and really taking measures around those because of the risk that is counseled by the CDC and what we know from emerging data. And so, as I mentioned, we obviously look forward to reevaluating these recommendations as community transmission rates come down. And we have also offered guidance around, how to implement these activities, with recommendations around testing, recognizing that this is hard, right? And that, all of these recommendations have an impact on on the health of our students. And that, this is really a risk benefit balance as we think about the safety of our children in schools and their health. Next slide, please. And so part of what we have been weighing very closely, again, in alignment with the most recent data, is our isolation guidance. So as the city, when I and others at the city have turned to the latest evidence that we have on viral transmission, when we think about how this guidance also applies to our schools, a few thoughts have emerged that I would like to share with you because they really underlie the rationale for what we recommend. So CDC last week came out with guidance around discontinuation of isolation at the 5-day mark, and then also released optional guidance around testing. Part of what this guidance around duration of isolation, around the shortened duration of isolation to 5 days highlights is that in order to be able to exit isolation, individuals are strongly advised to avoid unmasking around other individuals, meaning that they should, really interact with others with their mask on. And oftentimes this involves limiting their interactions at gyms, involves limiting travel, and because there is a risk of residual transmission, and that is what we have weighed in our recommendation. Really highlighting that we really should think about negative testing when people are leaving isolation after 5 days, and thinking more about 7 days as perhaps a threshold that we believe has a lower residual risk of transmission. And part of this is because we recognize that in our schools, especially when it comes to students, here is the guidance for staff. But when we think especially around students, we know that they are around, they eat around other children. Oftentimes we know that there are complexities around masking when it comes to our children with special needs. And so, a critical part of what we as local public health specialists are responsible for and in alignment with school leadership is really trying to figure out how this guidance applies to our school. And so that is some of the rationale and some of the issues that we have really carefully considered. And so we have offered recommendations around staff. The difference between vaccination status comes from some, again, limited in data to support that there might be reduced viral shedding, duration of viral shedding in vaccinated versus unvaccinated individuals. And so that sort of underscores this guidance around, staff returning after 7 days if they're unvaccinated, and after 5 days if they are fully vaccinated. And again, the recommendation around a negative rapid test. Next slide, please. And then, really thinking about the multi-pronged approach, doubling down on our mitigation strategies. A key part of this has been, significant preparedness as to our personal protective equipment, meaning, we have to give our students and our staff our best shot at protecting themselves in schools, and recognizing that with such high rates of community transmission that I outlined, we really need to be thoughtful around providing high quality masks and PPE. And so we at the city have created surge PPE guidance, and I have made parallel recommendations up to BPS based on to align with our city recommendations. And first and foremost, really being that at this time of high community transmission, we really want to move away or sort of, from cloth masks that do offer protection, but that has always been, but that we need additional protection. And so we have recommended the use of surgical masks, ideally among students, and then thinking about about masks for staff, depending on their level of contact with students. And In addition to that, we have really advocated for increased availability of testing, rapid testing, as well as around the fact that in order to really keep our kids safely in school, especially as we face staffing shortages that include oftentimes sort of contact tracing.
We cannot hear anything. You've gone mute.
And Madam Chair, I believe she went on mute.
The nation is our way out of this. And so we have worked to strategically coordinate vaccine clinics across our neighborhoods, across our BPS schools. And so I thank everyone at BPS leadership for their outstanding efforts here. And finally, we continue to collaborate very closely with your leadership and with DESE when it really comes to evaluating our cases and reviewing, emerging or concerning trends. And so we really, again, we remain committed to keeping our kids safe, our children safely in school, to protecting our staff. And I am grateful to the BPS leadership as well for really their outstanding commitment to this. And so I think that might be my last slide, but next slide, just in case. Okay, yes, thank you.
I first wanted to thank Dr. Sanchez for her amazing leadership. She has offered significant value to our team and to our processes, and it's noted every single day. So thank you to Dr. Sanchez. I also want to thank the superintendent for her leadership and support, as well as to the entire Boston Public School team, our central office, our school leaders, our educators, all of our staff across the system, and our families, and also the public health officials, including Dr. Sanchez and others who partner with us each and every day. I'll be transparent and honest, the last 2 weeks have been some of the toughest of my career. And I also come to work each and every day inspired by the quality of the team and the work that we're doing to move the system forward under really difficult and complex situation. I wanted to begin by talking a little bit about the process that we're going through each and every day to make informed, evidence-based decisions. So the slide in front of you right now is a flow chart that we're using to help inform day-to-day decisions. And there are 3 things that we're looking at in this chart. The first is on the left side of the flow chart, which is the public health information that Dr. Sanchez and her colleagues lead and that she was talking about in her presentation. I'll walk through the decision-making process quickly on that side. And then on the right side of the chart, we're talking about both the operational issues that we need to resolve, as well as the staffing issues that are part of the constraints or the barriers that our schools face every day. So Dr. Sanchez and her team are meeting multiple times a day and have very recently invited members of the academics team into those meetings so that, one, we can support with information about what's happening on the ground, as well as help double back with communication to our schools division, our school superintendents, and most importantly to our school leaders and educators at specific schools. So they meet to review data, specifically data that emerges from pool testing and test and stay program, and then make some determinations about whether or not there's a concern at a specific school based on their analysis of the data. If they find that there is a concern, they then prompt a meeting with the school leader, the school superintendent, and potentially other educators at the school to review the data and discuss next steps. They might make a decision, as we have in the past, to either quarantine a school, quarantine a grade level, or a cluster of classrooms, or a specific classroom. And if they do that, we have developed a play-by-play to help support our school leaders to work through that process. If they decide that there is not a reason at that specific moment to quarantine a classroom, a cluster of classrooms, or a school, it doesn't mean that there isn't a concern. We have to look at some of the other factors that must be considered, most specifically the operational and staffing issues. At this point, there are 3 data points that we're looking at. 1, what is the student staff ratio? 2, what is the test and stay capacity of the school? At some point, the test and stay capacity might become so large that it almost becomes not feasible or impossible to accomplish over the course of a short period of time. Or 3, that the interventions that are required might interrupt learning. So for example, in some classrooms, a teacher might be required to wear full PPE regalia, including things like face shields, masks, aprons, gloves, and those types of things, gowns. Those things might be impossible to implement, particularly in a room, given the nature of some students' disabilities. So we decide if it's necessary, based on our analysis of those factors in meetings that I'll explain in a moment, about whether or not we need to quarantine a classroom, a cluster of classrooms, or a potential school. And then we follow the same flow chart using the processes and tools and resources that we've developed to support schools and school leaders. Next slide, please. Our day begins each morning, if not before, at 7 a.m., where we meet each morning, and we're talking about the start of school. We're looking to see if any new specific school needs emerged in the evening after our last meeting, which ended at 9 o'clock. And we continue to deploy resources and supports to schools based on any new information that emerged from the evening. Over the course of the morning, we ask school leaders to report significant number of information by midday that tells us where they're anticipating vacancies. And as the course of the day, sort of the morning is moving on, that data is monitored as it's submitted. At midday, we do another check-in, and we continue in a systematic way to review the data and begin to prepare for our 4:30 meeting, where we actually deploy central office staff to schools in a strategic and thoughtful way to ensure that our school leaders and our educators have as much central office support. On average, we've been deploying upwards of 70 to 80 people per day out to schools to support the staffing needs on the ground. And then we end each day at 9 p.m. Where we continue to monitor data that's coming in and make final decisions on any additional deployment and assignment of staff to schools. Next slide, please. This gives you some important data that we're seeing around some of our staffing needs, around student attendance, around COVID positive cases that have been reported, as well as transportation. We're looking at this information each day. We're trying to be as strategic and thoughtful as possible and using this data to inform both at a system level and a school-based level about where we need to deploy our resources. Specifically, and I'll sort of dive into this in a moment, one pattern that we're looking for is areas where we might see high levels of staff absences and an increasing number of students returning. That is something where we know we need to ensure a significant number of staff to support those schools and those school leaders. Next slide, please. This is a screenshot of the Google form that our principals are completing each day. It's giving us good information about where their anticipated teacher vacancies are. There are opportunities for school principals to put notes in there. We're tracking not only absences for teachers and paraprofessionals, we're also tracking absences from lunch monitors, custodians, school nurses, so that we can be as strategic and thoughtful as possible in support of our schools. We're obviously also tracking that and aligning it with daily student attendance and looking at daily reports of COVID cases, as well as other factors like the opportunity index of each of the schools that's reported in this document. Next slide, please. This is an infographic that we look at every morning and throughout the day. It represents every school in the BPS that has reported information on our tracking system. And we're looking at 2 factors here. What is the absenteeism rate at the school level? And is that absenteeism rate getting better, or is it getting worse? You can see on this graphic from January 10th to January 12th, we saw a slight improvement in terms of more staff returning back to school, which is a good sign and consistent with what Dr. Sanchez reported earlier. And just for context, we showed you one specific school on here. You can see the Curly identified their blue dot on January 10th and January 12th. You can see that school has roughly moved northeast, which means that they're moving more closer to the sort of low absenteeism and low improving rate. We're hoping that the schools will be clustered in that circle that you see right above the sort of line across the median. And that is the trend that we're looking for as we're moving forward in the next few days. Next slide, please. In order to sort of dig in further to really deeply understand the data, we have had individual calls with about 50 school principals, particularly based on the previous slide, where we noticed patterns and trends that were concerning to us about their staffing needs. In those calls, we went through the entire roster of every single school with whom we spoke. And during that conversation, we had an explicit talk about each employee at that school, whether they were in school or out of school, and if they were out of school, when they were expected to return. This gave us good information for each specific school for which we had concern about when staff were expected back, which allowed us to be as strategic as possible about assigning staff consistent with the needs of school, and then also having a good sense of when staff would be returning so that we could potentially redeploy staff to new schools that were experiencing surges that were of concern to us. Next slide, please. Here is a graph that's looking at COVID cases for both students and staff. Here we're seeing a slight decrease in staff cases over the last few days. It should also not be surprising that student cases are highest on days that school is in session, likely given pool testing and the test and stay program. And I think it's very important that we note that we're very confident that this data is almost certainly an underreport of the actual numbers of cases, because many of the at-home rapid cases might not be included in this data set. Next slide, please. We wanted to just communicate explicitly to our community about ways that we're supporting students who might be quarantined because of a COVID-19 positive test. First, we want to acknowledge and thank our BTU members who are expected to provide daily relevant coursework on their school's digital platform so that all students who are absent can access the work that's happening over the course of that school day. In our classrooms for our youngest learners in K0 to grade 2, we are providing daily ELA and math instruction, 75 minutes of ELA tutoring and 75 minutes of math tutoring each day during the period of quarantine. We're currently serving over 350 students, and that number has been growing over the last few days. And students are sent home or have been provided with learning kits to support them during this time. And given the increase of students who needed access to this tutoring, we have redeployed several of our early childhood team members to open additional section of tutoring for both ELA and math. It's been very important to us that that tutoring matches the scope and sequence of the district so that students are roughly getting content that should be familiar with what they were previously learning and what they will learn when they go back to school. In addition, across the K-12, we're providing a one-on-one 24/7 tutoring option for students through our partnership with Paper. Thus far, over 2,000 students have participated in a tutoring session with a specific Paper tutor, and over 500 students have leveraged this resource to get feedback on their essays. We've also, to be transparent with the community, We began to prepare in the event that we need to offer a remote option across a classroom, across a cluster of classrooms or a school, leveraging our experiences from examples like the Curly and the Umana. We've created a play-by-play document, which includes some of the following materials that our school principals and school leaders and school communities would have available to them. Outlining clear expectations for remote learning, including, most importantly, access to all instructional materials that students would have, and then delivery of all required services for our multilingual learners and for our students with disabilities. The play-by-play also includes instructional supports, including examples of common schedules, materials for Google Classroom or Seesaw that have been curated by our exemplary educators, and ensuring grade level coaching, particularly for our newest educators who might not have the experience of providing remote learning in the past. And then finally, that play-by-play includes stakeholder communication, including pre-written communications for a foundation for a school leader, but to potentially consider for his, her, or their community, ways that families can access meals during the time of quarantine, an FAQ document for our school leaders and for our school communities, as well as a commitment for an information session for families and staff with members of the Boston Public Schools, as well as members of the Boston Public Health Commission, so that they can get their questions answered, both about public health and also about academics and instruction. Next slide, please. Finally, I just want to thank the communications team led by Jonathan Palumbo for the work that they are doing to keep our community updated, particularly during this time of the surge. It has been exhausting for everyone, but the communications have been exemplary, and I want to thank them for their work. You can see on this slide the types of examples of family updates that have been provided during the surge over the last few weeks, in terms of the numbers of text messages, emails, newsletters, and robot calls, et cetera, as well as the community updates that have been provided. Finally, we continue to provide regular communication of positive COVID-19 cases, including classroom notification forms, close contact outreach, school-wide communication, and all of our data has been publicly displayed on a public dashboard, which is linked in this presentation. I want to turn it over to Superintendent Casilius and thank her for her tremendous leadership during this specific difficult time.
Thank you, Dr. Eccleston. Thank you, Dr. Sanchez, and the entire team for pulling together. Like I said earlier, I have been so proud of this team, not only just this past week or 2 weeks, but really throughout this past 2 years. We're working on fumes these days, but they must be the hydrogen kind, I think, because everyone's got a lot of energy. So I'm happy to take your questions, Chairwoman Robinson and committee members.
Thank you, Superintendent, for that report, and thank you to Dr. Sanchez for joining us this evening. I'll now open it up to questions and discussions from the committee. I'd like to remind my colleagues about our agreed upon norm that each member will have about 5 minutes. That's 1 to 2 questions. And I want to remind the BPS staff also to be brief with your responses. If you have any additional questions, I'll come back around and I'll come back and do a second round. If you have a question, please raise your hand virtually. Put the request in the chat. Ms. LaPera, excuse me, sorry. Ms. Polanco Garcia, saw your hand first.
Gracias, señora Presidente Robinson.
Thank you very much, Madam President, Ms. Robinson.
Quiero darle las gracias a la superintendente y a su equipo por la presentación del informe en la noche de hoy.
I'd like to say thank you very much to the superintendent and to her team for the presentation delivered today.
Hay algo que me preocupa mucho y he tenido mucho el contacto con algunas familias y es con relación a la asistencia de los niños a la escuela.
There is something that is very concerning to me. That is the fact that the kids are missing school. It is very concerning to me. And that's something that I've been talking to different families about.
Estuve leyendo sobre la póliza de asistencia que tenemos en el distrito y pude ver que después de 18 ausencias se considera ausencias crónicas para los niños.
I had the opportunity to read about it, to embed myself in the different policies that are regarding that talk about the missing school. And it is my understanding that after missing school for more than 18 times, it is considered actually chronic absenteeism.
Y nosotros hemos visto, ¿verdad?, que por la pandemia, por el Omicron, las variantes que existen, muchos niños, muchas familias no quieren enviar a sus niños a la escuela, sobre todo muchos si están enfermos, otros porque han dado positivo a COVID. Entonces, aun cuanto estos niños ya tienen excusa, esas faltas están incluidas dentro de las 18 faltas para tener una falta crónica.
So you have to consider as well that there are many different factors that are related to the pandemic itself, to Omicron, to different variants that are circulating in the community. We have to understand that even though this sickness and these absences are included in this as part of this 18 absences or that are considered as chronic absenteeism.
Algunas de estas familias me han contactado personalmente porque han recibido llamadas diciendo que si los niños no van a la escuela, van a ser sometidos a la corte.
Especially some of the families had contacted me via telephone, and they had told me that in the event that the kids refuse or do not go to school, that could be a court issue, or they could be sent to court for that matter.
Entonces, en estos tiempos difíciles, ¿verdad? En este tiempo donde no hay respuestas que vayan a resolver la situación en estos momentos, sí yo pienso que debemos iniciar conversaciones para ver si pudiéramos nosotros pensar en una posible modificación a lo que es la póliza de asistencia de los niños, porque en estos momentos muchas familias que no quieren mandar a sus niños por la estructura de la escuela, porque no se sienten seguros, porque los niños no están bien. Entonces, yo pienso que tenemos que tomarlo muy en cuenta.
We have to consider different aspects. We are living different and very difficult times. There are no responses or answers to everything. We have to be cognizant of that. So be this the time that we have to engage in a conversation, perhaps to try to modify some of the absentees, the absence policies that exist at this moment, considering the fact that the families are very reluctant to send in the kids to school. And this is a structural problem where that is causing a lot of concerns to the families. So it is time to revise these policies, providing everything that I had explained.
Y tenemos familias que no tienen documentos, y cuando reciben una llamada y le dicen, si no presentas tu niño a la escuela, te vamos a someter a la corte, la familia con miedo envía a sus niños a la escuela, porque todo lo que tenga que ver con corte, al no tener documentos legales para estar en el país, lo asusta, y esto es un problema muy serio para nuestra familia.
It is a very difficult problem. The problems at that time, we have to understand that we're dealing with many of the families are undocumented. And whenever they get a call from school saying that the kids have to go to school, otherwise else confront court or the possibility of court, they are very fearful about this. Fear is being instilled, and they end up sending the kids to school for that matter, for that fear that exists of being undocumented.
Quiero llevar esto a ustedes para que pensemos, iniciemos conversaciones a ver cómo podemos hacer con esta situación.
I would like to bring this to your attention for the purpose of initiating different conversations and to look for different options regarding this matter that is very concerning.
Well, thank you, Ms. Polanco Garcia. We have really looked closely at our attendance policies over the past couple of years. Fortunately, this evening, we're joined by Brian Marks. because he's going to be giving us an update on our work at the homelessness. But he also has done a lot of work around attendance. I'd like for him to describe to you the state's allowance around constructively present for COVID, as well as how we're following up now on the 18-day rule. So Brian, if you might update the school committee.
Sure. Thank you, Dr. Casillas, and thank you, Ms. Polanco Garcia, for this question. I think you're exactly right. It's so important that we're being sensitive to the current circumstances around the pandemic when we're working on our attendance challenges that we might have across the district, and taking into consideration all of the factors that are impacting whether students are going to school every day. The state does allow us to mark students constructively present, which means they're considered present for the school day if they are in quarantine and they're participating in remote tutoring or using the paper platform that Dr. Eckelson described earlier. As well, we've modified our home and hospital instruction program so that students who are high risk and vulnerable to COVID-19, as determined by their primary care physician, are able to participate in remote instruction, which is also allowable by the Department of Elementary and Secondary Education. As Dr. Casillas mentioned, we've revised our attendance policy to really focus on relationship building, outreach, communication, and support to students and families to help provide the resources to overcome barriers to consistent attendance, but also have open lines of communication. As it relates to any threat of the case being filed with truancy court, students who are out of school because they're quarantining or they've been a close contact, that would be considered an excused absence. So that would never be taken into account when considering the need to file with court. But we have put protocols into place that require consistent intervention and outreach, and filing a truancy case with the Suffolk County Juvenile Court should be the absolute last resort. And schools must demonstrate that they have conducted extensive outreach and communication and worked with the family to try to overcome attendance challenges. And certainly our team and staff from the central office are working with schools and providing additional support as well. And again, our focus is on providing support, relationship building, engagement with students and families, keeping open lines of communication. And we've really worked to remove the punitive elements from our attendance policy.
Thank you, Brian.
Thank you. Ms. LaPera.
Thank you, Chairwoman Robinson. First, I just have an immense amount of gratitude for the amount of work that's been put into continuing to be able to serve our students and families. So thank you to everyone, from the folks feeding my own children to those teaching and keeping them smiling behind their masks. Thank you for all of that work. It's always a lot, and right now it definitely seems impossible. I do have a couple of questions. First, I also wanted to just commend the district and the city's action in looking to provide additional and adequate resources in terms of PPE for masks for not only staff, but also students amongst the surge. So just a thank you on that. I know my son has come home reporting on students are wearing the same mask. There is this happening in my classroom. I have a little inside informant on what's going on. One of the things that I have also been hearing, and not just from my child, but also from other community members, is that some of the quarantine protocols, particularly around test and stay protocols outlined by DESE and the contracted vendor, don't always include testing close contacts, be it students or staff that are considered fully vaccinated. And so I know that there was mention around additional city and district investment to expand testing. And I would like to know if for that testing, we are looking to provide testing to all students or staff who are considered close contacts, regardless of their vaccination status. And so I wanted to get an answer on that.
Well, thank you, Ms. LaPera. We have a request in with DESE around new policy. I'd like for Dr. Sanchez or Deputy DePina, I think Dr. Sanchez is still on with us, describe what we have asked of DESE.
Sure. And, you know, we have submitted a formal request to DESE, really highlighting a few key points. One, the increased transmission rates that we are seeing around the Omicron variant and the current surge, as well as the operational realities in schools on the ground with, you know, our staffing limitations that were outlined. And a part of that strategy has really, you know, based on a transmission rate, as I outlined, a positivity rate of 31%, meaning that at this point, you know, we are seeing significant rates of COVID infection, both in unvaccinated and vaccinated individuals. Although we know the vaccine offers significant protection against severe disease, we have put forward a proposal to request twice weekly surveillance testing for both vaccinated and unvaccinated students and staff, really recognizing again sort of the current circumstances and really hearing the concerns that, you know, that you all outline appropriately in the setting of this surge. And so that has been what we have proposed, and we are still awaiting a formal response, but, you know, really advocating to the need for our protocols to match our current reality and sort of the emerging nature of the current situation. And so I think I'll pause there, Dr. Casillas, if there's anything else that you want to add, but we hear you.
So my follow-up to that, sorry, Dr. Casillas,
No,
just
go ahead.
as a follow-up to that is, are we bound to wait for DESE to engage in additional mitigation strategies, right? Like, because we've talked about increasing testing, does that have to go through DESE, or are those investments that we can be making on our own, knowing that this is what our community, one, needs, and two, is asking for?
So I'm happy, sorry, Dr. Casillas, I can also, you know, our in communicating with our colleagues, I think a piece of these portions of our testing programs have been supported by DESE in terms of staffing and resources. And so that has been a part of why this request has formally gone through DESE. That being said, I do want to transition to Dr. Casillas and others who I know have been working diligently to really look at alternatives, given that these are options that we want to push forward. And so, Dr. Casillas, I'll let you chime in.
So I do think that changes are on the way. You know, we're hoping to be able to do more frequent testing, different types of testing. For instance, the Biden administration today announced the 10 million tests that they hope to get out to families. And so I anticipate in the next couple of days getting some further guidance from DESE. We wouldn't want to get ahead of that. We contemplated doing it on our own, you know, as you know, they don't allow opt-out. Dr. Ojokutu has been vocal about us not having the opt-out provision. As you know, we have about 30,000 students who have opted into our consent pool testing, and about 2,000 who have actively opted out. That means we have about 18,000 who have never responded to texts and to calls and emails to try to get them to opt into our consent pool. And we have thought about things like, well, could DESE do the consent and absorb that liability? We could absorb the liability for opt-out for the others if we could get the tests. As you know, there is a shortage of tests right now. And so changing any kind of protocol, I think, would have been challenging operationally, and it may have put at risk the continuation of the DESE CIC pool testing that we had been really working to perfect. We pay for stipends now at school level for coordinators there to help organize and make sure that the pool testing and the tests are ordered and that they're in contact with a CIC health professional who comes in to our schools at every single school. And so we didn't want to interrupt that during the surge time and change, kind of flip around and create more challenge for our school leaders in managing something that would be brand new, for instance. And so we've decided to stick out what we're doing now. It seems to be working much better than it was. And I think that with DESE, I anticipate coming out with some further guidance over the next several days around the Biden administration testing program, as well as what the DESE is going to be doing to ease up some of the burden that has been on school districts.
Thank you. I appreciate that context and perspective. I have more questions, but I'll wait for the next go round. Thank you.
And you are right, Ms. LaPera, that we have instructed our principals to provide the medical surgical masks to our students. We have about 700,000 masks for grades K0 to grade 2, the little ones, and then above grade 2, the larger sized adult masks available. We're not requiring it. Masks are still the choice of the person wearing it because of comfortability for students. And they're able to do that, or they can also put their mask over and double mask if they'd like, or they can wear just their own mask that they bring from home.
Thank you. Ms. Mercer?
Thank you for the report and the resources that BPS is giving to students and families for when they have to quarantine, especially preparing for when and if students have to do remote learning. So my question is, how exactly are students able to access food when they are quarantining?
Deputy DePina, do you have
Sure, yes.
information about our food service and how students are able to access food service when they're quarantining?
Sure, yeah. So right now, what we want to do is make sure that we have information on when a student is anticipated to go out or is going out. And students can, and families and or family member can come pick up food at the school, and we'll make it available to them. However, unfortunately, we're not able to do any deliveries to families because of the sheer volume of students and the capacity to do so centrally. As folks recall, we were able to stand up some door-to-door delivery options for our high priority students. We were able to successfully do that, but that stretched our limit out to those particular students. And right now, we currently don't have the capacity of bandwidth to do that. But students and families can contact their schools, and we can make food available from the school directly.
So my question is, how exactly would that work? Would that be them getting boxes put into their trunks? Would that mean them having to physically go inside the building? What does that exactly entail?
Yeah, basically, it would require us coordinating with a family member that can come to the school, and we can work on figuring out how best to package it and get it to that family member and to bring it home. But I'm happy to talk more offline about it if you need to as well.
Thank you.
Deputy Pina, I just want to add one thing here. We've been working also with the city's Office of Food Access. They have flagged some families that are in quarantine as well, and we have problem solved, not only with our BPS colleagues here, but really with all the city resources as well. So, if a family reaches out and they are in quarantine, we will help them get food if need be.
Yeah, and we designated like the hours of 3 to 5 p.m. at schools for this particular purpose. So it's after school hours, less people in the building. So we have a process for that I can talk about in more detail.
Thank you.
Thank you. Others, Mr. Tran?
No question at this time. Thanks.
Thank you. Any other questions? Ms. LaPera, okay, I'll go to Mr. ONeal and then come back to Ms. LaPera.
I just want to say, first of all, echoing what Ms. LaPera said, incredible thanks to the superintendent, all of our senior team, our school leaders, our teachers, our drivers, custodians, paraprofessionals, you name it. This surge has been very difficult on everyone. And Superintendent, to hear you say we're running on fumes, I appreciate that because I know how hard it has been. I was incredibly struck by the attention to detail, and I thank you, Dr. Eccleston, for sharing that, the spreadsheets on how you're tracking this, the flow charts on the decision process, the meetings that start at 7 a.m. and are also going at 9 p.m., the support being provided to schools. Like many people, this has gone through my family as well, and it is everywhere right now. And yet the scientists and the research is continuing to say to us that our students are safer in school than they are not in school, both from an academic viewpoint, from a mental health viewpoint, and from a physical viewpoint. So I appreciate the work the district is doing. Superintendent, what I'm hearing from you is your default position is you want our schools open and that you are working towards that. And if we have to make decisions, as I see in that tree, about the district or schools or individual classrooms, you make that decision. But it certainly appears you're doing all you can to make sure our schools remain open. And I appreciate how difficult it is. I do anticipate from hearing Dr. Sanchez explaining about the wastewater numbers, which has tended to be a leading indicator from what we have seen in other cities and even in other countries, it looks like the peak of this surge is either with us now, and hopefully we're going to start to see a decline and the attendance numbers come back both for our staff and for our students. Superintendent, the one question I do have is, are you comfortable, and this may be for Mr. Eccleston or Mr. DePino or someone else, how much of this is BPS, getting the masks, getting the tests, et cetera, from the state or even from the federal government or the city, and how much of it is BPS doing ourselves? And are we comfortable that we have the testing resources in particular in place, as well as the PPE as Ms. Lapiro talked about? Is that a roadblock for us over the next couple of weeks, or are we getting the support we need from the state in particular on this?
Well, thank you, Mr. ONeal. As you know, a few weeks ago, I started calling some of my colleagues, at the federal level, asking for support with testing, anticipating that testing was going to be an issue, and really pressuring to provide more testing to superintendents across the nation. As they were asking superintendents, what do you need? This was the number one ask that I was pushing for. I was glad to hear that the state was going to send us tests and send us masks at winter break. As you know, there were some difficulties with that shipment. We have since been huddling with our team. Deputy DePina has been working with the city and with Boston Health Commission to secure more tests and to secure appropriate masks. I do think just in the last day or two, the state has announced stepping in with additional tests, as well as the Biden administration. We anticipate that is going to significantly relieve the testing regimen that we think is going to be necessary, and that is recommended by the Boston Health Commission in order to continue athletics, in order to make sure our classrooms are safe and our teachers and students are safe, and all of our staff. And so if that doesn't materialize, we are positioned well with our orders in order to get our own supply, and we will do that.
Thank you, Superintendent. And my last comment is you've probably seen a number of parents have been writing in with some pretty thoughtful suggestions about, a number of steps that they'd like BPS to do. And it has to do with ventilation in buildings. It has to do with testing, protocols, et cetera. Have you reviewed that? And it appears to me that you are doing a number of those steps. I'm wondering in particular if you could address the ventilation issue a bit more in the classrooms.
Certainly. So, as you know, we have been working on mitigation efforts in Boston Public Schools, and I think we are doing a really great job. And we're doing that because it's been an all hands on deck, in particular support from our mayors that we've had. And also the state with their test and stay program. Many of my colleagues across the nation do not have testing protocols already in place. And as messy as they were at the beginning, you know, we have pool testing in place. We have test and stay in place. We did provide masking to our students and had surgical masks in our schools for our students and our staff. We have fixed 12,000 windows, provided air purifiers in all of our buildings. We have air quality sensors now that we have put in every single classroom, and our amazing environmental team watches those numbers each and every day in every single classroom. And when they have a number that doesn't look quite right, they're able to quickly mitigate that with checking with the school that there is an air purifier is properly placed, that it is on, that a window is open and a door is cracked. We've sent out communications, we've done trainings. You know, we've had the masking, and other you know, superintendents across the nation have struggled with these mask debates. We just haven't had those here. We've been fortunate. We have had so many vaccine clinics. Megan Costello probably has the exact number. I don't have the exact number because we keep adding them every single day. But I think we've had over 80 at least vaccine clinics, 30 just this month, more coming up to get our employees vaccinated too, so we don't experience another shortage. So a lot of mitigation that we've done, not to mention all the great work academically with our teachers and our cafeteria staff serving over 8 million meals these past 2 years. And our custodians who do twice fogging now of our buildings to make sure that we're sanitizing our buildings. You know, everything that we have, I told our teachers, I will move mountains so that they have what they need, so our children get what they need.
Thank you.
Thank you. Ms. LaPera?
Thank you, Chairwoman Robinson. Just to follow up around the COVID protocols, especially with the athletics and the update that you mentioned, Superintendent Casilius. I know you mentioned that for resuming practice and potentially the games around athletics, one of the pieces would be testing twice a week for those who participate. When are we going to start talking about vaccine mandates, right? Because at the city level, we are already seeing that for not only staff, but just for residents. We're seeing that even for children, that for some public spaces, we are talking about mandating vaccine for children to enter certain spaces. We need to also be thinking about the schooling aspect. And so I'm just thinking, you know, as a policymaking body, at what point is this something that we discuss?
Yes, I agree with you, Ms. LaPera. You know, back a year ago, I was saying we need to get our students vaccinated and we need to start talking about vaccine mandates. The unfortunate thing right now is the FDA has only cleared the Pfizer vaccine for 16 and older. So the state has not come through with any kind of vaccine mandate for our students. And so until I talked to Boston Health Commission about this, and I think until we have the full authorization for the vaccine, it's hard for the state to make it a mandatory requirement for compulsory attendance in our schools. And, you know, obviously we're waiting on that. You know, the mumps, the rubella, the measles, chickenpox, all of those vaccines, you know, are required for students to attend school. I suspect at some point we will be also requiring this vaccine, but we're waiting on the state's lead on that.
Got it. Thank you for that. And then I do have there's one question, and this is probably for Dr. Eccleston, regarding one of the slides talked about supports for students K0 through 2nd grade. And it indicated daily math and I believe English tutoring for periods of quarantine. And so I wanted clarification. This is different than the paper tutoring that we had heard about previously. And if it is it one-on-one tutoring? Is it class? Like, I just want to know more of what that really looks like.
Yeah, thank you for that question. So it is different than the paper tutoring. We have hired a cadre of tutors who are providing remote instruction for small groups of students over a period of time. They have an AM or a PM session where they're provided with 75 minutes of English language arts instruction and 75 minutes of math instruction. The idea would be that they have instruction that's closely aligned to the scope and sequence for their specific grade level, so that during the period of quarantine that they're getting instruction and tutoring that's closely connected to what should be happening in the classroom. It's keeping them generally in the game of what's happening during the period of quarantine. Of course, we're not required to provide that type of tutoring, but the moment calls for that type of support. And given the number of students, particularly recently, that have tested positive and needed this type of tutoring, we have had to redeploy members of our early childhood team to cover additional sections because we didn't have enough tutors to provide that. And this is in addition to paper. In part, there's several reasons why we decided to do this. Most notably, we felt that our youngest learners would have difficulty engaging in a chat-based function like paper, and that this would be providing them the type of support that they needed. There's no reason that those students can't also access paper. They have access to it, but we thought that this was the best move for our youngest learners.
Thank you. That's really helpful, and I'm glad to see that we're meeting the moment as is needed. One of my follow-ups to that is really appreciative of the decision tree, which if we don't have it on our website around how we're making decisions on a school-to-school or classroom-by-classroom basis, if we can get that on there. And then the piece around how realistically is curriculum, teaching and learning moving forward amidst all of the absences, right? So not just staffing, but I know even within my son's classroom, he's seeing absences of students of 7 to 9 students on a daily basis. And so what is the directive from the district to schools on those who are learning in the classroom while some tutoring is also happening for those who are out of the classroom? Is it even possible to move forward? I just want more of your thoughts on how that's being managed.
I don't know that I have profound thoughts on this really important and difficult question. I also apologize, I have my mask on. It was so hot in my office, I needed to come out where it was a little cooler. So hopefully everyone can hear me okay. I mean, I will say that the last 2 weeks have been difficult. I'm not, I'm going to be super transparent about that. Like, the superintendent was in classrooms. I was in classrooms. I was teaching 6th grade math. I taught 1st grade. I was swabbing noses. So was the superintendent. We're just doing the best that we could under really difficult circumstances across the system. And, we noticed a lot of variability, to be transparent, around quality of lesson plans that were provided for substitutes that we need to shore up and provide some feedback to both our school leaders and to some of our educators. And we'll do that in the coming days. And we hope that that will sort of help provide a continuity of learning and a consistency of learning across the system. But I do think it would be irresponsible for me to say that like learning has continued over the last 2 weeks in the way that it should, because that's just not accurate, given the large numbers of student absences and the large number, rightfully so, of faculty and staff who are out. Well, I'll just add, just for context here, that a large number, and I just want to thank the superintendent for her leadership, and many of us were like at a warehouse at 5 a.m. on Monday, sorting through the tests that came in from from DESE, and we got those tests out to schools. And it's those tests that captured a large number of faculty members and staff members who didn't know they were positive, but they took those tests. And so we see in the data that those educators who tested positive on that day, that the largest number of people are returning on the 14th, which is the period of quarantine from that positive test. And so I think that was really useful. And thank you to Sam, to Pina, and so many other people. Final thought on this, I know there's another set of questions, but I just wanted to thank my colleagues, particularly Monica Hogan and Mark Racine, who I failed to note in the presentation earlier, who've just been instrumental in helping us systematize our work, making our sort of decisions more evidence-based and more strategic. They have just been remarkable and along the ride with us under these really difficult circumstances.
Thank you for that. Really appreciate
And I
it.
would, Member LaPera, I would also, not say, I was speaking with the students today in BSEC, and they were talking about the interruptions to their learning and how challenging it has been for them. There's a lot of anxiety for our students. They are concerned for their peers. They are concerned for their teachers. And, it was a really great listening session with our BSEC members this evening to hear about what their experience is on the ground. Now, surely this is different classroom to classroom, school to school. Some students are getting along and there's not a lot of disruption, particularly at our elementary grade levels. But there are some that there is a lot of disruption at the school. And we see that bearing out in our data. So we're providing more additional support. We'll need to huddle with the team to look at which schools had the most amount of disruption these past several weeks of surge, and see what additional supports in the future we can provide to the students and to our educators in those schools.
Thank you. Dr. Elkins, do you have any questions?
Yes, I had a couple, actually just sort of along those same lines. With the chronic absenteeism, the anxiety around, classmates missing school, also the same with teachers. Has there been an increase in the call for mental health supports? And if so, how is the district handling this?
So we were really fortunate, Dr. Elkins, in that we saw this coming and asked the city for additional resources to be able to have social workers in all of our schools, and also additional family liaisons to participate in with our school support teams, and then to be able to communicate with our families in languages that they speak. They're a very multilingual group. And so we've been able to have that as part of our approach moving forward. Of course, we have our school nurses who have also been amazing. I don't want to leave them out. They have bear a lot of the brunt, as well as our school leaders, of this more recent surge, and really just over the past 2 years. So this is top of mind. We know that there's always more that we need to do. We have the best team, we have our crisis team, we have our counseling team. They go out where we know that there are students who are dysregulated or who need additional support, and they're terrific.
Thank you. Are there any other questions? If not, Superintendent, I have one. I want to thank Ms. LaPera and others for asking many of the things that I was concerned about, particularly as it comes to instruction. And as you talked about, quietly doing some preparation in case we do need to go back remote. What kind of preparation are we getting our families to do? One of my concerns was that for many families, remote did not work before, even though many are clamoring for it to return. And so the question is, how are we helping them in advance think about, at-home learning space, whether or not they've got Wi-Fi, extension cords, all of those kinds of things. So at the point, if this were to happen, we would not be having the scrambling that we've had to do in the past, and that people will be mentally and readily prepared to make the transition. And with that also, what are we doing in schools to make sure that children really are having a better facility themselves in logging on and utilizing their Chromebooks? Have Chromebooks become more of an everyday tool versus, as it had been pre-pandemic, as more of a cart? You know, you have a program, but it's not a learning tool itself. So where are we with our computer learning?
Well, thank you, Ms. Robinson, for that question. I had the same one of Mark Racine a while ago. You know, I would like to think that we are one-to-one and that students were getting and using these computers as tools for their learning on an everyday basis. But that is, again, like most things in Boston Public Schools just yet, varied from school to school in terms of their approach, you know, and I think that we have more work to do there. But I do think that Mr. Racine has done a tremendous job with providing tech support to our schools. And also we have tech coordinators at every school who have been ordering the cords and replacement computers. And I see that Mark has turned on his screen. So I'll let him update you on where we're at with that and how we've prepared for Wi-Fi for families. And then I think that Drew could probably speak a little bit more about how we've prepared families for communications to families so that they're prepared if we should have to go to remote, and how we've prepared for teachers in the playbook that he has designed based on our learning for closing the Curly.
Thank you.
Mark?
Thank you. Yes, you're right, Chair Robinson. The technology has changed in its approach. We have gone from a classroom where technology was a tool that was brought in once in a while to it is an integral part of the lesson. I've been in many classrooms, and I'm pleased to say that we've reached the point where our students and our teachers view Chromebooks and they view computers as a tool to use, and our students are at the maturity level where they can decide if the Chromebook is the right tool for the lesson or the pencil and paper is the right lesson or right tool for the job. It's a moment that we've strived for a very long time to get to the point where our students and teachers view the Chromebook as just another tool in their arsenal. So we do see varying levels of technology still in use today. Many classrooms are using technology in every lesson. And as I mentioned, we are seeing a lot of teachers and students going back to the traditional way of schooling because they've spent the last year staring at a screen. In terms of our readiness for remote learning, we are starting to hear some requests from schools for additional technology or more Chromebooks. Some of them are well ready to go and well prepared, and some of them are just looking for additional devices just in case. We do know that things like chargers and hotspots, those are the kinds of tools that people go through a little bit more regularly. So we did provide all schools with more hotspots this fall. We're in the process of dropping off more chargers and extra chargers for schools right now. We do have a small stockpile should we need to pivot remote for a small scale or a large scale. And we have been afforded an additional purchase of Chromebooks through another federal program called the Emergency Connectivity Fund that will help with home broadband access. The Emergency Connectivity Fund was established to help with the digital divide moving forward, not just as a COVID recovery tool. And so that's where our efforts are focused now on the digital divide moving forward, and not just as a COVID recovery tool.
Thank you. Are there any other questions? Okay, so before we close out the superintendent's report, I'd like to invite Ms. Mercer to share a brief update on BSAC.
Hello, everyone. BSAC has had their first in-person meeting on December 16th, the Thursday before break, and had their first virtual meeting of the new year last week, Thursday the 6th. We have a representation from 26 schools on the council, and we are continuing to recruit more students from the schools that are missing. Right now, we are working on the upcoming protest this Friday, the 14th. The protest has 3 options. The purpose of this protest is so that DESE and the governor know that we are serious and that our voices need to be heard and go beyond the district. This protest is not directly aimed at the district, but at the state and DESE. We want to be safe and receive our education at the same time. Our number one concern is that we want remote learning to be counted towards the 180 days of learning. We also have a full list of demands in our flyers. The three options that we have is option 1, which is students will walk out of school at 10:30 a.m. and head home or a place to where they can stay safe and warm to access the webinar link. Option 2 is students will be absent from school and join the webinar link. And option 3 is that students who cannot do either 1 or 2 will attend school and stay to email, phone, text, and call state, city, district officials, and DESE. The webinar will start at 11:30. Thank you.
Thank you. Before we close out, does anyone have any questions of Ms. Mercer? Not at this time. Thank you, Ms. Mercer. We look to hear more of what you all are planning to do. So at this point, I want to thank the superintendent and would like to make a motion to receive the superintendent's report. Is there a
So
motion?
moved.
Thank you. Is there a second?
Second.
Thank you. Is there any discussion or objection to the motion? Ms. Sullivan, will you please call the roll?
Thank you, Chair. Dr. Alkins? Ms. Lopera?
Yes.
Ms. Polanco Garcia?
Yes.
Mr. Tran?
Yes.
Mr. O'Neill? Ms. Robinson?
Yes.
The report is approved unanimously.
Thank you. We will now move on to general public comment. Ms. Sullivan?
Thank you, Chair. The public comment period is an opportunity for parents, students, and other concerned parties to make brief presentations to the school committee on pertinent school issues. Questions on specific school matters are not answered at this time, but are referred to the superintendent for later response. Questions on specific policy matters are not answered at this time, but may be the subject of later discussion by the committee. We have 77 speakers for general public comment. Each person will have 2 minutes to speak, and I will remind you when you have 30 seconds remaining. Those who require interpretation services will receive an additional 2 minutes. Speakers may not reassign their time to others. Large groups addressing the same topic are encouraged to consolidate their remarks or choose a spokesperson to provide testimony. Written testimony is appreciated and encouraged. Please direct your comments to the chair and refrain from addressing individual school committee members or district staff. When I call your name, please raise your hand virtually in Zoom. Also, please make sure that you're signed into Zoom with the same name that you used to sign up for public comment. That will allow us to identify you when it's your turn to testify. Please state your name, affiliation, and what neighborhood you are from before you begin. Please unmute yourself and turn on your camera when it's your turn to testify. Only speakers who turn on their camera will be allowed to testify. Otherwise, speakers can submit their testimony in writing. We'll begin this evening with Tiffany Lau, followed by Sean Sullivan, Ajane Agaro, Stacy Tran, Nizreen Feeham, Carmen Lopez, and Anissa Asabi George. If you could all please raise your hands virtually in Zoom. Tiffany?
Hi everyone, my name is Tiffany Law. I'm a senior at Boston Latin School and I live in the Austin neighborhoods. I am bringing attention to the growing student concerns around in-person learning as many of my peers and I feel unsafe in the classroom. After these couple of days of school, we have witnessed the increasing absence of teachers and students. Students would crowd in the cafeteria or auditorium due to absentee teachers violating social distancing rules. Lunchrooms are completely disregarded of all COVID guidelines as students are all packed with one another. Many of our communities have been testing positive and none of us feel safe. I've spoken to various teachers and staff in our school who have also voiced their concerns as many of them do not want to be in the classroom at risk while they're risking their own family's health as well. The district and Governor Baker seems to have no regard for the safety of Boston staff and students. I am pushing for an online learning option during these times that would be counted as school days. I know this isn't exactly something that the district may decide on, but I hope to bring more attention and urge the governor and Dusty to consider these options for the health and well-being of students. As students and families of BPS, we should not have to pick between possible health hazards and an education. Thank you.
Thank you. Our next speaker, Sean Sullivan, is not signed into the meeting. So we'll try Ajane Igaro. Again, if you could please raise your hands in Zoom, that will help identify you. Is Ajane with us? Okay. She's not signed into the meeting. Let's try Stacy Tran.
Hello. Hi, can y'all hear me?
Yes, good evening.
Oh, good evening. Okay. Sorry. Hi, my name is Stacy Tran. I'm a resident of Dorchester and a current attendee of Dearborn STEM Academy. I'm testifying before you to push for the closing of schools and reinstatement of virtual learning. Students should be protected, not neglected. Teachers are not expendable, they should be valued. As an ambitious scholar, I long to materialize many of my hopes and dreams, the foundation that drives me towards success. However, the terrifying resurgence of COVID-19 variants is actively undermining the safety and security of school infrastructures. Many livelihoods are being threatened. Many hopes and dreams are being snatched. Scholars across the district are unjustly subjugated to poor learning conditions. Our instructors across the district are suffocatingly confined to their classrooms. School grounds shouldn't be a death sentence. Entering school grounds should not risk hospitalization. Communities are seeking the assistance of district officials to alleviate their suffering. We're seeking a sign of relief and we're longing for a motion of liberation. Instructors across the district bear many burdens. It's evident that our instructors are silently suffering under the major weight of expectations and external obligations. School infrastructures currently are not equipped to maintain safe and secure learning environments. Instructors are dropping drastically in numbers. With each loss means a setback for our community. We direly need an environment where we can maintain our customs and at the same time preserve our educational gain. There doesn't need to be any kind of loss. Teachers are essential to our education and to the heart of our communities. Again, I'm testifying because I want to encourage the district to push for the closing of schools and the reinstatement of virtual learning. COVID-19 is hurting our communities. Communities are losing faith, and we cannot wait another moment. Thank you for your time and thank you for your consideration.
Thank you. Our next speaker is Nazreen Fiam.
Hi, everyone. My name is Nazreen Fiham. I'm a freshman at the John D. O'Brien School of Science and Mathematics, and I currently reside in Roxbury. There has been an ongoing issue within the BPS districts concerning the surge in COVID cases, as it has been reported that 1,000 plus teachers and staff have been out due to directly being affected by COVID or simply because they're apprehensive to enter a petri dish of COVID. As a student myself, I have noticed that the needs of the school and the district as a whole have been ignored way too long, especially when it comes to the latest hot topic, which is the ongoing stretch of COVID. We are being placed in schools where safety protocols are not strictly applied. There is no sort of distancing given the fact that many schools either don't have the space or are overcrowded. Places such as the cafeteria and hallways have become a playground of COVID, as it's almost impossible to avoid close contact. Many students like myself live with people who are at high risk, and given the fact that these variants are highly transmissible, our lives are being put at stake. There should be no reason as to why any students have to learn in such harsh conditions when they have to constantly think about their safety and health. Instead of being in a ground-breeding environment of COVID, students should have a hybrid option that will contribute towards the mandatory 180 days, as well as ensuring that pool testing is mandatory and tests are given out constantly. We need the district, the mayor, the education commission, and the government to do something now. It is the city of Boston's responsibility to take quick action to ensure its workers and students are safe. Thank you.
Thank you, Nazreen. I'd like to ask all of our speakers to please speak at a slower pace to help our interpreters out this evening. Carmen Lopez is not signed into the meeting, so we'll move on to Anissa Asabi George, followed by Ryan Maziarka, Michael Maziarka, Adelia Agueda, William Hu, Patrick Harnan, and Tom Harnan. If you could all please raise your hands in Zoom. Ms. Asabi George.
Thank you very much, members of the school committee, the chairman, and Superintendent Caselius. My name is Anissa Asabi George. I'm the mother of 4 kids, 4 student athletes who play winter sports, including hockey, wrestling, and basketball. I am grateful for the change in this evening's earlier presentation to move up or to end the pause on athletics, starting with practice next week and games the week after. Honestly, I worry about this further delay, and I'm very concerned about the rest of this particular season. We all know that athletics is certainly about competition and winning. We also know that athletics and sports in our schools for our kids is about physical activity, mental health, as well as joy. Our kids and our coaches and our school communities have worked very hard to follow all of the safety protocols that are in place. And I feel that the pause that has occurred and the worries I have, and I know so many have about future delay, can be very hurtful to our student athletes across the district. I do urge that we move quickly to reinstate sports in our schools for our kids, and that we do this without further delay. Thank you.
Thank you. Our next speaker is Ryan Maziarka. Ryan, are you with us?
Can you hear me?
Yes, good evening.
Good evening. My name is Ryan Mazurka. I'm a senior at Boston Latin School and live in the North End. Thank you for letting me speak tonight. I'm one of the co-captains of the BLS varsity hockey team, and I'm happy to hear we'll resume practice next week. But I've prepared some comments, and here are my remarks. Athletics are happening in nearby towns throughout the state and throughout the country. In the city of Boston, city kids are playing for private schools, Catholic schools, and even in the Mayor's Cup tournament. It's just Boston Public Schools athletics that are on pause, and that's what hurts the most. Our Boston student athletes are playing all different sports for all different high schools, want to play, and they want a safe way to play. We are vaccinated, we still play wearing masks, we'll do pool testing, and we will follow whatever rules are put in place so we can return. I've seen the impact not having sports has had on my teammates and friends. Not having the opportunity to play is making kids sad, angry, and depressed. Kids need to have some fun during the pandemic. Last year, when classes were fully remote, pre-vaccine, we were able to follow the rules and play. Playing in a shortened season was the highlight of my junior year. I'm a senior now. This is it for me. It's my last chance to play, and I want to proudly represent my school and my city in league games. This is my only senior year of high school, a time I should be enjoying and a time I will never get back. I'm saddened we've already lost a month of playing, but I'm still hopeful we'll have another chance to compete in games in our school uniforms. I'm concerned we need to wait until the 24th to play games. We need to return to games sooner rather than later in order to be eligible to compete in the state tournament. The winter season will end before we know it. I'm still curious about the extended wait for games and hope to learn more through your communications in the coming days. Thank you for taking the time to listen.
Thank you. Our next speaker is Michael Mazurka.
Hi, my name is Mike Majarka, a North End resident and parent of a BPS student, Ryan Majarka, that you just heard from. I was happy to hear your update on BPS athletics returning to practice next week. Since I've prepared remarks, I'd still like to convey them for the record. I appreciate that these are troubling times with rising COVID rates. However, one consistent theme has emerged across the country and within Massachusetts. We need to learn how to live with this virus. It's not only reflected in words, but within actions taken across the country. With the recent CDC guidance changes, Dr. Walensky said, these updates ensure people can safely continue their daily lives. It's an important point. We need to safely continue our daily lives. For these kids, that includes playing sports. COVID is here and it will be some time, and we'll have to figure out how to safely live with it. The pandemic does not know boundaries. It is not realistic to think that by shutting down sports will contain what happens within our schools with so many other interactions happening outside of your control. Further, rather than blanket approaches that shut down all sports across the district, more precision is needed to contain specific outbreaks at the team or activity level. There have been instances across the state where some teams had to postpone because of the outbreak. For instance, Wellesley paused over winter break, but have since resumed practice and games. They paused and they resumed. We paused and we're happy to hear that we'll now resume, but ask for increased communication and transparency on the ongoing decisions and criteria used, especially for the return to competition. Not playing sports is taking a toll on these kids. Their emotional well-being is at stake. Their mental health is critical. Stopping sports hurts the hundreds, if not thousands of kids that participate in the BPS sports programs. For many, this is a once in a lifetime opportunity for them, especially the seniors who more than likely will not play in college. We paused and now it's time for us to resume. Let's have plans that enable as many of them to continue to play. Thank you for your focus on these challenges and the opportunity to speak today. Appreciate it.
Thank you. Adelia is not signed into the meeting, so we'll move on to William Hugh.
Firstly, I just want to say thank you to the interpreters who have been working tirelessly tonight, helping us translate for everyone who has joined the meeting. My name is William Hu. I am a senior at Boston Latin School, just like Ryan, who spoke a couple of speakers before. I created a change.org petition urging the Baker administration as well as EDESI to have an option, and I emphasize option, for remote learning. This petition has received over almost 7,000 signatures as I speak right now, and has received over 60,000 views and almost 3,000 shares. These numbers don't reflect all of Massachusetts, nor do they reflect all of Boston, but they provide a resounding message that students need the right to be safe. Students, maybe, if not families, loved ones, everyone around them that are immunocompromised, that deserve the right to go virtual. I, as a senior and as a crew captain, would love to continue sports as much as the next player. I want to go have fun with my friends. But before that, I need to ensure that my friends, my colleagues, my peers, my teammates, my family, my loved ones are all safe. That is crucial. And after being in contact with students all across Massachusetts, ranging from Winchester to Lowell to Wellesley, I've received resounding feedback that simply continuing sports or continuing in-person schooling or being forced to go to in-person schooling, it's just not going to work. There are countless individuals, if not students, their loved ones who are at risk every single day when their child comes into a COVID breeding ground and comes home, bring that virus into their homes. So therefore, I once again cannot help but to emphasize that our safety, our family's safety, should not be an option. It should be a right. I thank you all for your time and hope that you can seriously take this into consideration. Have a great night.
Thank you. Our next speaker is Patrick Harnan.
Good evening. My name is Patrick Harnan, and I'm from South Boston. I'm a junior at Boston Latin School and a member of the Boston Latin hockey team. I was here to speak on the pause of winter athletics, and I am thankful that a startup date has been put in place. However, I would still like to share how I felt when athletics was put on pause. I was extremely disappointed when finding out at 9 o'clock on Sunday night that the pause on athletics would continue. It was gut-wrenching to hear the news as I was packing my bag for practice the following day. Over the past 2 years, I feel how I've been stripped of my high school athletic experience. My teammates and I have put in countless hours of work in preparation, along with our parents who have made countless sacrifices to put us in positions to succeed. A majority of us started playing hockey when we were 3, and we have been practicing our entire lives for our turn to shine at the high school level. For many of us, this is the highest and most rewarding level of hockey that we will ever reach. There is no word to describe it other than heartbreaking to think that our opportunity is being taken away from us, and that we have to sit on the sidelines watching other schools get the chance to play. I did the math, and I've spent almost 5,000 hours playing hockey in my life, including just about 80 hours on the ice this summer. Over the past 2 years, I played in 9 games when it should have been 30. 21 games have already been taken away. It's not all about the game either. Missing out on being with our teammates and friends every day is extremely difficult. High school is a time to make memories, and it is disappointing that we won't have as many as we should because of the decisions that have been made. Once again, I am thankful that a startup date has been put in place, and I hope that sports will be able to resume as soon as possible. Thank you.
Thank you. Our next speaker is Tom Harnan, followed by James Tobin, Stephen Jean-Louis, Jalen Conway, Than Bui, and Grace Sullivan. If you could please raise your hands in Zoom. Tom Harnan.
Good evening. Hi, my name is Tom Harnan. I'm a parent of 2 junior boys. One of them that just spoke, Patrick, at BLS. They're both hockey players and lacrosse players. I live in South Boston. Let me start by saying I certainly understand that COVID is an issue that we're all dealing with. But when it comes to high school sports, I strongly feel that pausing all sports was the wrong decision. If the kids and the teams are healthy and they can go to school every day, then I feel like they should be able to play their sports. There's a way to manage this, just like others are doing, not to shut it off, not to shut it down completely. Now, like others that have spoken, I too am appreciative of what I heard tonight in terms of the restarting of the sports and allowing these kids to get back to these activities. But I do still have some concerns that I'd like to express. First off, just as it relates to some of the details of the plan going forward, when are we going to see those details, and when will we be able to see them? It was mentioned practices and small group conditioning. Exactly what does this mean? I'm really unclear on that. And also more about the testing process. What is this going to look like? I'm also concerned that it's taken over 3 weeks to get to this point, 3 weeks of these kids' season, and which is concerning, particularly when just last Sunday, as my son Patrick mentioned, we got the news that we were again, late Thursday, that we were again continuing the pause on the sports programs. And I too am wondering, why can't we just immediately get started with these sports programs? These kids have been out 3 weeks, the clock is ticking. I also have concerns about how this was communicated to our students. Through tweets that are copied and circulated amongst the kids. None of these kids were given an opportunity to meet with the decision makers, to understand why these decisions were made.
Excuse me, Mr. Harnan, if you could please wrap up.
Then finally, one of my biggest disappointment was that these decisions were a big deal. You can tell these decisions were a big deal to these kids. And it was certainly disappointing that no help or resources or outreach was given to these kids to help them deal with what was presented to them. Appreciate your time, and thank you.
Thank you very much. Our next speaker is James Tobin.
Hi, my name is James Tobin. I'm a senior at Latin Academy, and I'm also the boys hockey captain. I came here today to also talk about the postponement of winter sports and also why I'm a little confused why it's starting back up on the 18th and games aren't starting back up until the 24th. Uh, I think after 3 weeks of having to quarantine or isolate and whatnot, we could really just start tomorrow. And I think um, also the communication that they gave to us about this topic was insufficient. It was just kind of tacked on the bottom of an email, 2 sentences saying, oh, you might not have a season until we tell you that you have a season. And I just think that that's a little, as I said, it's just an insufficient way of telling us and letting us know.
James, are you with us? Okay, I think we lost James. But there you are, having technical difficulties. James, if you'd like, you can email your testimony to us, and we'll be sure to share it with the committee and the superintendent.
Okay, thank you.
Thank you so much. Stephen Jean-Louis and Jalen Conway are not signed into the meeting. So let's try Than Bui. Okay. They are not signed in either. So let's try Grace Sullivan. Grace will be followed by Jairiona Brown Carter, Ashery Atkinson, Anisha Adorno, Richard Bova, and Lynn Bova. If you could please raise your hands in Zoom. Grace.
Hi, my name is Grace Sullivan. I'm a senior at Boston Latin School and I live in West Roxbury. I've been in the midst of the COVID outbreak since 2020, my sophomore year, and now it's my senior year and I'm almost 18. Now I have had the privilege to have a home with food supplies and heat. So coming on here today and just saying, put online school back would be pretty tone deaf in my opinion, but there's something I'm not as privileged to have, and that's good health. I've known the ins and outs of hospital buildings since I was about 16 months old, and I've seen myself get more affected by sickness than any of my other friends. So I always take precautions. And that's not just for the good of all, that's because I'm terrified. So Christmas break comes and goes, and I spend it in my room because I can't see my friends, and I test negative before coming into school. By Wednesdays, I'm experiencing stabbing pains in my stomach. I'm negative. Thursday, I have a sore throat, and I'm positive. Now I'm boosted and 2 shots in, but it's Wednesday a week later and my lungs are aching. I want you to imagine you trying to take a deep breath and get a pain all over your body. Now try that with regular breathing as well. Now, the day I found out I had COVID, I was sobbing because I didn't even know whether or not I'd be going to a hospital soon. And I know that I can say I didn't get COVID from school, but I went nowhere else. And I went on the train. That's how I get to school, because I have 2 working parents who can't drive me to school. And I have to sit next to kids who don't obey COVID policies and wear their masks under their nose. How is that safe and how is that fair? And I could have it a lot worse. You know who has it a lot worse? A direct relative who I live under the same roof with, who has stage 4 cancer. I can't give it to them, and I shouldn't be getting it myself. Because these are not just Massachusetts. These are not kids from the United States. These are Bostonians. These are your students, and we are dying. We are going to the hospital, and we are scared for our lives. So you have an option. It's whether or not you want to take that decision and let these kids keep being scared to go into school, scared to get their own education, or whether or not they get to be safe. Thank you.
Thank you. Our next speaker is Jariona Brown Carter. Okay, let's try Ashery Atkinson. Okay. Anisha Adorno.
Hi, my name is Anisha Adorno. I go to school in Boston Green Academy in Brighton. I'm a junior in Boston Green Academy. I feel like BPS shouldn't pause sports because sports is a source of a motivation to attend school and keep grades up. Sports helped me keep my grade up for me personally because I knew if I didn't have a good grade, I wouldn't be able to attend cheerleading, track, or basketball. We keep ourselves safe by wearing and attending the pool testing in my school. CDC has also just made the recommendation to cut down the quarantine period from 10 to 5 days. According to CDC Director Dr. Rochelle Walsky, these updates ensure people can safely continue their daily lives. The rec, court, or field is no different than a bar, restaurant, classmate, or public transit. In my perspective, I feel like they shouldn't pause sports also because it helps me a lot in my school to keep my grade up. And I really had a bad attitude when I started playing sports. It really helped me to develop a better positive attitude, and it helped me a lot as a person and a teammate. Thank you for letting me say my speech.
Thank you. Our next speaker is Richard Bova.
Hi, my name is Richard Bova. I'm from the North End and I'm a part of the Boston Latin School hockey team. I appreciate that there has been a date put in place to start athletics again. However, I prepared a statement tonight that I would still like to read. When hearing the news about the shutdown of sports, I was not only disappointed, I was also enraged at the fact that it seemed like BPS is putting the blame on athletics for the recent cases of COVID. I was also very confused because when I walked down the road on a Friday or Saturday night, I see hundreds of young adults packed in bars and restaurants, maskless. However, we aren't allowed to play a hockey game with 20 of our teammates. Another point that I would like to bring up is that I can go to a Bruins or Celtics game with 17,000 other people and wear a mask, but I can't play hockey with 20 of my friends. I also thought that it was very hypocritical how a third of our school can eat at lunch maskless, yet 25 of us can't gather for an hour masked, pool tested, and vaccinated at practice after school. This means a lot to all of us, and based on the way that the decisions have been made, it seems like there's a lack of care. In 7th and 8th grade, I watched my brother play hockey for BLS, and it hurts now that I don't have the same opportunity that he had. Throughout my brother's career, he played about 80 games over 4 years. I have played 10 over the past 2 years. There's clearly a problem with this, and I ask that you reconsider the decisions that you have made. Thank you.
Thank you. Our next speaker is Lynn Bova, followed by Jacob Gordon, Kamari Jones, Richard Petroselli, Lanaya Turner, Skyla Nichols, Crystal Jenkins, and Andrew Robinson. If you can please raise your virtual hand. Lynn Bova.
Am I on?
Yes, good evening.
Hi, my name is Lynn Bova, and you just heard my son Richard Bova speak before me. I had prepared something to say, but with the announcement that athletics is starting back next week, I believe that you have already considered the points which I was going to raise. I would, however, like to say what I plan to say at the end of the statement, which I believe is still relevant. My son and many other kids play youth hockey their whole lives with the hopes and dreams of playing high school sports. For most of these kids, this is the last time they will play meaningful sports in their lives. The friends and relationships that they make cross every color, race, religion, sexual orientation, and every other demographic. The friends and memories these kids make are for life, and to take this away from them without a good reason is a shame, and it's very heartless. No kid should have to deal with what these kids have had to deal with over the past 2 years. For some of these kids, sports are the only reprieve, the only outlet they have. In closing, I just want to say one more thing. When you're a kid and a student athlete, you have dreams of greatness. The older we all get, the more and more we realize that the dreams of glory and stardom we have had as kids were just that. They were only dreams. Please let these kids have a chance to chase their dreams. Don't take that away from them. Please let them play, let them dream. Thank you very much for having me.
Thank you. Jacob and Kumari are not signed into the meeting, so we'll move on to Richard Petroselli.
Can you hear me?
Yes, good evening.
How you guys doing? I just want to thank the council for letting me speak. My name is Richard Petroselli, and I'm a resident from the Back Bay. I'm a senior at BLS and a co-captain for the wrestling team. I appreciate the council for letting winter sports to resume, as I was worried that I and fellow student athletes were going to lose another sports season in my last wrestling season. While I understand the need for precautions and support the measures the city has put into place to limit the spread of COVID-19, I do not believe that we should completely lock down again. We have already spent the last 2 years in lockdown, and I believe it's time for the city to begin to move forward. Our teams have followed the mandates that the city has put into place for sports and have taken the necessary steps to continue to play, but the city has reneged on its promises and has affected the mental health of all student athletes. Student athletes need the opportunity to connect with others across the city and the state in order to try to return to a state of normal. Thank you all for your time and have a great night.
Thank you. Our next speaker is Lanaya Turner.
Hi, my name is Lanaya Turner, and I go to the PA Shaw. I'm here to tell you what I want to see at the PA Shaw. I want to see more school grades. I want to see more school grades because.
Lanaya, you're muted.
I'm here to see. Shh, Carson, go ahead. I'm here to. I'm here to tell you. Hi, my name is Lanaya Turner, and I go to PA Shaw. I'm here to tell you what I want to see at the PA Shaw. I want to see more school grades because I don't want to lose my best friend. And my teachers, they are the best. They are the best. They taught us a lot of new things that we didn't know before. If it wasn't for the PA Shaw, we wouldn't know things like addition, subtraction, division, and multiplication. I don't want to leave my best friend just like everybody else. I'm concerned that the school only goes up to 3rd grade, and you have the power to help us grow the grades at our school. If I wasn't at school, I wouldn't know how to read. It was this school that started it all. and I don't want it to end. And you have the power to not let it end. And you also have the power to fight for the right at this school, not just this one, other ones too. And remember, you have the power to do anything if you just believe in yourself. Our friendship means everything to us. So would you want to break up our friendship? Thank you.
Thank you, Lanaya. Skyla and Crystal are not signed into the meeting, so we'll hear next from Andrew Robinson, followed by Jules Owens, Brenda Ramsey, and Morgan Cohane. If you could please raise your hands in Zoom. Andrew Robinson.
My name is Andrew. I'm a third grade student at the PA Shaw. I love this school, so you probably would too. What I want to see at the PA Shaw is a fourth grade and a fifth grade. I think the PA Shaw should have more grade levels because kids should be able to have more members at the school. We have good teachers and a good principal intern. People in my school don't want to leave their friends and teachers. The teachers at the PA Shaw are special because if we didn't have these teachers, we wouldn't have learned about number lines, division, and how to break numbers apart. The teachers have taught us so much. I even performed a Frederick Douglass play in the cafeteria, and recently my class got trout in our classroom. Can you imagine taking this away from kids like me? Instead of having to leave the school, I would like a fourth grade, a fifth grade, and a sixth grade. We have extra classroom for the fourth grade class. And while you're still listening, we also want monkey bars and swings because who doesn't like monkey bars and swings? Thank you for reading this paragraph.
Thank you, Andrew. Our next speaker is Jules Owens.
Hi, my name is Jules and I am a third grader. The school I go to is the PA Shaw. I think that this school should get a fourth and fifth and sixth grade because I like this school. It has good kids in it, in the school like me. I think this school should have a fourth and fifth and sixth grade because kids want to stay in this school and learn more. My sister also likes this school, and she likes her friends as well. She wants to stay in this school until sixth grade. We love the PA Shaw because it's a great school for everyone to learn and have fun. What I ask of you is to build a fourth and fifth and sixth grade because sixth grade so we can learn more things, and after sixth grade we could go to middle school and then high school and then graduate. Thank you.
Thank you. Our next speaker is Brenda Ramsey.
Can you guys hear me?
Yes, good evening.
Good evening. My name is Brenda Ramsey, and I am a parent of a first grader at the Shaw and a third grade alum. I also serve on the parent council at the Shaw, and I am here to do like many of our students and ask that you guys seriously consider giving us a fourth through sixth grade additional grades as well as an inclusion strand so that our school can grow. I know right now it's projected that we will lose a third grade classroom, as well as the second classroom for K-2 will only be halfway enrolled. And I'm asking you guys to really reconsider. The PA Shaw is a school, but it's also a resource for many members in this community. It's honestly because of this school that I have been taken off of BPS's homeless population list. And I cannot imagine losing a resource like that. I would really like for the superintendent and the school committee to go back and just stop for a second and look at what this school has done, is doing, and will continue to do for this community. Superintendent Cassellius, you made a statement earlier that you would move mountains for the teachers to make sure that they had what they need to be of service of our students. And I'm hoping that you would move those same mountains to make sure that us as parents have what we need. And that is extended grades for the PA Shaw, so that we don't have to change our students' schooling in the middle of their elementary career, which we all know that serves an amazing and important part of their education. So I'm asking that you guys just go back and look and allow the Shaw to grow. And I'm hoping that you guys will make decisions with us and not for us. Thank you for allowing me to speak this evening.
Thank you, Brenda. Our next speaker is Morgan Cohane, followed by Zaramar Ramos.
Sorry. Can you hear me?
Yes, good evening.
Good evening. My name is Morgan Cohane, and I am the teacher librarian at the PA Shaw Elementary School in Dorchester. I have been at the Shaw since its reopening in 2014. Through rigorous instruction, inquiry-based learning, and family community engagement practices, we have been working to foster the relationships necessary to ensure that all Shaw students are successful and take ownership of who they are, where they come from, and where they are going. Our school is special in so many ways. As you saw, our students think meaningfully every day. They work with teachers on project-based learning that enables them to view concepts from the perspectives of diverse ethnic and cultural groups. Even our youngest learners are making decisions on important social issues and taking action to solve them, as you saw tonight. We have developed strong partnerships with the Boston Children's Museum and Vertex. We have had award-winning authors and illustrators come to our school. We have won numerous awards and grants, including being the winner of the Heart of America STEM Foundation transformation that will completely renovate our library space in the next few months. I am concerned about the projected closing of a Shaw classroom and what this means for the future of our school. Our community wants to see our school grow, not shrink. I hope everything that makes the Shaw so exceptional does not get lost without the input of our community. Thank you.
Thank you. Our next speaker is Zaramar Ramos.
Hello.
Good evening.
Good evening. My name is Irma Ramos, and I am a parent. I am the parent of Marlene Del Valle, a student that was at PA Shaw from 2019 to 2021. One of the many things I love about PA Shaw is the staffing. Her teacher, Miss Pickup, was my daughter's teacher. My daughter learned so much from social skills and comprehension skills to learn how to speak and be independent. While being at PA Shaw, any concerns or worries were also addressed by Ms. Pickup and as well as the principal herself. It is a major concern for me that the future of PA Shaw won't grow due to the cut of classrooms next year. The Shaw treated us as family, and I stand that it was one of the best schools for my daughter to be in. The Shaw should continue beyond third grade, so our children in our community continue to be a part of this wonderful school. Please take in consideration our voices. It is important for our community as students, parents, and family members, along with teachers. Thank you.
Thank you. A friendly reminder for speakers to please turn on your camera when it's your turn to testify. Thank you. We will now hear testimony from speakers who will be using interpretation services. I will turn off the interpretation icon. Interpreters and the public will all be in the main room. Interpreters, please stop interpreting and mute yourself for this part of the testimony. Thank you.
辛苦啦，唞唞啦，唞唞啦。
We'll begin with Yamaris Matias.
Thank you, Mas Matias.
Is there a Spanish interpreter on the main channel?
Yes, I am.
Yamaris Matias.
Señora Matías.
Sí, aquí estoy.
Bueno, señora Irmaris Matías. Aquí estamos para interpretarle.
Ok, gracias. Buenas noches a todos los miembros del comité. Mi nombre es Irmaris Matías y soy madre de 2 niños que asisten a la escuela de Orchard Gardens.
Buenas noches. So good evening to all of you. I am the mother of 2 children that attend the Orchard School.
También pertenezco a la organización de San Stephen y soy madre mentora de la escuela de Orchard Garden.
La organización de San Isidro, dijo?
San Stevens.
Oh, San Stevens. I also belong to the organization St. Stephen's.
El motivo que me trae aquí esta noche es para expresarle mi preocupación por la alta tasa de positividad en esta pandemia y sus diferentes variantes.
The reason I'm speaking to you this evening is because I am quite concerned about the many positive cases of COVID during these late weeks with the pandemic.
Quiero que se tome en cuenta que no todas las escuelas están preparadas para ofrecer un lugar seguro para nuestros hijos. Es algo que nos preocupa a todos.
I want to share that not all the schools are ready or prepared to offer a secure space for the children to be safe.
Eso es algo que ha sido ignorado por años y es tiempo que tomen cartas en el asunto y preparen las escuelas que necesitan mantenimiento lo más pronto posible.
And this is something that has been ignored for many, many years. I think it is time that you and the committee put some action, prepare the schools in this situation that we're undergoing.
Porque nuestros hijos, maestros y los demás trabajadores de las escuelas deberían de tener mejor ventilación y un lugar más seguro.
Because our children, the teachers, the staff should be receiving a better ventilation system.
Sentirse más en un lugar más seguro.
And they should all feel safe attending school.
Algo más que quiero agregar. Creo que tendría mucha lógica si tomamos en cuenta la falta de personal, por ejemplo, de maestros, los monitores de almuerzos, con los conductores y monitores de autobuses escolares que se encuentran ausentes porque están contagiados de COVID-19.
I also would like to add that we need to keep in mind that we are missing quite a bit of personnel because they are infected with COVID, such as teachers, lunch monitors, chauffeurs, conductors, monitors in buses. And again, they're not in school because they have COVID.
30 seconds.
El plan que quiero que consideren es que a partir del martes 18 de enero hasta el regreso de vacaciones de febrero se lleve a cabo una educación remota para evitar que siga expandiéndose el COVID-19 en las escuelas.
So what I would like to offer, so you all can consider, is that from, I would say, January 18th until February vacation, that you would consider remote learning, and that would be more appropriate for the students and the schools.
Thank you, Ms. Matias.
Muchas gracias.
Thank you.
Vanessa Peguero and Oneris Ramirez are not signed into the meeting. So our next speaker will be Sugi Scannell.
Buenas noches a todos los miembros del Comité de las Escuelas Públicas de Boston. Feliz y bendecido año 2022, esperando que Dios nos llene de sabiduría y mucha fortaleza.
So good evening to the school committee and all the members, for this new year, 2022-23, many blessings.
Mi nombre es Sujay Escanel. Vivo en Rosendale, tengo 3 niños y soy miembro activa de mi comunidad y de San Stephen Joe Program.
So I am Sujeni Scannell. I live in Rosendale. I have my children in the school, and I also am an active member in my community, and I participate in St. Stephen's. St. Stephen's.
El motivo por el cual hago esta intervención el día de hoy es porque ante los retos que ha traído consigo el nuevo año y las nuevas variantes de COVID, volvemos a tener un periodo de incertidumbre en cuanto a la salud y la estabilidad de la familia se refiere.
So I would like to make this intervention to let you all know that we're having many challenges right at the beginning of the year with the COVID situation that we're undergoing, and we all are very concerned.
No obstante estos nuevos retos, tenemos la dicha de contar la experiencia de 2020 cuando inició la pandemia. Pues en ese momento, cuando el mundo se paralizó y las puertas se cerraron, gracias a Dios, tuvimos todos los servicios básicos.
So we've been undergoing a lot of challenges since COVID started. Thank God we have been able to receive many of the resources and the families have been able to achieve learning even under these circumstances.
Con los esfuerzos de nuestras autoridades tuvimos acceso a una educación remota que vino a mitigar el mal creado por la pandemia y aunque no se aprendió en el camino, pudimos salir a flote.
So along the way, we were able to receive the remote learning. We were able to mitigate the conditions. We were able to use the resources and we were able to move forward even under those hard circumstances.
Por esta razón, considero que debe haber un plan remoto desde este mes hasta después de las vacaciones de primavera a fin de lograr que el nivel de contagio baje.
So my proposal is that we should consider giving the remote learning again, bringing that remote learning like we did before. And if we can start this month and perhaps end before the spring vacation, I think we will mitigate the COVID and the situation that we're undergoing with so many problems right now.
Pues la variante Omicron es de contagio rápido. Además, me gustaría que se evaluara la póliza de asistencia.
Well, you all know that the Omicron variant is very contagious and it moves quickly. And I would also like for the school committee to review the attendance policy.
Por lo menos que durante este periodo de nuestros hijos están más expuestos, los padres no sufran la presión y las amenazas de un régimen de asistencia.
I think that during this time, the families that are undergoing a lot of pressure with the attendance, you all should consider, the suffering and the anxiety that the families are going through, and do something about it.
Muchas de esas ausencias se deben a lo que está pasando ahora mismo, los factores COVID-19.
I like to say that many of the absences that the students are having are related to the COVID.
Ms. Gano, I'm
yes.
sorry to interrupt, but I'm afraid you're past your time.
Okay, thank you. Muchas gracias por dejarme. Gracias.
Thank you so much for letting me speak. Thank you.
Thank you, gracias. Our next speaker is Maria Mejia.
Buenas noches, ¿me escuchan?
Sí, la escuchamos, señora Mejía. Buenas noches.
Okay. Hola, buenas noches al comité correspondiente de BPS.
Okay, I'm addressing my concerns to the committee.
Mi nombre es María Mejía, vivo en la comunidad de Roxbury y mi hijo estudia en la escuela Blaston.
So my name is Maria Mejia. I live in Roxbury and my children attend the Blaston School.
Mi preocupación como madre es que si esta situación se veía venir, ¿por qué no tenían un plan B?
So my concern as a parent is if you all see as the committee that the situation was a possibility to be coming, why you didn't have plan B?
Para resolver todo esto que está pasando, ya que esta situación amerita ser atendida con urgencia.
Because it needs to be resolved as soon as possible. It's an emergency. This is an urgent situation that needs to be addressed as soon as possible.
Pues nuestros niños tienen que ser protegidos y seguir con un protocolo.
Because our children need to be protected and you all need to develop a protocol.
Mi hijo, tu hijo, son el futuro de nuestras familias, de las escuelas y la comunidad.
My child, your children are the future for the schools and for the community.
Me gustaría que ustedes intervengan como autoridades para que el gobernador Charlie Baker.
So I would like to see that you interfere or intervene rather before Charlie Baker, our governor.
Entienda nuestras preocupaciones porque la salud de nuestros hijos, nuestras familias y envejecientes está por encima de todo y de todos.
Because you all need to understand and he needs to understand our concerns about staying healthy for our students, our families, and our elderly.
Es tiempo de tomar decisiones drásticas para que este mal que nos agobia sea menos o desaparezca.
We need to make drastic decisions to control this virus and stop it.
Gracias por darme la oportunidad de hablar. Espero pronto soluciones. Buenas noches y cuídense.
So thank you so much for letting me speak. I hope you will come up with good solutions, and thank you for letting me speak. Good night. Have a good night.
Gracias. Lourdes Hernandez and Sonia Moldano are not signed into the meeting. So our next speaker will be Stephanie Almanza.
Stephanie Almanzar.
Buenas noches.
Good evening.
Primeramente, gracias por darme la oportunidad de estar aquí.
First of all, thank you for the opportunity for me being here.
Mi nombre es Stephanie Almanzar y tengo una hija de 8 años que asiste en la escuela Blaston.
My name is Stephanie Almanzar, and I have a daughter that is 8 years old that goes to Blackstone School.
Vengo hoy con mucha preocupación, ya que todo es diferente desde que empezó la pandemia.
I am here with many concerns because everything has been different since we've had the pandemic.
Muchos padres, por temor al contagio, no están mandando a sus hijos a la escuela.
Many parents, because they are afraid of COVID, they're not sending their children to school.
Otros no lo mandan porque han estado opuestos a alguien que ha tenido COVID.
And some of them will not send them because they have been exposed to COVID.
Por ejemplo, mi caso, mi hija salió positiva dentro de la escuela y contagió a todos aquí en casa, incluso a mi bebé de 4 meses.
So, for example, my daughter, she was diagnosed positive at school and she brought it home. Everybody at the house got it, including my 4-month-old daughter.
Estuvieron muy delicadas, la cual tuve que llevar la emergencia.
They were very sick and I had to take them to the emergency room.
Yo tengo mucho miedo de seguir mandando a mi hija a la escuela porque la que sufrió por semanas he sido yo.
And I am scared of sending her back to school because who has been suffering for a couple of weeks has been myself.
Al principio del año, yo estaba recién dada a luz y expliqué mi caso en la escuela que no tenía quien me ayudara a dejar a la parada o a llevar a la escuela a mi hija.
At the beginning of the year, I gave birth and I was explaining that I was having some difficulties to take my daughter to the bus stop and picking her up.
Y aún así recibí una llamada de la escuela diciendo que si mi hija seguía faltando, ellos se veían obligados a mandarme a corte.
And regardless of that, I got a call from school telling me that if my daughter kept on missing school, they were going to take me to court.
Creo que no es justo en estos momentos de pandemia donde la tasa de COVID cada día es más alto.
I think that this is not fair, especially in these times of COVID, where the numbers are increasing every day.
Yo entiendo la póliza de asistencia estudiantil que BPA aprobó, pero en este momento estamos viviendo en pandemia, lo cual quisiera que no siga siendo así.
30 seconds.
So, me quedan 30 segundos. I understand the policy, but I think that now in these pandemic times, it should not be taken into consideration.
Yo y otra familia le pedimos que por favor escuchen nuestra palabra, nuestras peticiones y que nos ayuden con esa parte de la asistencia de nuestros niños.
Myself and other families are requesting from you to please help us out with these policies.
Y que para evitar más el contagio puedan darnos por lo menos un mes estando remoto en casa para que todo esto con los niños esté menos contagioso con el COVID.
And also, we would like to request that we get at least a month of remote learning to avoid that the numbers with children getting sick keep increasing.
Gracias, Ms. Salazar.
Muchas gracias.
I will now activate the interpretation icon. All interpreters will be sent to your channels and you can begin interpreting again. Thank you. Our next set of speakers are Nancy Lesson, Samantha Laney, Michael Heischman, Matthew Ruggiero, and Go Sasaki. If you could please raise your hands virtually in Zoom. Nancy Lesson.
I'm Nancy Lesson, grandmother of 4 BPS elementary school students, mother of a BPS high school teacher, member of Mascosh Health Technical Committee, and of BPS Families for COVID Safety. I'm in Jamaica Plain. Students go from breakfast to dinner, skipping lunch, afraid to remove masks. Nurses struggle to care for asthmatic and diabetic kids overwhelmed with COVID duties they can't complete because they have only 2 hands and breaking hearts. Educators homesick with COVID or trying to manage lessons for those in class and assistance for those who aren't. Pool testing system too often failing. Test and stay exploding for all except the vaccinated who can be infectious but are barred from the program, so they only get tested by fears they're infected and won't know it. Masks not always worn properly, or not the protective masks needed. Cafeterias with unknown air changes per hour when changed air is essential. Some classrooms frigid from open windows promoting ventilation and numbness among the coated and gloved. Auditoriums filled with teacherless students as educators are down for the COVID count. Everyone filled with fears of bringing disease home to immunocompromised relatives or siblings too young to be vaccinated. Children's COVID cases now linked with significant increases in types 1 and 2 diabetes. Parents broken by daily decisions whether to send kids to COVID classrooms or keep them home with no remote option, or equally broken if they have no choice. Absences abound, including the absence of equity. This trauma is not social emotional care needed in this surge, nor valued education young people need and educators want to deliver. In-person school is fueling transmission, filling sick rooms and emergency rooms. How can those allowing this nightmare tell us this version of in-person school is what's best for our students over the next 2 weeks of the Omicron surge? We need a several-week circuit breaker pause right now. Thank you.
Thank you. Our next speaker is Samantha Laney.
Am I on? Okay, great. Hi, my name is Samantha Laney, and I am a 5th grade teacher at the Holmes Innovation School where I live in Dorchester. I know that not all of the issues that I raise are directly controlled by the district, but I raise them in hopes that you will fight alongside us at a state level. Right now, we are hurting educators, students, family, and we cannot continue to do our jobs in these conditions. We need transparency. What is being described to families and potentially to you all is not what the inside of a school looks like right now. We need significantly more access to COVID tests, and we are hoping to get more is not sufficient. My students were pool tested Monday. We were notified today, Wednesday, of a positive result. We were informed that they will not be retested until Thursday, and close contacts won't be identified and tested until Friday. Sorry, I talk really fast. Won't be noted. That means an entire week of active infection in my classroom before families need to be contacted via protocol. We need buildings with proper ventilation, not just mitigation tactics. My students and I wore winter coats all day because we have to keep our windows 4 inches open. Even if schools were safe, the mantra in-person learning is best is just false. Ms. LaPera is absolutely correct that students are either wasting their time in schools repeating material because as we catch kids up, or they're missing large chunks of instruction. Because teachers are just done. We are covering classes that are not our own, and we are planning on the weekends more than we already do, and even more to accommodate the massive shifts in learning because of the insane levels of student absences, and we are putting all hands on deck. It is not sustainable. Our students deserve teachers who aren't burnt all the way out. Cancel all of the tests, cancel the evaluations, cancel all of the new initiatives. And Dr. Alkins is correct in asking about mental health. 1 social worker per school is not even close to sufficient. We need significantly more mental health supports for students and staff because frankly, the disregard for the health and safety of our children and staff is horrifying and mentally and emotionally exhausting. And lastly, we need the flexibility to use the skills that we have learned in the last year, virtually or in person, and the discretion to make those calls based on our students' safety. We are the ones on the ground. We take and see the health risks every day. If you hear us, then listen. If you're listening, then please help. Thank you.
Thank you. And a friendly reminder to please try to speak at a slower pace to help our interpreters so everyone can follow along. Thank you so much. Our next speaker is Michael Heichman.
Mike Heichman, Dorchester, Beja. My happy new year ended quickly. On January 3rd, I was diagnosed with COVID. My partner prayerfully will be having her 79th birthday next month. She would like to avoid catching corona from me. She's living in a hotel while I quarantine alone. I am testifying at every regular school committee meeting since March 2020. I have tested repeatedly that our #1 mission must be the safety of our children and the educational workers that love and care for them. In the early months of Corona, the school buildings were shut down and we shifted to remote learning. When the number of COVID cases went down, we slowly reopened the buildings with a hybrid model. The Omicron, most infectious yet variant, has recently exploded. Never before has there been so many infections in our community. Never before have so many of our children and our educational workers been infected. Our school buildings were fully reopened in September. We have watched the number of cases escalate. We have faulty and insufficient resources. Safe distancing does not exist in our schools. Some schools have become super spreaders. We continue to send our children into unsafe buildings. The education of our children has suffered immensely. Our national and state government continues to mismanage the crisis. Many of us have suffered and many lives have been sacrificed to keep capitalism moving forward. Mayor Wu and the school department are obstructed from making decisions that would prioritize the safety of our children and our educational workers. To make matters worse, many confused and misguided residents are marching and demonstrating against expert healthcare advice and are refusing to wear the mask and to get vaccinated. Those of us who have not lost our sanity must protect the health and lives of our children and community. Mayor Wu, Dr. Caselius, and you, the school committee, must immediately shut the school buildings down and shift to remote learning. Those of us who love our children cannot wait any longer. Shut the buildings down now, shift to remote learning ASAP. Hooray for BSAC, hooray for our student leaders. Shut the school down on Friday. Thank you.
Thank you, Mr. Heichman, and please get well. Our next speaker is Matthew Ruggiero.
Hello, good evening. Can you hear me?
Yes, good evening.
Thanks. Hi, my name is Matthew Ruggiero. I live in Jamaica Plain. I'm a teacher at Charlestown High School and a graduate of Boston Public Schools. I'm testifying tonight against the prospectus to close Charlestown High School and to ask the screening committee to vote to reject the Charlestown Innovation Plan next week. It's important to name this plan for what it is. A group with no connection to Charlestown High School are looking to create a new school, and they are asking you to close Charlestown High School so that they can use the space. This is not a plan to improve or support the existing school. That's clear by the fact that they wrote a 50-page proposal and submitted it to BPS without any communication or work with Charlestown High. Their plan misrepresents our school, either with incorrect or incomplete information, and many of their ideas are out of touch with the actual experiences of people at CHS. Their call to close and reopen Charlestown High is rooted in a narrow, deficit-based measuring of our schools and our students. But if you speak to our staff, our families, and our students, which is where you should be starting from, you would gain a drastically different understanding of our school and what we really need as a proudly and truly public open enrollment high school. For far too long, BPS has implemented policies district-wide that have neglected and destabilized schools that serve the most marginalized and vulnerable populations in Boston. The students of Charlestown High deserve more and better than this proposal, and they deserve more from BPS. We deserve arts and music and dance and pathways and not having to choose which one to cut.
20 seconds.
Deserve inclusion done right because the district funds it, not because our staff sacrifices to provide it. We deserve critically conscious, culturally and linguistically relevant curriculum that's created by educators and community with their students. And we deserve all these things not as an innovation or to tax families that have chosen not to attend a school before. We deserve it because that's what's owed to the students who already attend Charlestown High. Thank you.
Thank you. Our next speaker is Go Sasaki, followed by Mary Debinga, Soraya Harley, Tara Donahue Bonacito, and Shevin Harrison. If you could please raise your hands in Zoom. Go Sasaki.
Good evening. My name is Go Sasaki, and I'm a teacher at the O'Brien. The BPS COVID dashboard last week said that the O'Brien had 8 cases. I had almost that number just in my own classes. I hope BPS updates the numbers to reflect the full count of students that have COVID soon. I also wanted to express my concern about pool testing. From what I see in articles and state reports, a huge number of students who are signed up are not being tested. We must do better. Today, I asked my students what I should share at school committee. The vast majority asked for the option of temporary remote learning. Many students have very mild symptoms and their learning is suffering because of limited access to learning materials. They are able and willing to learn, but struggle because we're not allowed to offer the same online supports that we did last year. This week, some students started returning and some are overwhelmed. Several students asked to temporarily suspend penalties for late work and make other changes to reduce academic stress, which I urge BPS to implement during the surge, particularly as we're approaching the end of Q2. Many students shared that they were worried about getting COVID at school. One worried about their mother who had recent heart surgery. Another shared concerns about their new baby brother. Many asked for more testing and better masks. Only a handful of my students have high filtration masks. One of my students attended school with light symptoms last week while waiting on a test result, which came back positive. And now one of his good friends is now sick. Access to better masks may have prevented that from happening. When I recommended to my families that they get high filtration masks for their children, I had a parent respond that they couldn't afford the masks. I know that that family is not the only one. Why should Boston give out rapid tests at the library so connected people with resources can get them for free when they could give them directly to BPS families, the vast majority of whom are under-resourced? I know that BPS is in a difficult position because of the mandates of the state, but we can do more for our students and families. Do not stall and wait for the surge to be over. We can make a difference now for families, for students, and not only their physical health, but their mental state as well. Please do not hesitate. Give out the good masks, make rapid tests available to students, mandate changes to support student mental health. Thank you.
Thank you. Our next speaker is Mary Debinga.
Good evening. My name is Mary Debinga. I am a Rosendale resident and I'm a teacher at Boston Latin Academy.
And I am coming to you this evening exhausted and anxious and sad and angry, as all of you must be, because this has been a very long ride for all of us. And I know that a lot of effort is being made in a lot of directions, Herculean efforts. I'm just very afraid that we are making some efforts in the wrong direction. And I'm asking that we step up and have the courage to take the correct measures that we know are right. This committee has taken some steps towards fighting for equity in exam school admissions and taken some really courageous stands in that. And I need us to take that type of courage again. I started my school day this morning on the MBTA bus with students who were packed onto the bus with me because their school bus wasn't going to come. I then went to my 55-degree classroom that stayed that way for 3 hours while I taught 2 students who have sickle cell anemia and could die from those conditions. I then had students in my classroom who have active COVID cases and were supposed to be on quarantine, but came back because they're afraid that they're going to miss instruction, sitting next to students who are there because they have medical conditions who aren't aware that they could access home and hospital because the program is not made accessible, and accessible meaning in ways that parents and families can understand and easily access, not that it exists. And that is what we heard one of the committee members raise. There are families that are interpreting our policy as what is on paper where they can find it easily and not what the newest updated one that is harder to find is. Right now, we are choosing to follow the guidance of DESE, and we know that that guidance is wrong, and we know that that guidance is inequitable, and we all know that that guidance is harming us. What we need in this moment is the courage that we see the students taking right now in speaking out against policies that are not for us. We were not provided the PPE that we were supposed to be provided. We were not provided with appropriate measures from CIC. That has been a disaster since its start. And we were not provided with the means to give distancing to our students. And instead of arguing against that, what we have done instead is to facilitate it and to tell our families it's okay. When we tell our families school is open, our families trust us and believe us, and we are abusing that trust. That's why we have so many confused students saying, why can't we have athletics? Because school is open. Why can't we have athletics? Because we go to lunch and sit without distancing. We are confusing our families and our students and forcing them into unsafe conditions. And we do not have a plan for all of the teachers and students who are coming back with long COVID or lingering symptoms who are going to be exhausted. We need to do better. Thank you.
Thank you very much. Our next speaker is Soraya Harley.
Hello, everyone. My name is Soraya Harley. I live in Boston. I have 3 grandchildren I'm raising. Right now, I'm at home with COVID, just like them. Some of them, we have been out of school. I'm also a part of the St. Stephen's, and I'm also a community person that does a lot in my community. I feel as though it's unfair that the schools are open right now, and there's people working from home. And I heard the governor and everyone talking about, oh, how we don't want all these people in the offices because they want to put down or lower the cases. But yet and still, it's like 6,000 or more Omicron cases going on. People are sick in the hospital. I do have a disability. I have grandkids that have asthma. Some have COVID, some don't, but we're all stuck at home together. I have to take care of all of them. I don't know, and it's like hard because there's some that's sick that you have to be around. There's some that's not sick that you have to work with when you don't even have, the ability to do it. I do have a little bit of support, but the thing is, I'm still here with these children. What if they come up with something and they all supposed to go back to school? It's like rough. It's a really rough situation. And you say 180 days the kid's supposed to be in school. My grandchildren have been out of school for a while. This is like the 18th day. And there's no school help. You give them paperwork in a Chromebook, and then you expect for them to know what to do. There should be a Zoom for people that's sick and can't go to school. They should have some kind of Zoom session for all of those students that can't be in school so that they can learn even if they're not there. Because being sick And at home, it's not their fault. It doesn't even have to just be COVID. It could be anything. The teachers as well. The teachers are going through their own things. They have their own families. We all are tired of it. We're sick of it. Y'all need to close down the schools, like they say, at least for the rest of this month and sometime next month, and get things together. We need to work this out and get this COVID down because it's doing nothing but going up. Thank you.
Thank you, Ms. Harley. Our next speaker is Tara Donahue Bonacito, followed by Siobhan Harrison, and Sheila Long. If you could please raise your hands in Zoom. Tara?
Hi, my name is Tara Donahue. I'm a parent at, Hi, my name is Tara Donahue. I am a parent from the Linden. I am sorry for those families and teachers who are struggling through this. But I will say, that I think it's important that we think long, and hard before we blanket close schools. And we're moving to remote learning. Young minds need to know that school is not only a safe place, but a healthy place for them to be. Keeping students in school should be our #1 priority. What benefit comes from a child sitting in a room alone? Not many. Many caregivers and parents are back to work. What happens for these families who cannot sit at home and be with their child? Again, where is the benefit? We have seen the negative effects of long-term learning, remote learning, that has created for our children. Test scores are down. Children are not at reading and math appropriate levels. Not to mention how high mental illness is running through our adolescents.
20 seconds.
In school, you do not only get an education, but you learn to grow socially and emotionally. At school, there are also support systems set in place for those who need it. This again is hard, if not possible, remotely. A remote learning situation should only be considered case by case, as we were presented at the beginning of January as a BPS community. A school should not be a place where children are shown that doors are being shut for them, but yet a place where doors are being opened.
Tara, I'm afraid you're past your time. If you could please wrap up.
As cliche as it may sound, students are our future. Please think about that when deciding to close the doors to a place that will open doors for their future.
Thank you. Siobhan Harrison and Sheila Long and Ruby Reyes are not signed into the meeting. Ms. Reyes has submitted written testimony that we will share. Our next speaker will be Dacia Morales, followed by Rich Petroselli, Elise Petcher, Sharita Fauci, and Jeb Banks. If you could please raise your hands virtually in Zoom. Dacia Morales. Not seeing Dacia. Let's try Rich Petroselli.
Hi, can you hear me?
Oh yes, good evening, Dacia.
Hi, good evening. Um, hi, my name is Dacia Morales. I am a BPS parent. My daughter goes to the Elliott in the North End, and I'm a South End resident. And my daughter's been attending BPS since she was 4 years old. And she attended it at the Hernandez where they failed her tremendously. And now she's at the Elliott where they excelled in her education. And she's doing good there. But I came on today's meeting because I'm an active parent and I really care about the education of my child and everybody's children. But I do also, as a person in the medical field that is friends with a whole bunch of doctors, my colleagues are doctors, and I know that we are living a public health emergency. And the health and well-being of us and our children is at stake. And I think that the schools should be closed until we get proper guidance to deal with this surge, because it's not funny and it's not okay. I hear people complaining about sports and other things that doesn't have to do with health and well-being. And I care about my daughter and I care about everybody else's health and well-being. Every day I pray for everybody's health and well-being, and I think it's taken lightly, and that's not fair and it's not okay. So I think that the school should be closed until everybody gets everything together, and people should know how to handle their children. They had them. I know how to teach my child. She was doing good remotely, and the Elliott School is an excellent school, and my hat's off to their teachers. And I hope the superintendent hears me. But our health and well-being is at stake, and people want to get mad about being told no about some kind of meetings that doesn't have to do with people's health and well-being. How about people that get calls of their relatives being dead?
Thank you, Dacia. Our next Thank you. Our next speaker is Elise Petcher.
Hi, my name's Elise Petcher. I live in Jamaica Plain. I have 2 grandchildren in the Boston Public Schools. I work with Mascosh, and I'm a member of Families for COVID Safety. I'm here to talk about more that needs to be done to keep our school staff, children, and families safe from COVID. If you saw the editorial in the Boston Globe on Monday, there was an analysis of the data statewide about COVID. And Alan Geller wrote that there were 50,000 cases statewide leading up in the 2 weeks to January 5th of COVID. In Boston, there were over 2,000 student cases of COVID, and the true number is much higher. On an average week, most districts didn't participate in pool testing. And an average week, only 19% of students were participating in pool testing. Nor did this number include the home rapid antigen tests. So we know that there are so many families being affected by COVID right now. And we're learning that COVID is even worse than we thought. Not only can there be long COVID, but children who develop COVID are at risk for diabetes. And that data just came out this week too. The efforts to protect our children, our staff, and families have not been enough. Relying on open windows in very cold conditions leads to ridiculous choices. Better virus dilution at the cost of being so cold you can't concentrate.
30 seconds.
The expertise on masks and prevention has been lacking. So there are a number of things we have to do if we want to keep schools open. You have to improve access to vaccinations We have to increase staffing in schools for more rapid and robust testing and contact identification, and to relieve the stress on BPS nurses and the other staff scrambling to take care of the kids with COVID and need communication. We need high quality masks for staff and students, N95s for staff, and KF94s for kids. We need much more: ventilation in cafeterias where kids eat breakfast and lunch unmasked. Thank you for the opportunity to talk. I hope we find a way to take care of this.
Thank you. Sharita is not signed into the meeting, so our next speaker will be Jeb Banks, followed by Catherine Brady, Chris McGrath, Suzanne McGlone, Andy Groh, Vivian Ho, and Katie Kersey. If you could please raise your hands virtually in Zoom. Jeb Banks. Jeb still with us? Having technical difficulties.
Are you able to hear me now?
Yes, we can.
I'm sorry for the technical difficulties. I'm Jeb Banks, and I'm the dad of two BPS student athletes. And I too am going to amend my comments this evening based on the news that sports are going to begin next week. I want to provide some brief perspective on why folks may seem upset about the closure of sports. Boston Public Schools is one of the only organizations in the state and in the country to have a uniform closure for as long as it has of sports. Our high school kids cannot play, yet our private schools, our youth organizations, and our club sports are managing the situation without shutting down. And they're doing this in the city of Boston, so there's no consistency. Shutting down sports is a mistake for too many reasons that I have allotted time tonight to explain. I'll close tonight by saying that the communication during this process was vague at best, and this is unacceptable. Parents have the right to know what's going on. Any questions that we asked about how the athletic environment is different with respect to transmissibility of COVID than the classroom, than a school bus, or even a restaurant were met with silence. The kids are ready to play. Stop the delays. Let them play now. Everybody else is. Thank you.
Thank you. Our next speaker is Catherine Brady.
Good evening, and thank you for the opportunity to speak to the committee this evening. Catherine Brady, I'm a mom of 3 and live in Charlestown, 1 BPS grad and 2 current 9th graders at Charlestown High. I'm here to talk to you about the proposal that you will consider next week to close Charlestown High and open an innovation school. And I want to strongly urge you to vote that proposal down for a couple of reasons. As was mentioned earlier, it was developed with a lack of transparency and input from the community. And as a result, it missed really what I see as the magic that has happened at Charlestown High. My younger sons went from being discouraged about school to engaged, advocating for themselves. And really, one of them in particular went from saying that math was his least favorite subject to now, just in the short time, that they've been in school to saying that it is, again, his favorite subject. So while we can look at numbers and results, it really doesn't portray the full picture of what is happening at that school. Secondly, the model that they're proposing as a replacement really alarms me. And as somebody that has parented a child through an exam school, and then had to find and advocate for an option for my younger sons who needed something different, I firmly believe that we need better options for all students across Boston Public Schools. The model that they're proposing is not it. What it will create is a high school that will be fed from 3 elementary schools in the city, elementary schools that really don't represent the majority of the population in the city. And finally, it will be supported, or they're proposing that it be supported by a nonprofit that research has shown that nonprofits that fund one school really just elevate that school at the expense of the system as a whole. So I encourage you to vote the proposal down. Thank you.
Thank you. Our next speaker is Chris McGrath. Chris is not signed in, so we'll move on to Susie McGlone.
Hi, my name is Susie McGlone. I'm a teacher in Boston Public Schools, and I am here tonight to talk about something that is continuing in Boston Public Schools. But I first wanted to just give a shout out to Miss Rafi Blanca Garcia, who worked a lot with me at Orchard Gardens on a lot of wonderful family stuff. And this is the first public comment I've been to since she's been on the school committee. So I'm really glad that she is here working along with the rest of you. So what began, or I guess continued this past Saturday, was a program called Freedom Dreaming. And it is a program that has as its goal to be a movement of educators, students, families, and communities using theory and practice of really great educators and people from the community to create better schools and better systems for our students and the community. And so it started last Saturday, 10 to 12 on Zoom. We kicked it off with BPS parent, educator, and alum, Alicia Wedderburn, who's also a science coach, and Evelyn LaRose, a science coach, talking about high quality STEM education and being culturally responsive and teaching STEM with an equity lens. Our next one will be on Saturday, February 5th, also at 10 a.m. on Zoom. And that one will feature Sharon Hinton from Black Teachers Matter and Dr. Tony Vandermeer from UMass Boston. They will be talking about resistance, rebellion, resilience, redemption, reparations, restoration, and rest, what we as a people use to survive and thrive despite the oppression, inequality, and isms of life presented by us. And so I just wanted to put that out there. There will be more information coming. I wanted to say thanks to Dr. Eccleston and Mr. Palumbo and Ms. Camillo for getting the word out about that. And we invite all educators and families and community members to it. Thank you.
Thank you. Our next speaker is Andy Graw.
Hi, can you hear me?
Yes, good evening.
I'm starting my video. Okay. Good evening. My name's Andy Groh. I'm from Charlestown. I'm the father of 2 students at Boston Latin School, a high school senior and freshman. And I'm here tonight to make my case on behalf of the student athletes of BPS for the immediate reinstatement of team sport activities. And I do this for its impact on the total health and wellness of our kids. For background, I've been an active member in the Charlestown community and have been engaged for over 15 years, serving as a coach, league organizer, and active board member for various youth programs, including basketball and baseball, Little League, and Babe Ruth, as well as contributing more recently to various capacities for high school teams. I've had the privilege through these experiences to engage with hundreds of youth from various backgrounds and cultures. I've watched them grow up. Many of them are high school age now, so I speak on their behalf too right now. I've seen firsthand the positive and measurable impact of competing in athletics and what it has on their development as an important supplement to their classroom activities. Some things include learning commitment and hard work, teamwork and working with others, discipline, time management, sportsmanship, as well as the mental and physical health benefits of being active. That includes, and it's more appropriate now than ever, maintaining a strong immune system. And it also provides a face-to-face social outlet. In the context of BPS athletics, playing for and representing your school is a unique extra that provides a further connection and fosters loyalty and a sense of belonging, which our kids need right now. Other points I'd like to note: the scientific data suggests this variant poses minimal risk for serious illness. And while the infections are rising, the number of hospitalizations with COVID, not from, is being examined and manageable, as well as the death rate. This won't be the last variant we have to live with, and the high immunization rates make this a manageable disease. Even such, all our student athletes are already adhering to the strict and regular protocols. The teams have proven they can successfully navigate through these steps, as evidenced through the past seasons leading up to this time last year. As noted before, other schools, colleges, and professional teams within Boston are competing through relaxed guidelines, as well as the MIAA and other school districts in the state and across the country. Finally,
Mr. Groff,
high school athletics.
Excuse me, Mr. Groh, I'm afraid you're past your time.
Okay.
Thank you.
Just wanted to close and say this is important to get back for the kids. Small window. Thank you.
Thank you. Vivian Ho is not signed into the meeting. Our next speaker will be Katie Kersey, followed by Anna Shapiro, Kevin Fitzgerald, Cecil Carey, Yara Perez, Sarah Horsley, Sulika Soto, and Nancy Minucci. If you could please raise your hands in Zoom. Katie Kersey.
Hi, can you hear me?
Yes, good evening.
Hi, my name is Katie Kersey. I am a West Roxbury resident and a parent of a K-2 student at the Kilmer. I'm speaking tonight to advocate for remote schooling for the students in Boston. It's time that we defy the state's mandate on in-person learning and go remote. I'm not asking for a permanent return to remote learning, instead an emergency solution during this current surge of cases to protect the people of our city, especially our children. Up until this past summer, I taught special ed for BPS for 12 years. I had to make the difficult decision to resign because I have a 3-year-old son who's high risk for COVID complications, and I felt I couldn't keep him safe if I was going into a classroom. I know that there are staff members who have high-risk loved ones, and they worry every day about exposing them to COVID. Please defy the state's mandate on in-person learning and allow a remote option for students and staff in Boston. I'm so grateful for all the staff supporting students, especially the amazing staff at the Kilmer where my daughter is thriving. My husband and I decided not to send her back to school after winter break. She hasn't been back since Christmas. The risk of her bringing home to COVID to her at-risk brother is too great a risk for our family to take on right now. Having to weigh our daughter's social and academic needs versus our son's potential health complications has been extremely difficult for our family. Please defy the state's mandate on in-person learning and allow a remote option for the students in Boston. My son just turned 3 and he has qualified for an IEP with BPS in a self-contained K0 classroom. He has developmental delays that have no doubt been exacerbated by lack of social interaction during the pandemic. His pediatrician advised me to reject the classroom placement on his IEP because the risk of him catching COVID and developing serious conditions is so high. As a special ed teacher, I know how important it is for him to get services now as a 3-year-old, but I also know that the skills he gains in the classroom will mean nothing if he catches COVID and ends up on a ventilator, or God forbid, worse. If there were a remote option available, he could get the services he desperately needs, and the many special education, ELL students, and other students with high needs would have a safe place to learn while their peers access instruction remotely. Please, it's time to defy the state mandate on in-person learning and allow a remote option for the students in Boston. Thank you.
Thank you. Our next speaker is Anna Shapiro.
Hello. Hi, my name is Anna Shapiro. I am a 7th and 8th grade science teacher at Charlestown High School, and I'm also an advisor for our student government. So today at our student government meeting, I showed my students some of the plans in the prospectus for the Innovation and Inclusive School, just to show students what is being proposed and to get their feedback about it. And I wanted to share what their thoughts on the proposal. We went through a summary of everything, and they really wanted me to focus on 2 things. The first thing is the proposed schedule in the prospectus is from 7 a.m. to 5 p.m. All of the students immediately rejected this idea. Many pointed out that they live all over the city in East Boston and Roxbury. They're having to wake up really early to get to school at 7:30, and the 7 a.m. start would be worse. It's already pointed out to them that this new plan might not actually be designed with them in mind, even though they are technically guaranteed a spot if the proposal were to go through. They also pointed out that ending at 5 p.m. would involve them traveling home in the dark. And again, these are 7th and 8th graders. They also cited that their mental health needs were not going to be met by this proposal, and that they need to have some time to have lives after school. It was not lost on any of my students that their opinions weren't solicited by the people who wrote the proposal, and that the people who wrote the prospectus were not currently part of the Charlestown High School community. The other piece of the proposal that students wanted me to talk about is that the proposal includes firing all current teachers to rehire new ones, or to invite everyone to reapply to the jobs. Students said that the connections they've made with their teachers are important. They really want to be able to visit and continue to be connected to them throughout the 7-12 experience. Our students are brilliant. Their voices should be centered in decisions for our school. Thank you for your time.
Thank you. Kevin, Cecil, and Yara are not signed into the meeting. So our next speaker will be Sarah Horsley.
Hello, good evening. My name is Sarah Horsley. I live in Jamaica Plain, and I'm a parent at the JFK Elementary. I'm also part of the group BPS Families for COVID Safety. We represent families in over 25 schools, and we work alongside nurses, educators, and other allies. We stand in solidarity with BSAC and students. For months, we've been calling on BPS and city and state officials to enhance ventilation, ensure consistent and equitable pooled testing, and prompt and reliable contact tracing, to increase the vaccination rates for students, to provide remote learning options for those, especially those in quarantine and isolation, and to ensure equity in all COVID safety efforts. Now with the Omicron surge, we are also calling on BPS to provide better quality masks for all students, such as KF94s. We appreciate steps BPS has taken on some of these pieces, but there are still many problems. Testing and other systems are not working to keep students and families safe. For example, we know of several schools that as of Monday have not received results from their pool testing from last week. We know of several schools that were supposed to do pool testing yesterday, and CIC refused to reschedule them for another day this week, so they won't have pool testing this week. Yet, and in addition, BPS is drastically underfunding the shift to school-based contact tracing and setting it up for failure. Like all of you, we recognize that pivoting to remote should be a last resort. However, in light of the Omicron surge and the broken testing in other systems, we call on the mayor and BPS to pause in-person learning for a short period of time, such as 2 weeks, so that these systems can be fixed. We know that the state's rules are often roadblocks, but please know there are families, public health professionals, state legislators, and others who are urging the state to change their policies. Mayor Wu, Superintendent Caselius, and the school committee, we will support you to stand up to the state. Thank you.
Thank you. Our next speaker is Sulika Soto.
Hello, my name is Selena Soto. I'm a BPS parent and advocate, a member of Beja and BPS Families for COVID Safety. I'm a Blackstone and Tech Boston parent, and I live in the South End. Families for COVID Safety and Beja stand in solidarity with BSAC and students. Although there may be light at the end of the tunnel and BPS leaders may believe you have been doing a good job, students, families, nurses, educators, and other staff are now at a time of crisis. And like Dr. Caselius said, much uncertainty. Nurses are burned out, but it shouldn't have to be this way. For months, we have been calling on BPS and city and state officials to take steps for every school, including enhancing ventilation, especially during meal times, guarantee consistent pool testing, along with better plans for communications to families to increase participation in these programs, as well as to increase the vaccination rates. All COVID safety efforts, especially if we're thinking about a vaccine mandate, we first have to assess the inequities and impacts that will have on our Black and Brown students who already have trouble accessing a quality education. Until better systems are put in place, it is time to activate a circuit breaker to reduce in-school transmission and put a pause to in-person learning until we can make these systems work and increase access to vaccines. We are in crisis because of lack of planning, not because parents are sending in their kids to school sick. Beja also stands in solidarity with the PA Shaw community. Like the Shaw community on November 3rd, I came before this community to speak about the concerns, myself and parents from Mendel and Sumner had about not being part of the sixth grade expansion. In particular, we ask that you protect our schools from financial consequences for enrollment disruptions next year. And given the unique circumstances that we were facing, we explained that how that would allow us to engage in the process from a place of trust and confidence. Once again, that trust and confidence has been broken. There has not been funds allocated for us to support the 4 additional classrooms that are going to be added to our school. This is despite ESSER funding, despite soft landings. We are set to lose about $400,000 in our budget and a paraprofessional. This is a school that is already understaffed. We are struggling, and we ask that you adopt a no harm policy when it comes to budgets when there is decline in enrollment in our schools. Beja requests that the school committee commit to no unnecessary disruptions to any student or learning community until there is at least 1 year of steady learning. Again, there should also be a pause to in-person learning until we could get systems that work in place. Thank you.
Thank you, Ms. Soto. Our next speaker is Nancy Minucci, followed by Jill Harris, Jennifer Gordon, Sarah Parker, Jason Jones, Hugh Coleman, and Patrick Keating. If you could all please raise your hands virtually in Zoom. Nancy Minucci. Nancy Minucci. Yes, good evening.
Hi, my name is Nancy Minucci. I'm a parent of 2 kids at BLS.
Nancy, could you please, I'm sorry to interrupt, could you please turn on your camera for us? There you are. Thank you.
Okay. I'm very confused as to why we are at a point in January with the windows open. I haven't heard of any school. Every person I've talked to throughout the state, schools' windows are not open. We had more money than we've ever had to fix our ventilation systems. It is January 2 years later, and we haven't fixed it. We haven't fixed the problems that we've had. I don't understand the planning here. I have videos of the rainy storm in September where the kids' desks are full of water. It's not acceptable. The wind was blowing, the windows are open. The kids are gonna don't even have to worry about COVID, they're gonna catch pneumonia. It's freezing. I don't understand what the money was spent on. I am beside myself trying to figure out why anybody going forward would want to send their kids to BPS. And as a matter of fact, after speaking with friends, they're saying their private school had the highest enrollment it's ever had last year, and their applications are up 85%. And that's a school in Boston for high school. We have to do better than this. This is not fair. Shutting school sports off for kids is crazy. Nobody else was shutting sports off. Every bar in Boston is packed. The lines are down the street. The kids are saying, why aren't we playing sports? But everybody else is out doing their thing.
30 seconds.
We're sending we don't want kids in Boston. That's how I feel as a parent, that you don't want families anymore, and that BPS isn't doing what it should be doing to keep families. Thank you.
Thank you. Jill Harris is not signed into the meeting, so our next speaker will be Jennifer Gordon.
Hi, okay, I guess you can hear me and see me at this point. My name is Jennifer Gordon. I am a resident of Brighton, and I am a parent of 2 boys who are track team athletes at the O'Brien School. You've already heard a lot about athletics at this point, and I was very glad to hear that the schools have relented on their rather ill-considered decision to disrupt sports. I'm speaking very slowly for the sake of the interpreter. I know she's getting very tired at this point. I'm bothered to hear that there's going to be a continued delay for competitions. Look, my kids are track kids. They were very disappointed when the announcement came out on the 23rd of December saying that sports were going to be suspended. They had worked hard to qualify for some competitions that were happening over the winter break, competitions that their peers in suburban schools, well-resourced peers, were able to compete in. There's an equity issue here. You know, the kids need to be able to compete for the sake of being able to access not only that sort of sense of satisfaction you get, but also the ability to compare yourself against the kids who are extremely well-resourced. On top of that, you know, you've already heard all sorts of things about the importance of athletics, and I'm not going to repeat that. But one thing I haven't heard is the way that being in competition gives you access to be able to be seen by college coaches. And, you know, yeah, let's be realistic. Track is not going to be some sort of full scholarship to schools by any stretch, but my kids are both over 4.0s. And they'd like to be able to have a shot at it. And you all know how student debt works. You all know how compound interest works. Every dollar counts. But unless they are competing, they can't be posting times that are validated. They can't be running against the suburban kids who are getting all of the chances, all of the visibility, and frankly, all the resources.
Excuse me, Ms. Gordon, I'm afraid you're past your time. If you could please wrap up.
Yep, my kids feel safe in school. My kids have been continuing to practice running on the streets of Roxbury together. They might not catch COVID, God forbid they're hit by a car. Please be careful with your decision making. Not all sports are the same. Thank you.
Thank you. Our next speaker is Sarah Parker.
Hi, can you hear me?
Yes, good evening.
Hi, good evening. Sorry, I'm just going to, 1 second. Was on my phone as well. I apologize. Okay. My name is Sarah Parker. I'm a proud resident of West Roxbury. I'm a mother of 3 students, a 6th grader, a 3rd grader, and a 1st grader at the Linden School. And I'm also a member of the Citywide Parent Council. Dear School Committee and Superintendent Casilius, I'm here to testify tonight and ask you to strongly consider who you are truly benefiting when and if you do decide to go remote district-wide. Some are urging for remote, but I promise this is the minority, not the beliefs of the majority. The siege is already trending down per Dr. Sanchez's earlier presentation. Using children who are not physically affected by Omicron the same way as Delta variant or the original variant as a shield to control spread is not appropriate and frankly harmful. We cannot continue to allow our children to suffer. Students need to be in-person learning, receiving services, hot meals, social and emotional support, connections with other children, teachers, and staff. BPS students cannot afford any more social, emotional, mental health, and learning gaps. They simply cannot. The majority of BPS students do not have a parent or caregiver who can stay home with them to make sure they are logged on, safe, and supervised. They don't. You know it, and I know it. Middle school and high school students are in crisis. Not my words, but the words of BPS administrators, staff, and teachers. The damage that has been done to students from over 18 months of remote learning cannot be undone. Do not perpetuate the damage by canceling sports, clubs, extracurricular activities, and most importantly, by going back remotely. We need to move forward. We need to get back to some normalcy and consistency for students. We need to show up for these kids. We need to show up for this generation of Bostonians. I respectfully ask the committee to resume athletics immediately and not wait until the 18th or the 24th when you said you could start the games, and strongly consider the further damage and destruction that will be done if you decide to go remote again. Thank you for your time.
Thank you. Our next speaker is Hugh Coleman.
Hello.
Good evening.
Good evening. How you doing? Thank you, everyone, for this opportunity. My name is Hugh Coleman. I am currently the head boys basketball coach at Charlestown High School. I am also the culture and climate coordinator at Charlestown High School. I am born and raised here in Boston. I lived here my entire life, 44 years. For 38 of those years, I've been a part of the Boston Public Schools as a student, high school, graduate, went on to college. I started my career 20 years ago. This is my 20th year in the district at Charlestown High School. I'd like to speak on a few elements that were brought up here tonight. Mainly this idea around equity, inclusion, and choice. I know that the superintendent and the school committee, the powers that be, they all have to make very difficult situations. The theme that I heard consistently tonight from folks is that they do not feel like they were included in the decisions that were made. The decisions that were made for so many don't feel equitable, and it's not fair. Obviously, one thing has to do with sports, and us being in Boston and other folks around the other districts around us being allowed to play and participate in a safe manner, and assuming that we're not able to do so, that has not felt very fair to the student athletes or the families. In person versus remote options. There have been families on one side that like to be remote and others that like to be in person because of the mental, social, and well-being of individuals on both sides. However, it doesn't feel like there's been much inclusion or equity on either side. And lastly, I'd like to quickly speak about the vaccine mandate for folks who, for whatever reason, whether it's religious, medical, or personal, who are not vaccinated, are on the verge coming this Friday and Saturday of potentially losing their jobs, such as myself, who have been a member of this community his entire life and have done everything in his power to educate, mentor, motivate, inspire, and educate the youth and the families. And you have placed folks in a very hard position between being stuck between a rock and a hard place of making a choice between doing what's best for their families, like having a job and feeding them, or coming to work and trying to support those folks. So I really, yes.
I'm afraid you're past your time.
Thank you. I will wrap by saying thank you for this opportunity, and please, please consider to be equitable and be inclusive as we've talked about this entire school year. Thank you.
Thank you. Our final speaker is Patrick Keating. Patrick Keating with us? Patrick?
Hello. It's
Good
taken
evening.
some time. I'm sorry. It took some time to connect. I've been listening to the entire proceedings. Thank you so much. My name is Patrick Keating. My daughter attends the John D. O'Brien, and we live in Dorchester. I understand that practice is resuming, hopefully, on the 17th and possibly games on the 24th. Boston Public School student athletes have endured almost, I think it's 18 months of shutdown prior to this. There's a lot of benefits to sports, and it's fitness, socialization, but I want to talk about the opportunity to leverage athletic performance for college admission. To utilize this opportunity with college admission, students need documented metrics. Mile times, yard runs, completed passes, goals scored. All of these are objective measurements like science, right? And to do this, students need to compete with other athletes and teams, including teams from other districts, which my athlete does track and field, and her invitationals are done at the Reggie Lewis in Roxbury. The recent closure was done at the start of the holiday break
20 seconds.
and was cited by the Boston Public Health Commission. I have 3 questions. Number 1, what are other school districts doing to keep their athletes open that BPS is not? I'm going to say that again. 1, what is other school districts doing to keep their athletics open that BPS is not? I see buses still dropping off students from around the state at the Reggie Lewis track in Roxbury, which is on the same block as the John D. O'Brien, where my student attends, and athletics is shut down. Number
Mr.
2,
Keating?
why was there zero effort to reduce risk before the shutdown? As Ms. Lopera and the Cambridge School District has issued mandates for vaccines, and the FDA has authorized
Mr. Keating?
ages 5+. No, I'm not done yet. I'm not done. I'm actually not done. And number 3, why has the data used by the Boston Health Commission recommendation to shut down athletics not included in their decision? I want to see I want to see the data. I want to see the data.
Excuse me, Mr. Keating, you're over your time.
Up to date on their vaccines.
Mr. Keating,
Require
you're out. You can put your comments in
Require
the
vaccines and get sports back in the schools.
Thank you.
Thank you.
Chair Robinson, that concludes our speakers for general public comment.
Thank you, Ms. Sullivan, and thank you to those of you who spoke this evening and shared your perspective. Your testimony is very important to us. Our first and only action item this evening is grants for approval totaling $400,174,120. I'll now open it up to the committee for questions and comments. Are there any comments, questions? Ms. LaPera.
Thank you, Chairwoman Robinson. I believe one of the pieces that is listed on there, just in terms of receiving for grants, is around ESSER. And so I was wondering, last time the ESSER information was brought before the committee, there were some outstanding questions related to where we were with disbursement on, be it ESSER 1, et cetera. And so specifically around the schools and their allotment. And so it would just be helpful to just get a little bit of an update on where we are with ESSER pieces.
Good evening. My name is Dr. Yvonne McCray. I'm the Director of Grants and External Funds. The information you are looking at is only for ESSER 2 and ESSER 3 for City of Boston to approve it, so we will be able to upload the budget lines. ESSER 1 is completed. That was since 2019, 2020, and that grant ended the end of December of 2021. ESSER 2 is being disbursed to schools. Schools are applying for it, but I'm not going to go into details as the Chief of Accountability is responsible for the allocation to schools. So schools are applying for the funds and they're receiving them right now.
I can share, Ms. LaPera, and we could get you a better detail from what has happened over Christmas break for the final schools that are receiving their ESSER funding. 86% of schools, that's 97 schools, have been approved in the required rounds of 2 and 3. And all school plans are shared in our public report. Out of the remaining schools, one school is not yet submitted, and we're working diligently with this school. 2 schools need to revise their proposals, and 13 schools are currently under review after submitting their revised proposals late December and early January. So we're still working with those final schools on their submissions for their plans. As for the FY 23 school year, those schools, their funding is going through a collab process with our operating budget to align both the operating budget, their Title I budgets, and their ESSER budgets so that they're aligned to their school plans.
Thank you for that. Appreciate the update.
Are there any other questions? No other questions? Okay, if there are no further questions, I'll entertain a motion to approve the grants as presented.
So moved.
Thank you. Is there a second? Ms. Sullivan, will you please call the roll?
Dr. Alkins,
Yes.
Ms. Lopera,
Yes.
Ms. Polanco Garcia,
Yes.
Mr. Tran,
Yes.
Mr. O'Neill,
Yes.
Ms. Robinson.
Yes,
The grants are approved unanimously.
thank you. Our first report this evening is a presentation on the Homelessness Education Resource Network, also known as HERN. At this time, I'd like to invite Brian Marks, Senior Director of Opportunity Youth, to please present this report. First, I'd like to invite the superintendent to provide opening remarks.
Well, thank you so much, Madam Chair. I know that last committee meeting, you had said that you wanted to have a little bit more in-depth information about the work that we are doing with HERN and our incredible partners that we have at Higher Ground as well. And I'm certain that Brian Marks will speak to that. He just does such a wonderful job with our families, as you saw earlier with his update on attendance as well. So excited to have him present to you, and then we'll take questions afterward.
All right, thank you so much, Madam Chair, the members of the Boston School Committee, and Dr. Casilius for the opportunity to present this evening. As Dr. Casilius mentioned, I'd like to provide an update and overview of the important work that we're doing to support our precariously housed students through our Homeless Education Resource Network, or HERN. We have a committee known as our HERN Community Coordination Council that's made up of diverse stakeholders, members of the community, experts in the area of homelessness and housing insecurity that help us put together our strategic vision and strategic plan. We review this on an annual basis to see if we're meeting our objectives and intended outcomes. And we update it every 3 years. And a key part of that is also making sure that it's aligned with the overall district strategic vision. So in terms of our goal, we want to ensure that we have the human and resources capacity to respond meaningfully to students experiencing homelessness, putting each student on a clear path to academic success. And key to this is our mission to connect schools and families to the right resources and training, so students experiencing homelessness are not defined by it, but have the capacity and equitable opportunity to learn, achieve, and thrive. We have a range of priorities as part of this strategic vision. Part of it is, a key part of it is building capacity at the school level to increase access to resources, services, and support. Developing systems and strategies for greater communication and collaboration, significantly increasing awareness of available homeless-related services, and increasing awareness of eligibility among students, their families, school leaders, and support staff. Eliminating inequities by aligning services at the school level that are agile and responsive to the needs of all students, as well as closing opportunity gaps by adopting an asset-based approach, and approaching the work from an understanding of how the overall challenges of high cost of living in Boston impact families and create risks for homelessness beyond only those who are experiencing extreme poverty. So oftentimes we understand that families experiencing homelessness can find themselves in a situation where generational poverty might be occurring. But we need to also look at a broader lens of all of the families and circumstances that might be impacted, particularly among circumstances of a global pandemic. This schematic right here just shows how we really want to work to make sure that we're connecting at a macro level key organizations, resources, policy information, and strategic initiatives at the school level, but also work with schools to help them build capacity and build local ecosystems. So they're aligned with key partners, they have relationships with key partners, and they're creating a hub of support for students experiencing homelessness within their school. Some of the work in terms of how we provide supports, we work with 175 school-based homeless liaisons. So every school across the district has at least one staff person who is designated as a school homeless liaison. And oftentimes this might be a social worker, a family liaison, many school nurses, guidance counselors, schools that have directors of engagement and community supports oftentimes are in this role. This person will serve as our key contact to coordinate programming, to help connect resources, refer families, to be available for students and families to request additional support. We provide training in a similar way to district homeless liaisons, and I serve as the district homeless liaison. So we actually partner directly with DESE, the Department of Elementary and Secondary Education, to provide that same level of training. We have a HERN toolkit for schools that schools have available to be able to have resources readily available, and I'll share some examples of those. There's been considerable investment around more effectively supporting students and families experiencing homelessness. So the city has invested approximately 1.9 million that's allocated directly to school budgets using the weighted student funding. So there's a per pupil allocation for each student that's been identified as experiencing homelessness in that school. And then there's also a concentration allocation. So if 5% or more of the student population in that particular school are experiencing homelessness, there's an additional per pupil allocation. We also are required to ensure educational stability and access for students. So this means immediate enrollment for students that have been displaced due to homelessness without barriers, providing transportation for students who have been displaced out of the district to continue to attend their school of origin. We have specialized programs and resources that I'll touch on. We support with case management, consultation, referrals, particularly navigating complex cases, providing assistance with basic necessities, and then coordinating with community partners and city and state agencies. Here we just outline a variety of the programs and support that we help to connect or that we offer directly. So this includes partnering and providing access to citywide services and resources. Food access is a critical resource. Mr. DePina earlier this evening mentioned some of the food delivery, and that was actually a particular effort around students experiencing homelessness, families that had been displaced outside of the district and didn't have access to the in-school meal program during remote learning. We leveraged private transportation vendors to deliver meals directly to those students throughout remote learning. Providing technology access A good example of this has been ensuring access to hotspots for students who might not be able to utilize the Internet Essentials option through Comcast if they're experiencing homelessness and they don't have a lease on an apartment. Clothing and hygiene items, housing support resources, including housing vouchers and emergency assistance programs, resources for immigrant families in particular. So making sure that we have strong partnerships with community organizations that have services and support for immigrant families. And then medical and healthcare. We often utilize Help Steps as a resource that is useful to navigate a variety of different services where you can look it up by the service type or the neighborhood and location. And then a key effort in general, a common thread throughout all of our work is ensuring priority access to BPS programs. And by that, we really mean equitable access. We've done significant work to improve our identification. So you can see that over the past few years, we've had between 4,000 and 4,500 students identified as experiencing homelessness. But going back to school year 16-17, it was only 3,200 students. And it was clear that community estimates and some of the projections from other organizations were pointing to the fact that we were identifying far fewer of our students experiencing homelessness than truly existed. So identification is critical because it's the first step to connecting key services. So some of the work that we've done is increased access to data at the school level, streamlined identification as well as streamlined identification and referral processes. We know that our students experiencing homelessness are disproportionately represented by students of color. We do see slightly higher rates of students with IEPs among those experiencing homelessness, but significantly higher rates of students who are in English language development programs. And then also lower attendance. So across all regions in the district, the average attendance rate for students experiencing homelessness is about 3.5% lower than the district average. And we also see lower MCAS scores. Part of our vision for how we're trying to better support students experiencing homelessness is through stabilization. So historically, and as expected across all school districts in the nation, educational stability is a big part of that. So ensuring immediate access to enrollment, ensuring transportation to continue to attend the school of origin, equitable access to other programming that ensures educational stabilization. But we also know that housing stabilization and adequate wraparound services, a two-generation model to approach homelessness, is equally as important to truly stabilize our students. So a lot of our work is focused on partnering with housing organizations in Boston. So one particular initiative that we will be restarting in February is our early homelessness intervention program. And we've actually been able to infuse a range of private dollars through our partner Family Aid Boston, along with ESSER funding to restart this initiative with an aim at having sustainability over a 3-year period. And this partnership allows direct referrals across all BPS schools through school homeless liaisons. It provides a range of services, including customized case management, wraparound support. So this can be housing stabilization support, including voucher access, access to healthcare, childcare, and other services. We have emergency assistance funding available to prevent homelessness for families that are at risk of falling into homelessness. So financial assistance, in particular for families that are ineligible for city and state funded programs. It also includes landlord engagement and issue resolution support, a crisis shelter, as well as employment and training support. So this is a very broad range of supports that a school-based homeless liaison can refer the family into this program and get that customized case management support. Another really truly groundbreaking initiative, and I think this is a testament to leadership across the city, including the advocacy of Dr. Casilius, which is our housing voucher partnership with Boston Housing Authority. The city actually changed its policy in 2020, which enabled eligibility for all BPS families under the McKinney-Vento definition of homelessness to be eligible for Section 8 vouchers. So what that means is oftentimes housing initiatives, HUD-funded, housing and urban development funded initiatives would not include families who are doubled up as part of their prioritization of homelessness families for housing vouchers. We know historically that we've had approximately nearly half of our families experiencing homelessness have been in shelter, and nearly half have been doubled up. So we have a huge percentage in a large number, approximately 2,000 students in any given year who are doubled up, experiencing homelessness. Their families are unable to have housing of their own, who are not eligible for these critical Section 8 vouchers. This policy shift has enabled us to house over 550 families since June 2020. And that's a very significant number. 80% have been able to secure housing within Boston. So the ultimate goal here is we want to make sure that we're stably housing families, but we didn't want to inadvertently create a push-out mechanism that was going to actually displace families from their neighborhoods and from the city of Boston. So that number of having over 80% able to continue to reside in Boston is also very encouraging in terms of our outcomes. So this program includes an infusion of private and public dollars. We're aligning, again, housing and urban development funding with Department of Education funding to ensure case management services for these families. So they're assisted with the application process. They're assisted with housing search to actually find an apartment once they're awarded a voucher. And then they also are enrolled in supplementary wraparound services based on their needs, which may include medical or behavioral health care, child care, employment services, and so forth. And that case management stays with them for a considerable period, at least a year after they're stably housed. Here's an example of the types of tools and resources that we not only provide to schools, but we train them as well. And they certainly can pick up the phone and call a member of our team at any time for questions, additional support, guidance. But we want schools to have the tools and resources directly within their building so that they can work with families. They have strong relationships directly with the families in their school. This is a housing needs decision tree that we designed specifically for Boston and for the circumstances amidst the pandemic. So for instance, a school homeless liaison or a family liaison or a social worker can use this decision tree to provide the best first referral for a particular family's circumstance, whether they're currently experiencing homelessness or at risk of losing their housing. So this is something that, if you can imagine, you can easily post it on the wall. And the housing resources, the shelter and housing system can be complex for folks that are doing it on a day-to-day basis for a long period of time. It's particularly complex for families to navigate. And for our staff, that they have a lot that they're juggling at the school level, trying to support all the various needs of students and families. This isn't something that is always going to come naturally in terms of the right first point of referral, but making that right first point of referral helps to reduce frustration for families that are already dealing with so much. And part of our goal is to be there to support families and navigate them on the path to stability. Some of the strategic initiatives that we have include, again, priority access. So we provide priority access to all BPS summer programming. So this includes nearly 900 students who are experiencing homelessness participated in school year 2021. Admission to exam schools. So I know all of the members of the school committee are very familiar with some of these changes, but we saw that enrollment increased by 34% among students experiencing homelessness from school year 2021 to 21-22. We also have, as Dr. Casilius knows, expanded our academic mentoring program with an opportunity youth focus. And part of this approach is, this is in partnership with the academics division, as well as equity strategy and opportunity gaps. And it's designed to meet the needs of high priority students across BPS, including students experiencing homelessness. So we're using a no wrong door approach to the student interest in recruitment process, and student agency and voice guide the matching process. So as they're comfortable, they have the opportunity to share their own unique lived experiences, preferences, and interests, and those responses are matched with the responses of the mentors. And of course, we have an interview process and training, and it's not a matter of just creating a formula, but our goal is to try to align those student preferences to find a good match with a mentor. Of course, we provide basic necessities like backpacks, winter coats, and other items, hygiene items, sneakers. We partner with OIT to provide Chromebooks and hotspots. And then we're always looking for unique situations where we need to remove barriers. I think a good example of this is the pandemic EBT cards. We created a workaround in partnership with OIT to ensure that students who are experiencing homelessness, who often have frequent address changes, so thereby the addresses that we're going to send from our system to the state might not always be accurate. We created a workaround, and over 90% of students experiencing homelessness ultimately activated their PEBT card to get critical food access resources. I'll just wrap up by sharing a little bit about our youth-focused initiatives. So unaccompanied youth is a critical population of BPS. These are students who are not only experiencing homelessness, but they're also without their parent or guardian. And the services that are available and the services and resources that meet their needs are very different oftentimes than those for a family experiencing homelessness. So in partnership with the city's Department of Neighborhood Development, as well as in consultation with DESE and DCF, the Department of Children and Families, we developed a youth triage tool. This is designed to help school staff who may have a young person, perhaps a 17 or 18-year-old student, who indicates that they come and share that they don't have a place to sleep that night. This helps to facilitate a guided conversation to ensure the immediate safety of that student, conduct a needs assessment, and then open the door to have a follow-up meeting to develop a plan to stably house that student. And then we also have, in partnership with JRI Youth Harbors, housing peer navigators that are available for all high school students across the district. This is a critical partnership. So this is also a connection point between BPS and the city's Rising to the Challenge initiative to end youth homelessness. Over 200 youth have been served through this program. And some of the services include housing search and stabilization support. Again, it's more youth oriented. So a young person we may have a senior who's 18, and they may be in need of housing, and they may need a roommate, and perhaps some connections for a job that will that they can work around their school schedule, and also some support, guidance, and mentorship on the path to post-secondary education. That's an example of the type of service that the Housing Peer Navigator program will provide, along with financial assistance within that case management support. And we're always here to help. I have our assistant director's information here because he really is the go-to person on our team when it comes to all things supporting students and families experiencing homelessness. Again, I appreciate the opportunity to present this evening.
As you can tell, Madam Chair, you can probably hear the care in Mr. Mark's voice and how we have just really done so much over the past several years. In particular, you know, as a child who grew up in public housing and who was highly mobile during my 6th grade year because we lost housing, I understand those kinds of supports that children need, and this is near and dear to my heart. And you know, my love for this work is triply matched by Brian's, and he is just an amazing champion for our kids and their families. And I thank him and his entire team for the work that they do and the care that they take with our youth and with our families. So open up to questions that you have.
Yeah, I want to personally also thank you, Mr. Marks. I'm a long-term member of the Project Hope Board, and so have worked around family homelessness for any number of years, and in the early years also worked with her and families during the summer. And I am just astounded by the growth, the deepness of the work that you all are doing, and how well it has served our families. We even had a testimony tonight by a family during public comment who mentioned that she had received housing because of the work of the district. So I join the superintendent in thanking you greatly for this amazing work. I'll now open it up to the committee for questions and comments. Start, Mr. Tran? Yes, thank you.
Yes, thank you for an opportunity to speak about this issue. First of all, thank you, Dr. Casillas. Thank you, Mr. Marcus, for your commitment. Marks. My pronunciation is always problematic, but anyway, thank you for your commitment and your work in this area. Very similar to Dr. Casillas. My youth, prior to coming to America, was marked with periods, sometimes long, sometimes short, of homelessness because of the war. And you know, my family lost houses moving here and there. In addition to losing houses, I also lost educational opportunities throughout my youth. So this issue is very dear to me because as a victim of circumstances that led to homelessness, I identify myself with these individuals very much. Just one short question. Unaccompanied minor. The legal definition of unaccompanied minors, as I know, is akin to the kind of law that I was aware of and I was exposed to, which is in the immigration law. But in this case, what is an unaccompanied minor? I know that the number is very small, about 81.
Yeah, no, that's a great question, and oftentimes that is conflated. It's not related to immigration status or citizenship at all in terms of this terminology. It's a young person who is not only experiencing homelessness, but also without a parent or guardian. So, part of our work was to establish, is this an automatic for a 51A with DCF if a young person is on their own? Not always is the answer. Obviously, the younger the student, and depending on the circumstances of where they're residing, that might be necessary. But you could have a young person who's staying with other members of the extended family, but not directly with their parent or guardian. Like I mentioned, you could have a 17 or 18-year-old student who's doing really well academically, but could use some additional support to find stable housing and a path to really build on that success beyond high school. We do know that while it's not something that we track or report on in BPS, in our student information system, we know that statewide, there are higher numbers of, disproportionately higher numbers of young people who are undocumented, might actually be unaccompanied. So it is a consideration when thinking about the needs of unaccompanied young people in general, but it's not a synonymous.
Just a quick follow-up question to that. So you are not going to automatically refer an unaccompanied minor in your own definition to social services, to Department of Social Service under 51A? No.
No, and that's actually part of what the triage tool is designed to do. Now, again, the younger the student, and depending on what their circumstances are, if they're not in a safe environment, obviously we're mandated reporters, we understand that. But the part of what the triage tool does is it enables the immediate safety of that student, a plan for the path to develop a plan to stabilize that student longer term, as well as provides the educator or staff person with a much more informed decision about whether filing a 51A with DCF would be necessary, or if there's an alternative path through some of the district and city resources.
Brian, I wonder, do you have laws in Massachusetts? Honestly, I just haven't had a chance to look around emancipation. And at what age is that allowable in Massachusetts?
I believe it's 17, but don't quote me on that. I'm not 100% sure. Actually, our partner JRI Youth Harbors helps and provides a lot of expertise with that particular need.
Thank you. Dr. Alkins?
Hi, thank you for the presentation. And again, the wonderful work around this, can't be praised enough. So I guess my question is more just a simpler question regarding the EHIP, and how simply put, like, how do you plan to get that number from 80% up to 100%? So what about the other roughly 20% that are not able to access that? That's my first question. And then the second question is just, could you speak a little bit about perhaps some of the grants that you might be going after to sort of increase the budget for more resources?
Yeah, sure. So I think your question, were you referring to the 80% or so that have been able to stay in the city of Boston with the housing voucher?
Yes, I'm sorry, yes.
Yeah, so I mean, our goal is, if the families are desiring to find an apartment in the city of Boston, we're providing them the case management support and the housing search assistance to be able to do that. It's a transferable voucher, and ultimately we want to be able to stabilize the families. We're striving to provide every family with that opportunity. So if a family, I'll put it this way, if a family absolutely wants to stay in the city of Boston and they're not even looking at apartments outside of the city of Boston, we are going to make sure that they find an apartment in the city of Boston. So we're partnering with the city to make sure there's extensions on the deadlines around the vouchers so that families have adequate time to find an apartment. The other thing I should point out is even if a family, let's say next month, decides to move to Quincy because they found an apartment they like, they feel like they're relatively close to the community, we are not going to require that student to immediately enroll in Quincy. They're going to be able to stay enrolled in BPS at least through the end of this school year, so they don't have any disruption during the current school year.
Okay, that's great. Ms. LaPera.
Thank you. I first just want to thank Superintendent Casilius and also Mr. Marks for this incredible work, and just to fellow members who have shared their personal experience with this. One of the things that it got me thinking about around the experience of homelessness is, depending on the age of the child, they may not necessarily understand that they're necessarily experiencing homelessness. And so when you talked about the identification pieces, I want to understand what additional strategies are being implemented to ensure that we are identifying all of the students and families that are experiencing this. Like, you saw an increase. What were some of the different strategies that you all have employed?
Yeah, that's a great question. So one of the most important strategies has been the establishment of, well, really there's two parts to this: the establishment of the school-based homeless liaison role, because then we have someone who's particularly focused on making sure that they're connecting the resources with families, they're engaging with families, having this conversation, but then providing that person with access to the data of the students experiencing homelessness in their school. So, going back a few years before we really broadened the network and approach with the school homeless liaisons, schools front level staff did not have access to the information about what students in their school had been identified as experiencing homelessness. Now, part of that is because of the confidentiality protections. We need to be more than sensitive and protective of our students experiencing homelessness, who are among our most vulnerable, because that can be a very difficult stigma to shake, particularly as students become aware of their peers. And if something gets said, even if it's with the best of intentions among staff in the hallway, and another student has to overhear that, again, that could be a very difficult stigma to shake. But by providing access to the school leader and the school homeless liaison, and then allowing them to have the discretion to share that with other BPS educators in the building when it's in the best interest of the child, that has created a two-way information sharing process where they are able to let us know if a student who was experiencing homelessness is now stably housed, so that we can take them off that list. But then we're also sharing the information of families that maybe were referred directly to our office, or during enrollment at a welcome center were identified as experiencing homelessness. So those are really the main mechanisms, but because we've opened up a level of transparency while still very much protecting students' confidentiality, that has allowed us to have much more accurate knowledge and awareness of students experiencing homelessness. And we also provide training on some of the look-fors. We never want to make assumptions about any given circumstance without knowing confidently that, yes, the student is experiencing homelessness, but there are look-fors that can help to engage in certain conversations, with the idea being, let's connect the resources that might better support you.
I appreciate that. Just for reference, I grew up as an undocumented child, and as an adult, I can think back on like the experiences of homelessness that I encountered. But as a child, I would have never been able to identify that. And I know that my family probably also wouldn't have contextualized it, and so therefore wouldn't have sought out specific resources because they didn't necessarily see themselves in that category. We didn't necessarily see ourselves in that category, although we very much were. And so I'm glad to hear that there's a liaison and we are leveraging relationships. I also just wonder what we can be doing to more broadly communicate with families, just resources that exist more blanketly, as just a communication strategy. But really appreciate the work on this. I think many of our students and families are obviously being impacted in positive ways with leveraging resources. And now more than ever, this is a necessity. So thank you.
Thanks.
Thank you. Ms. Polanco Garcia.
Thank you, señora presidenta. Yo me siento tan contenta con esto porque es algo que me identifica mucho a mí, porque yo fui homeless. Yo también estuve sin hogar.
Madam President, I do appreciate very much for this, what you were saying. It is something that is very dear to my heart as well, because I was homeless myself as well.
Y cuando llegué a las escuelas públicas, no tuve la oportunidad de conseguir un programa como este. No, nunca supe que este programa existía. Y así como yo, hay muchas familias que están ahora en esta pantalla, que están mirando y se preguntan, ¿cómo es la navegación? ¿Dónde tengo que ir? ¿Qué tengo que hacer?
When I did arrive, I did not have knowledge of this particular program. I did not know that it did exist. So there are many families in my position when I arrived that they do not know how to navigate the system, where to go, what to do, whom to trust, things like this.
Y quiero decirles que es difícil. Yo duré 30 meses en un refugio de gobierno. 30 meses y no es fácil. La navegación, la espera, los procesos de housing son bien largos.
So I have to say the housing processes are extremely long. I myself went through a 30-month wait process as a government refugee. So those processes could take a long time. I went through that myself.
Y mi hijo no entendía, mi hijo me decía, ¿por qué mis amigos no pueden venir aquí? ¿Por qué yo no puedo jugar aquí en el refugio con mis amigos? Porque no podían entrar ni amiguitos, nadie. La única persona autorizada para entrar era un trabajador social o el maestro de mi hijo Junior.
So at this particular shelter, when I was living where I was living with my son, Junior, he was frequently asking this question, why my teammates or my little friends are not able to come here and play with me. Nobody was allowed to go to that particular place or refuge or shelter. Only perhaps a social worker could enter those places, not everybody else.
Cuando pude entender que un maestro sí podía entrar, ahora mirando este programa, ¿cuán fuerza tiene el distrito educativo? ¿Qué grande es la fuerza que puede tener el maestro? Y digo maestro porque me refiero al distrito educativo y cuántas cosas nosotros podemos hacer como distrito para ayudar a tantas y tantas familias que están en esa situación.
We have to say that the district in that particular regard is very powerful. The fact and the ability that a teacher has to go into these shelters is really powerful. And that is something that is very important and very significant for many families that could be in this particular situation.
En ese sentido, me gustaría preguntar si pudiera existir la posibilidad de que ellos pudieran priorizar las familias de BPS en Boston Housing, si existe la posibilidad de que haya un acuerdo entre Boston Housing para priorizar estas familias que no tienen hogar dentro del sistema público.
So I was wondering myself if within the public system that exists, that it relates to housing, if there is any way to prioritize the families that belong to BPS perhaps in a way of having an agreement with the housing authority, or if any priority could be allocated to those families that belong to BPS in terms of housing.
Y la última pregunta ya para terminar, para que Juan me siga con la interpretación, es la parte de la conexión. Hay muchas escuelas. Esto es importante que los líderes escolares, los principales de las escuelas, tengan esta información para que cuando se realicen las reuniones de padres con los concilios de padres, ellos informen esto, porque hay muchos concilios de padres que esta información no llega. Lo digo por experiencia propia. Yo no sabía de esto y agradezco mucho a la presidenta que insistió para que esto pasara, pero esto hay muchas escuelas que no lo saben ni lo emplean.
I do very much appreciate what the president is doing on this particular program itself. However, we do have to bring awareness, particularly to the leadership in schools and the principals, for example, that sometimes they do not have this information and they are not aware of this information. Therefore, they cannot share this critical information to the parent council. Sometimes there is no awareness. So it is critical that this information becomes available to the leadership at schools and principals as well.
Yeah. Y gracias nuevamente por traer esto.
And thank you very much for bringing into account this particular program, which is very important.
Yeah, thank you, Ms. Polanco Garcia. Actually, we do have just that, and maybe I didn't touch on that point with the partnership with the Boston Housing Authority. But that's exactly what we're doing, is prioritizing housing vouchers for BPS families. School leaders do have access to this information. Certainly, individual student information wouldn't be shared with a parent council. But we'd hope that school leaders would share as it's appropriate to improve the services within the school and help a parent council better understand the needs of the students in that school, aggregate data about students experiencing homelessness in that school. So yes, absolutely agreed.
Thank you. Ms. Mercer?
Hello, I would first like to say thank you so much for your report. Thank you on the behalf of the youth and families that are experiencing homelessness. So my first question is there a projected number of the difference in students that will be helped with this proposal compared to the current number of students that are being helped?
Well, what I try to do is cover an array of programs and services that we have. We went from housing very few families to over 550, and it'll be in the 600 to 700 range by the end of this school year. Just to give a scope in terms of the impact. We've been able to go from identifying less than 10 students who are unaccompanied to nearly 90. And that's a very significant, it sounds like a small number, but those students are extremely vulnerable and absolutely need our support. And that's because we're providing relevant resources to support them. They have a reason to come forward. And with our new, the relaunch of the emergency housing intervention program, EHIP, we will be able to support in the neighborhood of 100 to 150 families for the remainder of this year, and then 100 to 200 families for the following 2 school years, at least through the funding that we have right now.
Thank you. And so my next question is, how exactly will your proposal help to decrease the disproportion of homelessness of students in English language development programs and students of color?
Yeah, that's an excellent point. So we know in general, among our students experiencing homelessness, they're disproportionately represented by students of color when we look at the percentage across the district overall. So inherently, in some respects, with this programming, we are supporting our students of color with this housing stabilization service. We know that among our English learners, not all, but some are undocumented, and therefore, and again, this is not something that we track within our system, but we know that some are, and therefore, actually, they are not eligible for the Section 8 housing vouchers in the same way. That's not a district or city of Boston policy by any means. That is a federal housing and urban development policy. So it's actually prorated based on the number of members of the household who have citizenship status. So if there's 5 members of the household and only one has citizenship status, that proration for the housing voucher might actually make it cost prohibitive, or there might be no one in the household that has citizenship status. So the city has actually put forward city housing vouchers to supplement, to ensure that we can meet the needs of our families who are undocumented or have some members who are undocumented. So certainly that is front of mind for us, and innovative programming in partnership with the city has enabled that. The other thing I'll say is we have translation through our partnership with Family Aid Boston. We utilize interpretation and translation services for all of our BPS languages, to ensure that there are no restrictions in terms of no barriers to access in terms of language. And then directly in our office, some of the services that the district has implemented, including Lion Bridge and Talking Points, have dramatically increased the speed with which we are able to respond to families that speak a language other than one of those spoken by the members of our case management team.
Thank you, I appreciate it.
Thank you. Mr. O'Neill?
Thank you, Madam Chair. My questions have been answered by my fellow members' questions. So I will strictly say, Mr. Marks, thank you. The care and compassion you are showing on this topic and with this population, and the work that you and your team is doing is incredible. So thank you for that. I actually find it very motivating to learn of the work that's going on, the actual work that's going on, not a proposed program, but actual implementation that is happening. And Superintendent, I am in awe of your leadership on this topic. When you first came to Boston, you said you were going to focus on this. You told us why it was personal to you. It was part of your narrative. It was part of the story. And I won't say you put your money where your mouth is, because you put the city's budget with it. You carved out a line item. You told us you were going to do it. And then you went and have done it. And I can't begin to thank you enough for what you've done for one of our most vulnerable populations in the city. So thank you for the impact you are making for many families in the city and many students in the city. Thank you.
Well, all that credit goes to Kate Bennett and Sheila Dillon and Brian Marks and Monica Roberts, who set up a really awesome program to support our families when they're looking for the housing, and the entire team. And, I didn't have much to do with it at all, other than to convene and to push.
Well, it takes a village, and there's no doubt about that. And this is not, Boston Public Schools cannot be the solution to it, but they can help drive the solution to it. This is many departments of the city working together, but you have to form relationships to make that happen, and it has to be leadership to make it happen. I also noticed with interest the term, Mr. Marks, that you used about our unaccompanied youth, called the navigator. And I love that. I would actually love to see that expanded to many more of our students. I have seen the example how Nashville is actually using that term, how they're doing a navigator for every student, almost allowing every student to have their own individualized education plan. And they're actually using that term because it does make sense, right? Our students need someone who see them, who understand them, who can relate to them and help them navigate, so to speak. So thank you for the work that you're doing. This was a wonderful presentation.
Thank you.
Thank you, Mr. ONeal. I have just a couple of quick questions. One is internal. What kind of work is being done within the district to help develop teacher awareness and empathy for these issues, as well as curriculum for young children? I know there are a number of wonderful children's books now written about homelessness, and as a way of developing children's empathy around the situation that families find themselves in. And I'm just wondering how we are talking about this within the district.
Yeah, I think you just spurred some food for thought around potential additional collaboration. I don't know if Dr. Eckelson is still on the call, but perhaps we can explore opportunities to just be more intentional about relevant, material, whether it's books and, learning materials and content that can better highlight this issue without sharing directly what a particular student is going through, but spreading awareness about it. I do know that the teachers union has been doing some considerable work to train some of their staff and leverage some of the experts among their membership. And then we have Jessica Tang herself, as well as some other members of the teachers union, actually sit on our Hearn Community Coordination Council. So we have some direct communication and collaboration through that.
Yeah. Approximately how many homeless students do we have at this point?
So we always use the number from the previous school year because it's really a point in time that if a student was experiencing homelessness for one night in that school year, that they're part of the count. So 4,000 students were identified during the previous school year. Typically, we see it's between 7 to 8% of our total student population.
Yeah. Has the number grown during this period of COVID, or has it remained about the same?
It's gone down slightly. The challenging part is with these major housing initiatives and then the backdrop of the pandemic, it makes it that much harder to see, is this going down because of enrollment? Is it going down because of these housing initiatives? Is it going down because we had a period of remote learning where educators and support staff didn't have as much direct contact with students and families? It's really hard to flesh that out. But we still feel like our processes are on really solid footing in terms of identification. And as we go into next school year and the following school year, we'll get a better sense of the extent to what some of those root cause factors were. It wasn't a huge decrease, but it was a decrease during the pandemic, which was interesting.
Yeah. And my last question is, how does the greater community become aware of the kinds of services that BPS is providing for families? I mean, again, I know sometimes families themselves, will not ask, but if others know, can help, sort of help go with them to access services. And I know that a number of people are not at all aware of the amazing things that are going on here for Boston children.
Yeah, that's a good point. I mean, what we try to do is balance a very discreet approach and that network of school homeless liaisons and other staff at the school level help to engage families in a discreet way, in a sensitive way. But we also have a no wrong door approach. So if a family calls us directly, we're going to help them directly. If a school staff person calls us, great. If they email us, if they text us, we have the referral form online in the Aspen Student Information System. So and I didn't actually even touch on that this evening, anyone with student level access across the district can refer a student for services, and it's point and click. So that was another way that we actually boosted identification and made it really easy to connect families and students. But we do need to continue to increase awareness, and part of that is partnerships and forums like this to spread the word.
Thank you again, and thank you to your hardworking team. Good night.
All right, thank you.
Thank
Good
you.
night.
All right. Our next report is an update from the Office of Safety Services. At this time, I'd like to invite Neva Coakley-Grice, Interim Chief of Student Support, and Deputy Superintendent Sam DePina to please present their report. First, I'd like to invite Superintendent to give opening comments.
Thank you, Madam Chair. This is another area in which I am really proud of the work of the team and what they have accomplished, and that has gotten little attention. Our chief of police, who has now become chief of safety school officers, was hired back in 2020, I believe, if my memory is not so foggy. And, she went ahead and just started implementing more of a community policing model with our police officers, our school police officers, and then worked with me directly in order to get data privacy laws shifted within our school community, and also work alongside Superintendent Baston and the Boston BPD to begin to secure the data privacy provisions, implementation of that. And then as the state law changed in 2021 around school policing, really a seamless transition for our school police officers to school safety officers. Noted it was a little bumpy this fall, she'll talk about that. But I think, overall, it's been a really great way for us to work with our student body, work with our parents, work with our advocates around student safety and around the transition from our school police to school safety officers. And she'll go through some of that and all the incredible steps that she took to navigate that in a way that didn't make headlines, but still provided a significant service to our students and our teachers and educators in this really difficult time that we're in. So I'm going to turn it over to Deputy DePina and Chief Coakley-Grice.
Thank you, Superintendent. Good evening. Go ahead, Chief Coakley. I apologize.
That's okay. Good evening, everyone. Madam Chair, school committee members, Dr. Casillas, Assistant Superintendent Sam DePina, my executive team, and my safety team that's also here on the panel with me. I just want to start out by first just telling you that I would like to express how proud I am of our young people this evening, listening to them testify. Any opinions that say that BPS students aren't some of the best and brightest minds is truly false. Our kids are articulate, they've expressed intelligence, and very brave. These attributes inspire me, and it sustains my commitment to do better and to be the best it takes for all of our students, staff, and families. I'm Neva Coakley. I'm the Interim Chief of Student Support, and I'd like to show my support for Sam DePina. He's probably just gonna let me go, that's okay. And we're gonna present on the Boston Public School Safety Services. Department history. Formerly known as the Boston School Police, The Office of Safety Service has operated since 1974 with law enforcement jurisdiction on school properties. We're just going to wait for the slide to catch up. Just the next one. Go to the next slide. It's stuck? Okay, good, thank you. I'll go back over. Formerly known as the Boston School Police, the Office of Safety Service has operated since 1974. The law enforcement jurisdiction with law enforcement jurisdiction on school properties. The Department of Safety Service served as an alternative to the Boston Police Department's response to schools. As we dismantle structural barriers and provide a greater access to opportunities, we must consider a qualitative study on the school to prison pipeline. The school to prison pipeline was created by the implementation of federal zero-tolerance school discipline practices that began as a result of the Gun-Free School Act in 1994. The Gun-Free School Act of 1994 mandated all school districts who received federal funding to expel or suspend for at least 1 year any student who brought a weapon to school. The Gun-Free School Act of 1994 also forced school districts to implement policies that required referral to juvenile delinquency agencies for youth who possessed weapons in schools. The establishment of zero-tolerance school policies was a way for federal governments to introduce school police into schools. As we transitioned through the years, we found out that those policies really created excessiveness as far as prison to pipeline models for schools, in particular, a disparity between Black and brown students. Hence, the police reform implementation that has been in consideration for now at least a decade. And as of last September the 30th, 2020, it was enacted and signed by Governor Baker, enacted into effect July 1st, 2021. It's commonly called now the police reform. I'm going to go through just a snippet of some of the points that impacted safety service directly, but I did attach the complete bill on the left-hand side. The law included a grandfather provision to retain police powers specifically for law enforcement officers who have completed a municipal police training committee approved full-time police academy or training program. Another key point is additional mandate training is required for current and law enforcement officers. On March 17, 2021, the Peace Officer Standard Training Post Committee voted on and approved the following in-service topics for 2021 and 2022. This is important later on in my presentation. But responding to emergencies involving mental ill individuals, de-escalation and use of force, cultural competency in responding to mass gatherings, human trafficking, law enforcement officers' mental wellness, law enforcement officers' suicide prevention, and critical incident stress management and legal updates. But as safety services in the state reimagine our office, we adhere to some of the policies within the police reform, even though as a result of July 1st of 2021, Boston Police elected not to license officers under the Rule 400. So in essence, we were licensed as officers with police powers under Rule 400 by Boston Police Department. July 1st, they elected not to license Rule 400 office agencies, which not only impacted Boston Public Schools officers, but a number of different agencies within the Commonwealth of Massachusetts. Once we found out that information, and it even started prior to the actual timeline within July, we started engaging the community, really thinking on an equity, impactful amplifying of voices. So myself, as well as the staff, conducted extensive community engagement processes beginning as soon as June of 2020 to solicit input and ideas from a broad range of stakeholders on how we would reimagine safety services. Through the foresight and commitment of Dr. Casilius and at the former mayor, Janey, we talked about what the value of safety service was. And after engaging a number of these partners through community equity roundtables, we also met with the Special Education Parent Advisory Council. We met with the District English Learners Advisory Committee, the Citywide Parent Council, Boston Student Advisory Council, a BPS student focus group that I compiled myself, which consisted of retired judge, students, educators, and community members. We engage operational superintendent leaders and heads of schools, community-based advisory groups, Boston School Police Patrolmen's Union, and the Boston School Police Superior Federation, as well as the BPD Bureau of Community Engagement and the Municipal Police Training Council. Through those discussions and sessions and information sharing discussions, we came up with a reimagination. Safety services will serve as a valuable school community resource to students and staff with values committed to fostering positive relationships and developing strategies to engage problem solving, prevention, and partnership. What we will do as safety specialists, which is our new name, safety specialists had replaced the school police name and role. Our roles will serve as liaisons for the Office of Safety Services to school administration and the BPD and/or other law enforcement agencies as necessary, with specialty training to solve potential concerns and relay pertinent safety information in or around the school and to effect appropriate action when necessary. Safety service deployment overview. We're comprised of citywide mobile vehicles, mobile school-based vehicles, specialists assigned as safety specialists in our dispatch operations office, specialists assigned to 18 of the 29 high schools, and specialists assigned to 8 of the K-6 and K-8 schools. Now, these numbers are present, but throughout my presentation, you'll see how we're going to be increasing those numbers based on some hiring initiatives. No, back one, there you go. How we're going to do this. Under the direction of myself and the safety specialist team, we're going to collaborate with school administrations on designated safety teams, the staff to provide a safe and welcoming environment for school communities. Safety specialists serve as proactive links between students and other support staff and exercise appropriate safety and security procedures as necessary. Our specialists have redesigned uniforms consisting of a cargo pants
in signature polo shirts, which represents a professional image of engagement. And Madam Chair, we heard you as well. Our vehicles have been rebranded to focus on safety rather than policing. Next slide. Our team is comprised of, well, first, our safety and diversity and inclusion. Our FY 2021 budget for BPS Safety Services, $5.3 million. We represent 53% of safety service specialists represent as Black, African American. 27% represent as Latinx, Latino. 20% of safety specialists represent as white. 72% represent as male. And we're going to be adding 8 new hires as of hopefully in the next month, by February 1st. 28% are female, and we're adding an additional 6 new hires as of hopefully February as well. Bilingual staff include Haitian Creole, Spanish, and Portuguese speakers. As a result of the recent recruitment investments, 14 potential new hires will soon increase the percentages of female safety specialists, and we are committed to make affirmative efforts to increase the representation of specialists of color, particularly Asian Americans, and additional unrepresented demographics. I'd like to also add that we posted initially 10 positions. We got an astounding 25 candidates for those positions. And so the superintendent gave us an additional 10 positions to backfill. So we're still in the process of interviewing very prospective candidates. We've had a wealth of experience, knowledge, and community as a representation of the candidates applying for the positions. Next slide. As the superintendent mentioned, we really took at heart through all of that community engagement what the community wanted and how they wanted safety service to represent them as a contributing factor to our community. We looked at the data policy sharing policy, which was executed in 2020. As a result, only the chief and the deputy chief of safety services will share incident reports or other information with BPD through the BPD school police liaison. Our exceptions to that would be in a health or safety emergency when any safety services employee may share otherwise protected information externally in order to address the immediate emergency within the bounds of an exception. And that's a part of our superintendent's circular. An example of that would be if we had to transport a student to the hospital and an EMS would need that student's information. The other categories that we would be sharing information with myself and my deputy chief would be a missing child, a student in possession of a dangerous weapon at school, incident of bullying or retaliation when there is a reasonable basis to believe it is criminal, incidences of rape or sexual assault, incidents involving stalking or harassment or violations of a restraining order. So we windowed down that information sharing down to very, very specific categories. What we also looked at, next slide, please, is our report writing. So incidences in which we would write reports. As of July 1st, in losing our police powers, we also lost the access to Boston police reports or even to write those reports. So now we do not write Boston police reports and we don't have access to Boston police reports, either past or present. But we do have our internal
safety service reports, which we refer to as SSR1s. And these categories are the ones in which we use to document those reports. So safety services must adhere to the provisions of Massachusetts General Law 7137, which is all felony crimes. We have to write SSR1 reports, internal reports on. Non-felony crimes of assault and battery, hazing, those involving stalking behavior or sexual behavior, threats that could have caused a person to whom they were convened to fear that the speaker had both the intent and ability to carry them out. Possession of, possession with intent to distribute controlled substances as defined by Mass General Law 94C, other than possession of 2 ounces of less of marijuana, because those laws have changed. And so anything less than 2 ounces, we won't report on. Other than felony crimes where a victim or victim's parent or guardian request a report. A missing child, which will also include a BPD report. Sick injury assist, and medical evaluations or other medical emergencies. BPD also responds to medical emergencies, and also EMS is called. And when EMS is called, they respond with BPD and a 1-1 report is completed. So still a Boston Police report is produced when a medical emergency exists. Our commitment to engagement moving forward. What I wanted to express is that we have been very intentional about not just our inside within BPS district stakeholders, but also our community stakeholders. I came from an extensive background of community engagement, and that was my original intent, to bring that engagement platform to safety services. And through the bandwidth and foresight of Superintendent Casilius, she's still allowing us to work with our external partners as well as promoting that. As a result, we're still committed to working with the BU Women's Basketball Athletic Program. We had set up some police dialogues and which talked about relationships and community. We were going to do a day meal giveaway, and then the pandemic came. So we're going to be following up in that, hopefully during the spring. Basketball referee school for BPS students, we're looking at instituting that. We work closely with ROCA in their impact training. We're in the process of planning the Medicine Wheel Youth Dialogue, Healing Hands, and photo shoot, but unfortunately the COVID violations put that on hold. So we're looking at doing that after the spring. Women's safety initiatives, Girls Leaps, Big Sisters, Possibilities Here, Inc., Building Our Lives Together as One, Promoting Conflict Resolutions, Inc. All of these partners have joined in with us, and they're going to be our referral base as we look at more of a holistic discipline approach. A city council hearing on safety and facilities. These are some of the engagements that we will continue to do. BSAC Restorative Justice Partnership Training. We have several specialists that are in the process of completing that training, and we're elevating that training to train the trainers so we can assist the district in their capacity as trainers. Our safety care, train the trainer. We have trained 4 safety specialists at this point. During the February break, we're scheduled to train 20 more that will also be able to support the district in that capacity. And I've also been in in-depth conversations with Can We Talk, community conversations on trauma and healing, so that we can now begin to refer some of our families that are experiencing that to those conversations. And those conversations are led by Reverend Liz Walker and Colleen. So we're also working on that. We're hoping that that is set up by mid-February. The next
Our Director of Student Support and Opportunities is a contributing asset to our holistic approach of discipline as well. We have an assistant director that works with us. Currently, 41 students are supported by the Department of Youth Services. Consistent and collaborative communication between BPS and DYS, Department of Youth Services, through the Director of Student Support and Opportunities, allowing for a streamlined process of re-entry for the purpose of ensuring that BPS creates academic environments that are nurturing and promote forward academic progress. Also allows for academic monitoring while students are in DYS facilities. Collaboration for 120 students occur with DYS and SCDAO, DCF. So I'll just tell you what those acronyms are. The Suffolk County District Attorney's Office, and also the Department of Children's and Families. While meeting with SCDAO, DYS, Youth Connect, the Mayor's Office of Public Safety, Boston Children's Youth and Families, SOAR program, and YOU, who I'm a board member. I've been a board member now for 15 years. We closely case, manage, and identify youth and create supportive plans that provide wraparound services both in schools and in community-based settings. The purpose of these meetings is to ensure that students and families have access to proper resources, and collaboration is never a barrier for the purpose of supporting our youngest risk youth. Our next portion is going to be by Deputy Superintendent Sam DePina.
Thank you, Chief Coakley, and thank you and the team for getting us to where we are today with the Office of Safety Services. So I just want to just say again, thank you to you, the entire Office of Safety Services team, and all the union leadership for our collaboration and all the stakeholders and partners to date. One of the key changes that we also worked on with both reforms to Office of Safety Services as well as the Code of Conduct is really drawing a clear delineation of roles regarding the Code of Conduct and eliminating the role of officers, safety service officers, in participating in the Code of Conduct and shifting that responsibility to the school administration and school student support teams. So as you know, over the last 10 years, we've continued to update the Code of Conduct. Highlights of those include eliminating a lot of the zero tolerance policies that were in the code previously that Chief Coakley mentioned. And for this year's version of the code, we're happy to include the elimination of suspensions for students in grades K to 2, reducing the violations in which a student can be suspended in grades 3 to 5, and work to ensure that suspensions are a last resort whenever possible, in pivoting and using restorative practices. Next slide. Just to summarize real briefly, given the time, the new code addresses disproportionality of suspensions for Black and Latino students compared to other students by identifying the root causes of some of the dynamics that are happening in schools, with a focus on, supporting our adults and getting them the training that they need, and working on addressing and preventing disproportionality of suspensions, and really strengthening home and family partnerships with regard to incidents that are occurring in schools. And lastly, just looking at and implementing the revised multi-tier systems of support framework. Next slide. Just at a highlight of next steps with regard to the Code of Conduct, we're looking forward to the passage of the code by this committee. We're really going to shift our focus to the training of all stakeholders involved, including parents, students, and community members and school-based staff. Again, the focus of the trainings will be on root causes, really looking at dynamics broken down by race. We'll be updating the superintendent circular on the implementation of the code. So as you notice, the code is a lot smaller. It just contains information definitions, and then all the procedures are still laid out in Superintendent Circular 5. We'll need to update all the Code of Conduct attachments and translate them into the various languages. And again, we'll continue the quarterly reviews of the data, both with school leaders and central office staff and the Rethinking Discipline Committee. And obviously, we'll really pay attention to review the code of conduct ongoingly, as we've done over the years, and really utilize the racial equity planning tool and work with our Office of Strategy to do that with our stakeholders. Next slide. Again, this is the new vision for safety services team, and the new code of conduct represents the district commitment in partnering with students in their learning and creating the types of environments in schools where everyone's welcome, respected, and supported to succeed. And again, I just want to close by saying, I just want to thank Dr. Caselius and her leadership and support for this work, where districts across the country and state were closing and shutting down and eliminating safety service officers. We really pivoted and co-created a model with the community, and she fully funded and resourced it for us, and just want to thank her and her leadership for that as well. So I'll turn it back over to you.
Great. I want to thank you, Ms. Bryce and Mr. DePina, for your report and for the incredible work you and your team do day in and day out. Now I'll open it up to the committee for questions, comments. Mr. Tran?
Yes, I know it's late to the day, but first of all, thank you for your presentation, and the report is pretty thorough. But I know that we have been dealing with this issue for the last couple of years. I've been on the committee for 3 years, and this has been on with us for the last couple of years. I still have concerns, though. In order of priority, given that I have only 5 minutes, let's just cut to the chase and raise some serious questions. First of all, regarding the report, the SSR report. I understand that at some point after you wrote the report, you refer to BPD. The first question is, before writing the report, does a, what you call, safety specialist, one, investigate the incident, two, try to resolve the incident if possible by mediation or by other kind of restorative justice that had always been talked about for the last 10 years or so before writing the report. Three, in writing the report, I know that all the information submitted by the report are going to be objective, not subjective. But is there a recommendation to the BPD of the kind of action to take, or just leave it to the BPD to start its own investigation? So 3 questions compounded into one. First, is there an investigation before the report? And how thorough is that investigation? Second, is there any kind of restorative justice practice, such as mediation, performed prior to submitting the report, or any kind of resolution attempted before writing the report? And third, is there a recommendation in the report to the BPD as to the next step? Thank you.
Thank you so very much for your questions, Mr. Tran. Very good questions. Yes, to your first question, as far as investigation, I think what I did and my team did in really trying to calculate safety service, we tried to take out the best parts. And one of the best parts of safety service has been really our familiarization and relationship with the school community. And so our specialists are in the buildings and interact with students and staff. So when an incident occurs, they have the opportunity to be right on hands-on. And I think that in that relationship with administration, with the school staff, with students, really helps to give now. This is mostly for documentation. Now, just a documentation of the incident, just in case, say if there's a victim, say if this have to move forward with an investigation, we have documentation of that. So yes, it's really detailed, investigated, and only specific incidences related to that incident are documented as a result of that.
If I can also, I'm sorry, if I can add to, as far as the decision making on how to proceed, the safety service specialist consult with the school administration, and if it's a matter that can be resolved with the code of conduct, the school administration will then let the safety service specialist know that they'll proceed in that manner. However, when it rises to a certain level of crime, we do need to forward that along to Boston Police and provide them information and how to proceed, especially if there's a victim involved. Sorry, Chief, go ahead.
Nope, you're right, absolutely. And restorative justice practices, we're in the process of training as well with the rest of the district, and that's going to be our first line of defense with any type of, can you hear me? I'm sorry, with any type of discipline that has to go in line with the code of conduct. And for BPD, we are a work in progress with our partnership, but I was on a meeting earlier with Superintendent Bastian from the Bureau of Community Engagement, who also heads up our school police division, and she is very open and willing and supportive of what we're doing here at Safety Services. And we always look at if there has to be any kind of punitive discipline or reports from BPD, that's our last resort.
Okay, I know that my time is up, but I'll just add two more recommendations. As a matter of fact, not questions, because I'm telling you right now, ahead of time, the answers that you have given me is insufficient in my mind. I have to deal with student issue, especially in dealing with students of minority, Asians, or Black students who have different kind of issues that your security specialists need to be trained. I don't see a basic training recommended in the type of courses that you provided to the specialists, such as basic diversity training, such as how to understand other culture, other basic cultural issues, things of that nature. And lastly, I hope that given the fact that you have only a very limited number of translation and interpretation services up to this point, please make sure that other community, particularly Asians, are also included in there. Thank you.
Thank you, Mr. Tran. If I could just add, we can provide you a list of all the trainings that we do at the offices, if that's helpful.
Thank you. Dr. Alkins?
Yes, thank you for the presentation. It is great to see the notion of what a safety specialist is definitely transforming. So I guess one question is about, do you all feel that you will be developing, if you haven't already, a toolkit that will be able to go out to schools so that they can maybe create policies or just guidance on creating policies that they may not have thought of, but that's guided by your office? And then the second is along the lines of the cultural competency training that the safety specialists have received along with Black, Latinx students with disabilities. There's also a high intersection for LGBTQ plus populations. So I am curious as to how much of the cultural competency training also has that element in terms of support there.
No, thank you. Very good points. And you're right with the toolkit. I think that we started out with the information sharing policy and also the report writing policy, which is a part of us really being intentional about creating systemic platforms for particularly students of Black and Brown and Latino descent. As far as the training is concerned, we have done an extensive amount of training throughout the years. Now we just want to be really intentional how we look at the restorative justice training, the safety care training, which really focuses on de-escalation, communication training. And to be honest, a lot of my staff represents the demographics that they serve. I think I showed that within my presentation. So we're even working harder to go back to Mr. Tran's concern, to have a representation of the Asian background. And also we already have representation of LGBTQ representation. I didn't put that on there. I wanted to talk to my younger officers before I represented them like that. But we do have that. But I think our specialty training title is going to go with extensive training, particularly in trends and transformation as far as safety services are concerned. So we're looking at all of that moving forward. This transition too, just to understand, committee, we transitioned, we found out this within a year. So I think our priority really was the commitment to sustain safety service and transition into a model that the community, based on our engagement, wanted.
And I would just add that based on the feedback that we heard from the community, other areas of training that we're developing is around how to interact with students with disabilities, more so, especially nonverbal students, and then possibly understanding some signing as well. So the training is going to be continuously improved upon based on the feedback that we received. And also we'll continue to work with school leaders on how the interaction and the model is being rolled out, and make adjustments as we need to.
And those are some of the first two groups that we met with when we realized we had to make this transition.
Other questions? Mr. O'Neill, no. Ms. Polanco? See you, no. Only question, I know, given the lateness of the hour, I know people, there's a lot here to digest, and I hope to have a chance to take a closer look at the report. I'm sorry, our Ms. Mercer is unable to be here with the lateness of the hour, but she and I did have a brief conversation about this yesterday. I'm in preparation for this evening, and we were talking about, I asked her what she thought of the changes over the years around the difference between school police and now school safety officers. And then given the issues that have gone on in the Henderson in this past year, you know, how did she feel that that had been handled before and now after? And she was very positive with a lot of her conversation, except for the fact that felt that some of the officers present in a more gruff and a disinterested manner towards some students. And others are much more, you know, playful, collegial, you know, very much engaging. And the question is around the training and around the thoughts of officers, particularly given the change in their job description and role over the last year. How do they see themselves now interacting in schools with students?
A very good question, Madam Chair. Thank you for that. And we can definitely follow up anytime you want to, you know, have a discussion. We can just definitely sit down and talk about that. But I think one of the adverse consequences of the transition from policing label to safety model, we did lose a number of different police officers. You know, some of them came in after 30 years of being police officers, and that was their career. They elected to move on to other positions, which we totally respected. But as a result, as I mentioned, we put the specialist description out on the current job description, and 24 people applied for the position. So I think that's going to give us an opportunity to bring in individuals with a new imagined approach and concept into what we're doing presently. I can't,
speak on individuals' personality, but I can guarantee you that every one of my specialists have a great deal of respect and commitment for Boston Public Schools, and had it for, as I mentioned earlier, 40 decades. You know what I mean? So 4 decades, sorry. And that's what we're going to promote moving forward. Thank you. One last question. I'm very happy over the years of seeing the kinds of changes that have been made around, not disciplining very young children, with suspensions, et cetera. And I guess I'm looking for where within the curriculum are we helping students to learn what appropriate school behavior is, because often they are punished for discretions when in many homes and also in schools, particular kinds of behavior is not taught. So my question is, where do children learn what is expected before they're being held accountable for it? I think that would be probably a great point as well. I think my next part of the phase would be to get back into the presentations that we used to do in my former life, BPD. I did a number of presentations for school on social media. I did on the sexual assault stuff, and some of the partners that we're looking at during my presentation, they're going to help me with that, because, I always tell everyone, I'm the chief, but we have many leaders amongst us. And we're going to use the resources and skills that the community has, not just our BPS community, but also our community within the communities of Boston. So we have the Can We Talk presentations with Liz Walker, with Reverend Walker. We also have the Girls Leap projects, which deals with self-defense, not just the physical self-defense, but a mental self-defense. We're going to use them with that. And then to be out, not to be too long-winded, but even the number of individuals that we that are hired. We have some of the females that have run programs specifically dedicated to young females, younger children. We like to bring back our reading circles. We would like to bring back the Chief Corners with our book series. We like to do a lot of different things. This really opens us up to be really that specialist model that I talked about.
Ms. Robinson, I think it's also through our SelfCare office as well, and the health and wellness plans that we have through our schools, the responsive classroom, second step curriculum, the different programs that we do with positive behavior and anti-bullying. As you know, we do our 24/7 training that has won a national award that will be coming shortly here over the next couple of weeks. So, it's in multiple departments, and I really love the work that Chief Coakley is doing with her team around community activities and prevention activities with the students. But there is a social emotional wellness curriculum that we put out throughout the district. And I'm sure Dr. Eccleston would be glad to do a presentation to the school committee in the future regarding our activities around social emotional wellness.
Thank you.
And the BSAC has a code of conduct.
Right, BSAC, yes.
So app, it's the app. And I think, once we get this approved and voted on, we'll have them put a new app out for the rights and responsibilities for students.
Right. Wonderful. Thank you. We've done plenty of trainings on that. So there's some updated laws and juvenile laws, and I think that would be excellent. Know your rights presentation. Again, thank you. So if there are no further questions, the committee looks forward to taking action on the revised code of conduct at our next meeting. We'll now move on to public comment on reports. Ms. Sullivan.
Thank you, Chair. We have no speakers or public comment on reports.
Thank you. New business. No new business? Right. That concludes our business for this evening. The next remote school committee meeting will take place on Wednesday, January 26th at 5 p.m. If there's nothing further, I'll entertain a motion to adjourn.
So moved.
Thank you. Is there a second?
second.
Thank you. Any discussion or objection to the motion? Ms. Sullivan, will you please call the roll?
Dr. Alkins,
Yes.
Ms. Lopera, Ms. Polanco Garcia,
Yes.
Mr. Tran,
Yes.
Mr. O'Neill,
Yes.
Ms. Robinson.
Yes.
It's unanimous. Thank you.
Thank you and good night.
Good night.
Good night.
Good night, everyone.
Night, thank you.
Thank you.